Welcome to the Truth and Beauty e-Summit. My name's Jen, and I'll be today's MC. There's so much noise in the beauty space. Separating fact from fiction is legitimately difficult, especially when we have different experts saying different things. Who's trustworthy and on what types of topics? Is endocrine disruption in cosmetics something you need to be worried about? Can you really get a Botox like effect from your skincare? And are sunscreens responsible for coral bleaching? The Truth and Beauty e-Summit is my attempt to cut through the noise. Whoever you are, whether you're an industry veteran or an interested consumer, I promise you'll walk away with valuable insights. Thank you so much for joining us for this and for being a part of this conversation. The Truth and Beauty Summit is part of my greater free e-conference initiative to attempt to democratize accurate information in the beauty sector. From my experience, which I know is by no means unique, industry conferences often miss the mark when it comes to accessibility. With high registration prices plus travel costs to get to them, if you're not with a large enough company to bring you out, you're often left out, or you have to make a lot of sacrifices to make getting to the conferences work. With the current conference landscape, personally, I think it entrenches some industry knowledge disparities, where the big guys keep their insights in an ivory tower and the small guys have to grasp at straws to piece together fragmented information. This e-conference series is part of the puzzle in addressing that. My goal is to compete with the best quality conferences in industry, except make it all free and virtual, always with a replay. That way, whoever the audience is, whether from a conglomerate or a tiny brand, maybe you're even a consumer watching this, there will be nothing in your way other than maybe you and your time in accessing this. I would like to demonstrate to the rest of the industry the value accessibility brings to the equation. So far, I've hosted 9 e-summits on a variety of topics, from sunscreen to skincare, sustainability to formulation. All the replays can be found on my blog, those plus all my podcasts. If you're looking for some free professional development, this would probably be a good place to start. My summit sponsors are a big reason why these e-summits have been able to continue and ramp up. I now host 4 per year. A big thank you to the Truth and Beauty e-Summit sponsors for helping make this event possible. Thank you to our silver sponsor, NYSEC, bronze sponsors, BASF and L'Oreal, general sponsor, Salabia plus Applechem, and our media partner, Cosmetics and Toiletries, who will help give the insights from this event a greater platform. Cosmetics and Toiletries is the definitive peer-reviewed resource for cosmetic science, and much of their content is freely available as well. If you're interested in cosmetic science, they're an excellent resource. You can find a link to subscribe to their newsletter on the Truth and Beauty replay page. If you're a company wanting to work with us for a future e-summit, please reach out directly. Another big reason I've been able to keep these e-summits free are all the subject matter experts who've agreed to donate their time and expertise to help me realize the goal of information accessibility. We've got a phenomenal lineup of presentations with some of my favorite voices globally to do the topics justice. A massive thank you to all of our speakers today for being here to share their knowledge. We've got a big day planned with a lot of ground to cover. We'll start the day with a series of fact versus myths presentations, followed by presentations on the impact of misinformation, then on critically navigating research, finishing the day with conversations about the need and opportunities for science communication. As part of that final conversation, I'm also really excited to share a Scicomm initiative Michelle Wong from LabMuff and Beauty Science and I have launched through our side social enterprise, BeautySciComm, a company dedicated to increasing the quality, volume, and reach of accurate information, which is a Scicomm contest. Over the last 2 months, we've been gathering entries from prospective Scicommers. The prizes are all things we thought would help get them on their feet, from cash prizes and mentorship to memberships and helpful associations to help them train up. Big thank you to Cosmetics and Toiletries, Society of Cosmetic Chemists, and the Independent Beauty Association for partnering with us on this. We'll be announcing the Scicomm contest winners and sharing the winning reels at lunchtime. A massive thank you to Nawal at Derm Element for being the brainchild behind this initiative and for doing all the legwork to get it off the ground. Some housekeeping before we get started. There will be live Q&A for most of the presentations, so ask your questions in the live chat of the YouTube stream. Don't wait to ask your questions. I'll be monitoring the chat and I'll ask questions who come first during the Q&A time that's going to happen after each of the presentations. As mentioned, yes, there will be a replay of this eSummit. Expect to get it in your email shortly after the event. And before I leave you with the event, I have 2 asks for you. First, I'll be sending out a short feedback survey with the replay. It'll take about a minute of your time and will be really helpful for me in continuing to make these events better for the future. In the second and final request, if you want to see more truth and beauty and you value this free e-conference initiative, please share. Share the link to the stream you're watching, maybe some things that you're learning throughout the day, and be sure to tag us at the EcoWell. And that's all I've got. Thank you so much for joining us for the Truth and Beauty eSummit. I hope you learn a lot and enjoy the day. To start the day, the first presentation will be by Dr. Ann Chappelle and Dr. Lisa Navarro on safety, separating fact from fiction. Without further ado, let's get this summit started. Our first presentation will be by Dr. Lisa Navarro and Dr. Ann Chappelle. Lisa has over 20 years of experience in product safety, compliance, and regulatory affairs. She's a trusted advisor and leader in her field. Lisa provides strategic guidance for the approval and ongoing stewardship of consumer goods across the globe, such as food, cosmetics, medical devices, and agrochemicals. Certified by the American Board of Toxicology and the European Registry of Toxicologists, Lisa has a proven track record of managing complex and diverse product safety issues, public speaking, and professional engagements. Lisa is currently a principal at Ramble, a global engineering, design, and consulting company where she works with clients to ensure their products meet the highest standard of quality, safety, and sustainability. Lisa is also an adjunct instructor at Cincinnati State, where she teaches food policy, regulations, and compliance. Lisa is passionate about bridging the gap between commercial and scientific needs and empowering her team, customers, and partners with sound decision making and credible data. Anne has over 25 years of evaluating complex environmental health and safety issues and developing solutions and programs. Anne has extensive experience in generating and evaluating toxicological and exposure data to be used in the risk assessment of chemicals, pharmaceuticals, consumer products, and cosmetics. She develops and sustains strong and influential relationships with clients and is able to expertly navigate and balance commercial and scientific needs in key product areas. Anne is on the board of the Toxicology Education Foundation, is an associate editor of Toxicology and Industrial Health, and is the co-host of the Society of Toxicology podcast, Adverse Reactions. She is very proud of being featured by Wired Magazine as the toxicologist who answers poison questions on Twitter, with over 7 million views. Without further ado, here's their presentation.
Hi, Lisa Navarro from Ramball US Consulting.
Hi, Ann Chappelle from Safe Bridge Consultants. How are you today?
I am really excited to talk to our audience, but it's weird just to be talking to the two of us. We represent the Toxicology Education Foundation, TEF. It is an organization whose mission is to promote the education of the general public about issues in toxicology. Both Lisa and I serve on the board, and we were asked today to talk a little bit about toxicology and safety and assessing cosmetics. And so that's what we're here to talk to you about.
I'm going to jump to the second slide. And let's talk about what is the role of toxicology in beauty. I think we probably all know that the skin is our largest exposed surface area of the body. It serves to protect us. It acts as a barrier against germs, particles, and more. And part of the role of the skin when it's not functioning as a barrier, some things may be absorbed. So trying to understand the dynamics between what your skin can protect you against and what might penetrate the skin or pass through and be absorbed into your body is part of the role of understanding the product safety and the concept of toxicology and beauty.
Exactly. So when we think about toxicology studies, a lot of the studies you see listed on this wheel are ones that we would do not only for a cosmetic ingredient, but we might also do for a component of jet fuel or a pharmaceutical. So when you're looking at all of these studies, and Lisa and I regularly do for different endpoints for clients, we really have to think of how was that chemical administered to that person? Is it actually going to get through all the layers of the skin? Is it going to sit there? If it's administered with another substance, does that help it get through the skin even faster? So you will find for cosmetics that, and across the whole gamut that you might use, you're going to have a lot of different amounts of data that are available. So you're not going to have a carcinogenicity study on every single ingredient that might be in your particular cosmetic. And that's for a lot of different reasons. Could be that the ingredient has had a long history of safe use. It could just be that nobody has decided to spend the money yet.
And so when you're looking at the data that might be available versus the data that is often not available, you might wonder, why is this the case? Well, in the last short recent history, we've had a lot of activity in which countries have banned the testing of cosmetic ingredients specifically. And so when you're trying to determine and make a safety assessment for a particular product, and you don't have the historically designed, and you're now having to rely on non-animal methods, this can present some interesting challenges for doing those types of safety assessments. Most studies are done on single substances. Most studies are run at very high concentrations. And it's been, well, Anne, has it been more than 10 years since we've had the initial bans on cosmetic animal testing? So maybe we're 10 years out with a lot of development and novel innovation in the cosmetic space, but with a lot of limitations on the types of studies that can be done to demonstrate safety for these ingredients.
Yeah. Fundamentally, I am all for minimizing or eliminating animal testing. A lot of pressure has come from the market. You've seen different beauty brands say, we do not test our ingredients on animals. And I think that in general can be really fantastic, but there's a certain limitation that comes with that. The ban on animal testing has started in Europe. It hasn't officially come to the US yet. They're making plans to limit this in the US, but I would say that a lot of the market pressures have already eliminated that for personal care products.
Right. And the reason why you might see a lot of that limitation is most of the major personal care product manufacturers are global. And so where they may be developing a product in one country, they're going to comply with the most restrictive requirements from a global perspective. They're not going to run animal studies just in a country where they can, because certainly, like the way the European regulations are written, if you run a study in another country and it was intended for safety support of a cosmetic, you won't be able to navigate through the European regulations. Now, granted, there are still ingredients that have multi-uses, and so you may have a cosmetic ingredient that was developed for some other industrial use. There may be safety data on it that can be therefore used to substantiate or support submission in another country that's already got an animal testing ban.
Right. Sometimes the route of exposure is really important. You may have studies that were done with having rats breathe a substance for 28 days or 100 days. If you would think of something really volatile, like maybe a fragrance, but that doesn't help you necessarily if you're putting it on your skin. So there's a lot of data out there, and it takes professionals to really look and see, is that data appropriate for that intended use of that product?
We've talked just a little bit about maybe some of the challenges associated with the access to safety data and the types of data that might historically be available. Something that's happened just within the last 2 years has been the development of MOCRA. And so MOCRA is the modernization of cosmetics regulatory approaches. It's a new regulation. There's different elements of it that have come into activity, and there's still some elements that are trailing enforcement. Right now, the first stages do require safety assessments. In the US, companies are required to have in-house safety assessments for any components going into their cosmetic products. In Europe, these safety assessments have to be submitted to an authority for peer review. And that brings me to this article that Anne found is fantastic. It points out 40 key differences between the EU and US approaches to the regulation of personal care products. We listed a few of our favorites here, but we encourage you to take a look at this article and read all of the differences. MOCRA is really designed in a way that's almost a me too to the EU regulations, but there are some differences. So we do see animal testing discussed in the MOCRA regulation as something that the US would support stepping away from for cosmetic products, but it's not at this time promulgating a ban. In the US, cosmetic ingredients currently can be manufactured under CGMP voluntarily, but as MOCRA goes into effect, those CGMP requirements, so that's good manufacturing practices, will become enforced. Some of the cosmetic companies are already seeing preliminary audits from the FDA where they're coming in to take a look at how they're manufacturing their cosmetic ingredients. So that will go a long ways for supporting, good manufacturing practices. The US is also supposed to list an allergen. The intent is to adopt initially the dermal allergen list from Europe. And then also the US has actually promulgated the adverse event reporting requirements for cosmetic products. And so we're seeing for the first time in, I don't know, when 21 CFR was originally written back in the 50s, finally some regulations around cosmetics and their ingredients in the US. So this has been a long time in the making, and it's certainly a welcomed change to the cosmetic industry. Anne, did you want to add something to this?
I did. I came from mostly a chemical industry, industrial chemical background. And the European Union for over 20 years has really led the way in doing these kinds of risk assessments and saying, what is the product? What is the consumer getting? And is there enough data for these intended uses? And you'll hear Lisa and I talk a lot about intended use of a particular chemical, because that's a really important concept. So it is natural that the EU was ahead of the US when it came to cosmetics and other personal care products versus the US, because we've been trailing for some times in making sure that all the substances that are out there have enough data and have had a risk assessment for those particular uses.
I know a lot of us are excited about MOCRA, but I think if you're in the cosmetic business, you might have some consternation as well about MOCRA and what that it might mean for your cosmetics business or your personal care product, and as you navigate these new regulations within the industry. And so this is just a quick little flow chart. We won't read through all the details, but in the large box on the right is the highlights, the mandatory adverse event reporting, the good manufacturing practices that we've talked about, mandatory facility registration, so that's a new one, mandatory product listing, so that's registering your product with the FDA, the product substantiation, safety substantiation, of course, those are in-house documents. But where enforcement will become interesting is once the CGMPs are in place, the FDA routinely will use their powers to come by and do an audit of manufacturing facilities. And once they're on site to do a CGMP audit, they can ask for access to your product safety substantiation records, which are required to be in place for all of the components that are going into your cosmetic. So we will see over time as the agency ramps up its audit enforcements that there'll be probably some additional requirements around product safety substantiation that follow. There's going to be new product labeling standards. Of course, FDA will have access to business records, and then a new FDA mandated recall process will go into play. So some of these are heavy lifting tasks for the cosmetic industry. And if you're a domestic manufacturer, and this is newer for you, where if you've been on the international market, some of these requirements have been in place for quite some time.
I was at a meeting earlier this year, and the director of the FDA, they're talking about MOCRA, and they recognize that they need to have a lot of tools out there for manufacturers in the US that don't necessarily have a deep bench when it comes to safety assessment or CGMP or the processes in place to be able to do that. So they are working on having guidance documents out there and assistance. Overall, if you're not a manufacturer, you're just a user. So what does this mean for a US cosmetic versus an EU cosmetic? Well, we've talked about this offline. If it is a global company, you probably wouldn't see much of a difference. The difference is really going to be in cosmetics that are manufactured solely here in the United States.
I know there's a lot of interest around like should be in your personal care product or what they're made with or what might migrate in from the packaging materials. But in general, a personal care product should be a product that has demonstrated activity, right? We're all using these use a deodorant for a reason. We use a moisturizer for a reason. We use a shampoo for a reason. And so all of those reasons are have demonstrated, efficacy for their intended uses. And then, of course, the ingredients that go into those products should have safety evaluations for their intended conditions of use. And most cosmetics do have some level of safety data dossier to support their uses. And we would expect that most personal care products have preservation systems. And I know that preservatives can be a point of maybe debate. But think about environment of most of our bathrooms in our homes. It's probably like the most damp location in the house. So if you have your personal care products stored in your bathrooms or inside of your showers, and they don't have a preservation system, think of how like moldy or gross they could get so quickly.
Wash your brushes. Don't keep your mascara for 4 years because again, you've got these opportunities for mold, bacteria, fungi to get into your products. So one of the differences between the US and EU system is that they want on US products to have a use by date, or after you open it, you can use this for so many months or weeks or years, whatever it happens to be, because having these issues around product contamination, that is something that can really cause a problem.
Yeah, I just think I'm sure I do. I go through my drawers in my bathroom probably every 6 months because I have a tendency to collect a sample of this and a sample of that, and you use it once or twice, and then in the drawer it goes, and who knows how kind of it might be after a few months.
Right.
And so
Or
try not to use those.
how much of a magnifying glass I need to get to actually see those dates. So we're not necessarily advocating that everything has a preservation system. However, if it does have a preservation system, that does not mean it's bad. It's meant to protect you and increase the shelf life.
So what are some of the most important things that you should know about your personal care products and how you should approach, when you're making your purchases? First and foremost, always read the label, understand the application and use instructions. Is this intended for use, near the eye or not? Is this a rinse off or leave on product? Are the applications, do not apply to broken skin, for example.
Right.
Take a look at what the label says and follow the instructions. And then read the ingredient list. I know they're very scientific and they can be a mouthful to try and even pronounce some of the words. But take the time, become familiar with ingredients in your cosmetic products. So you're familiar with the names, and then research the company of your favorite brands. Is this a multinational company with a solid reputation, or is this something that made in Susie's garage and she's selling it online, right? So there's the
company, understand what they put on their website. You may have more trust for a multinational large company versus, as she was saying, somebody who made something in their garage. So I'm not saying that's bad. I'm just saying that you need to do your research. And if you have questions, there are places to go for information. It is not necessarily just Facebook. You've got to really see where all this information is coming from. So we went out and started looking for places that if we had questions, where you might go to look. And so we did some Google searching. We want to highlight a couple of ones for you.
Two are supported by or funded by the Personal Care Products Council. This is an industry trade association. And so their kind of consumer-facing platform is this one called cosmeticsinfo.org. And so here you can go and read about than 2,000 different cosmetic ingredients. And a lot of those cosmetic ingredients are actually by their sister kind of organization, which is an independent peer review council called the Cosmetic Ingredient Review. And so this also has a separate website where you can go and read about the individual chemistries and the publications in peer-reviewed literature.
The nice thing about, though, if we go back for a second, Lisa, the idea, though, again, is that for that anticipated use, like you may have something that is an irritant, a severe irritant, but that's at a concentrated form. At a lower dose, it may not be an irritant. Well, what concentrations was it being used at, and have they evaluated those concentrations for adverse effects? So the CIR is a really good resource. It's really technical, but it's that for that anticipated use and concentration.
And then moving on, we have another website funded by the Breast Cancer Prevention Partners. This is safecosmetics.org. And then
well, if we go back for just a second, I just want to add that because this is funded by the Breast Cancer Prevention Partners, they're really sensitive to the idea that could these substances or a combination of substances result in breast cancer. So this is a woman-focused website. So again, when you're looking at these sites, look who funds them and an idea of why that they are telling you about these ingredients.
And to the same extent, then there's another group website that's sponsored by the Environmental Working Group. This one is called Skin Deep, and they have 114,000 products that have been reviewed, and they have a verification process that they use based on kind of point of view that they're bringing to the table.
In my experience, EWG can be a little biased, but again, compare what they say on these different websites for an ingredient that you are interested in, and then use that information to help form your opinion, or take that question back to the company and say, I don't understand the data on this.
And then the last one that we found, of course, is what will become a stronger growing website over time, but the FDA's MOCR website. We mentioned this at the beginning of the session. We talked about how MOCR is relatively new. I think the regulation was published at the end of December of 2022. And so we had
government speak, this is moving pretty fast for the government. They know that they need to have a lot more guidance documents and helping people to set up the framework, because some people don't even have the electronic framework to collect all the adverse information. So it's a lofty goal, it's a worthy goal, and we strongly support what the FDA is trying to do. It's just going to take a little bit of time.
And I wanted to just add there too, is that it was very supportive of MOCRA. Sure that everybody, one participant in the personal care products industry is not upholding the quality and safety for their products, they affect the entire industry. And so by having a regulatory framework, this was something that was widely supported by the cosmetics industry. And so it's refreshing to see that it's finally here. It's moving as quickly as it can, but it's something that's going to make changes for the cosmetic industry in the U.S. going forward.
Right.
And then this brings us back to the agenda for the rest of the sessions. So there's a lot of material being covered. Hopefully you have time to listen to all of the speakers.
So, it's been a real pleasure to have this forum to talk about toxicology and beauty products. And I think we want to stress that there is no one right answer or one perfect combination. And with everything that we do, there's always a certain amount of inherent risk. And it is being able to have the information that you need to make an informed choice. And if you don't know what the ingredients are, if there has been no testing on those ingredients, it's very difficult to make a good decision. So I think we're going to have a Q&A session after this.
Yes, it should be right after this.
So get your questions ready, everyone.
And we are just about ready to go live with the Q&A. And here we are. Thank you so much, Anne and Lisa, for agreeing to give this presentation. So I will ask a question that came in earlier. Can you speak to the safety considerations on natural ingredients as well?
So hang on, I'm having audio issues with Zoom. Hang on.
I can hear you perfectly, just so you know.
Yeah, but it's not. So just give me a second because Zoom always messes up my computer.
And
And
Anne,
I
I
can't hear
cannot
Anne
hear
at all.
you. You may want to check your settings.
How about now? Can you hear
I can
me?
hear you perfectly.
Okay, perfect. Well, thank you, Jen, for letting Lisa and I come and speak with you guys today. When we say a natural product, I mean, are we talking oil bubbling out of the ground? Are we talking clay that you scoop up from the bottom of the Red Sea? I mean, there's a lot of natural products. So it's hard to define anything that has a CAS number that can be individually identified. Any of those should be assessed to some point, and it's just really from my perspective. Has it been used in commerce for a long time? Does it have other uses? Because if it is solely for a cosmetic, it probably doesn't have the same toxicological database and information on it than if it had been used for other things.
And now I have seen a few comments in the chat. I think maybe a misinterpretation for what you guys were saying about the EWG, where people are like, hey, I heard that EWG was unreliable. What do you mean? I believe the context was be critical of your information sources. Was that your take home?
Absolutely.
Yes.
Okay. Another question came in from Andrea, who asks, I would like to hear more about Anne and Lisa's thoughts about the notion that the public should be trying to do their own research when data suggests this actually might lead to misinformation and chemophobia. It's so hard to do your own research. Oftentimes, you end up just confirming your own biases. And that's something that's going to come up time and time again throughout this presentation. And Google really does have a way of confirming biases depending on what you're searching and what you receive. Obviously, as you had highlighted, critically navigating the research, including if you see EWG, questioning the profit incentive is important. But what's your take on this?
Well, certainly I think, using reputable resources, right? Google is probably not your best first place to go other than looking for different websites, as we kind of pointed out, that you definitely have to validate the source of your information. But I wanted to skip back a little bit to your natural question too. And also point out that there's a difference between nature identical and synthetic. So when somebody's looking for something that's natural, natural doesn't mean necessarily better. You can have the same molecule manufactured synthetically, and often it's will have a higher standard of purity because it is made through production processes. So you can control for impurities that you can't control for in a natural, truly natural, like extracted, like a botanical extracted material. And just keep in mind, poison ivy is all natural.
True. It's true.
And I would say for finding who is reputable can be challenging with all the noise online, but perhaps some of the speakers here could be a good place to start because all of them are doing phenomenal work in all of their respective fields. We had another question from Patricia who asks, what do you think about apps like Ooka or similar, like Think Dirty? What's your take on these? Are these helpful?
I'm not even familiar with the app. I have
Yeah.
never heard of it.
Well,
What'd you
okay.
call it?
So
Yucca? Yucca?
Yucca. So the idea is they take hazard assessments and then say that ingredients are unsafe to be in products. So they say, based off of probably outlier data, oftentimes they're just regurgitating references from EWG. They say that, for example, parabens in cosmetics renders these products unsafe. It's the same kind of thing from app to app to app. I find that they're all kind of iterations from EWG information. And so when an app is saying that a product is unsafe because of the individual constituents, such as parabens, or sodium lauryl sulfate, or whatever other ingredient, would that app be something that's reputable?
Well, certainly can't speak to the content of the apps, but you have to keep in mind that the apps were probably pulling in only the data they want to include. So if it's giving biased answers or generic answers on any chemical substance, but basing that on maybe the neat chemical versus the chemical under conditions of use. And
Right.
so you always need to think about it's the dose that makes the poison. I know it sounds like a toxicology cliche, but it is at the heart of everything. I mean, you can think about anything that, you know, that we're
Sugar,
exposed to. Yes, everything.
water, all kinds of things. I agree that there is a problem with really finding a good source of information. And I'm glad, Jen, that you really pointed out the multiple sources that you can get. Again, the cosmetic ingredient review is very, very good. And for many of these products that we're talking about, a lot of the data is really focused on, is it a skin irritant or not? Is it can it even get through the skin? Um, does it cause, you might have some sensitization data, you might have some long-term data, but for so many of these chemicals that are out there, there just isn't a lot of data. And without, some of these high throughput screens that can test different endpoints for you and start to gather these kinds of databases for you that you can pull from, it's really it can be very difficult. Again, what Lisa was talking about before about a natural versus a natural synthetic, that is really really a critical point, because so many times, and you'll see this, and I'll use the example of marijuana, that there's all these different strengths, there's all of these different potencies, there's all of these different essential oils and components within these different strains. And so if you use a natural chamomile product, it's going to have a lot more variance depending on where it was grown, what the strain of the material, the genus, the species, and that can have a huge impact on its functional output and how it's being used within a specific cosmetic ingredient.
That's really good context. And I think that this is all the time we have for this Q&A. I just wanted to point my audience to a really great resource from Procter and Gamble. They published a white paper on substantiating safety for natural ingredients, or it may have been specific, like they may have said botanicals, but it was excellent. Lots of context for the safety substantiation methods potentially required, as well as some of the concerns for natural botanicals on the market today. But thank you so much to Anne and Lisa for agreeing to share your knowledge with our audience. And yeah, this was a great presentation.
Can I just add just two quick things? One is that Lisa and I are out there on LinkedIn. So if you have other questions, put them in the chat, or reach out to us and we'll see how we can address some of your questions or concerns. And so that's what I just wanted to add.
Awesome. Thank you so much to Anne and Lisa.
Thanks. Bye.
Slightly odd to introduce myself, but I'm Jen. I'm a cosmetic scientist, science communicator, and founder here at the EcoWell. I started my career as a formulator and science writer and transitioned to technical consulting, sustainability substantiation, and science communication. I host these free e-conferences, also a weekly podcast where I highlight interdisciplinary scientists about all things cosmetics. Stay tuned, the podcast is coming out hopefully this coming week. I hold 2 Bachelor's of Science degrees, a diploma in formulation chemistry, a grad certificate in the policy of climate change, and a Master's of Science in environmental sciences, which I focused on chemical management in cosmetics. I was at that time looking at misinformation through the legislative lens, and now I'm doing a PhD at the University of Ottawa where I'm looking at how misinformation is impacting sustainability in cosmetics, looking at it more from consumer perception and business decision point of view. I'm also a co-founder of the Scicomm social enterprise, BeautySciComm. Without further ado, here's my presentation. Hello again, I'm Jen. You probably know me by now. I'm hosting this summit. I'm the founder at the EcoWell, and my background is actually in environmental impact, specifically misinformation. So I'm really excited to be covering this presentation, Environmental Impact, Separating Fact from Fiction. Throughout this presentation, I'm going to go through some common misconceptions, take you through how I like to think about it, and then finish with some of the impacts that I think there may be. Future research is needed, and hopefully I'll fill that gap. The impacts of misinformation on environmental outcomes. I'll get right to it with the first misconception that I commonly hear is this idea that ingredient lists tell you whether or not a product is more or less environmentally friendly. This is something that's perpetuated by a lot of eco standards. You see the Planet Aware at Sephora stipulating there's certain ingredients they allow. To the right, we've got David Suzuki's Dirty Dozen. David Suzuki himself is a Canadian treasure as a science communicator, but his organization has put out some questionable information, and this is one example. So to start to think about the formulation environmental impact, you have to know a little bit about its life cycle. And that life cycle starts with ingredient feedstock sourcing. So what's the harvesting scenario with that feedstock? Is it, for example, wild harvested? Little known fact, many of the extracts in the cosmetic sector are wild harvested, and we know that to be a pretty significant threat generally for biodiversity. It's generally better to cultivate. So is that part of the supply chain? Is there food competition? We know that the greatest threat for biodiversity is the expansion of agriculture. We also know that we're struggling real hard to feed the growing population that we have. If we're producing feedstock material for the sole purpose of producing cosmetic ingredients, maybe there's an issue there. Is it bio-based? Note, just because it's bio-based doesn't necessarily mean it's better. For example, with Simrise's menthol, that has about 100 times lower of a carbon dioxide output compared to the natural source. You probably want metrics to understand whether or not the bio-based or not will be a better or worse option. That's going to shift as we move away from petrol, and that's a huge conversation, but I'm going to leave it there. Then we get to the ingredient manufacturing. Are economies of scale on your side? Are there efficiencies in extraction and production? So a good example of this is with surfactants. Commonly, you'll hear that SLS is not the eco-friendly option. There's other eco-friendly alternatives. SLS is actually produced in a continuous production pathway because it has the economies of scale on its side to do this. And so like a sausage, it's produced. Compare and contrast to many of its alternatives, they're produced by batch manufacturing. And so that involves starting and stopping the production. And with each start and stop, that's going to increase the waste and energy requirements. And then also there may even be transportation from different facilities. Is there waste production with ingredient? For example, if you're producing an extract that you then after have to clean up all of this extra muck, what's the scenario like? Then we get to the formulation aspect, which I don't have a slide for this, but certain ingredients will contribute more or less to the environmental impact of a formula. So in the context of an emulsion, a leave-on emulsion, the emollients actually are the greatest contributor to their impact. Commonly, I've heard people talk about waterless equals more environmentally friendly. But if you're making, for example, say, water-containing lotion versus you're going to go and just put a bunch of oil and then say that this liquid oil product has a net benefit, is it? Then we get to product manufacturing. Are efficiencies of scale on your side? So we talked about this a little bit already. As you have more scale, then you can be more efficient with, for example, that continuous manufacturing method up to a certain point. So is there efficiencies in production? Oftentimes that comes with economies of scale. That may also come with, for example, the processing methods, for example, hot processing methods versus cold for the formulation. Is there waste production? So for indie brands commonly who order ingredients that have very high MOQs, minimum order quantities, but are used in a rather low amount, when they're only manufacturing in small runs, they may have excess of that ingredient that they're not able to go through. Are they able to get through it within the expiration of that ingredient? And if not, what's that scenario like? Then we get to consumer use. For many product types, this is actually the most impactful part of the life cycle, specifically with water and energy use as one example for wash-off products. So if a product requires more water and heat for the water to wash that off, well, that is actually going to increase the impact. What's the product waste scenario like? If companies have a sustainability initiative, what's the accessibility like? For example, companies have refill stations, maybe even it's a refillery company itself. Say I'm in Lions Head 3 hours away from a city that may have that service. How likely am I to go access that in the future? Another thing that I've seen with companies is they'll have cartridge refill systems that are thicker, and so they require a certain amount of consumer use to actually see a net benefit environmental outcome. Is a consumer likely to actually continue with that refill system with this product? Because if not, that product itself without that uptake may actually have a larger environmental impact. And then we get to the end of life. Are the ingredients biodegradable, persistent in the environment, not toxic to aquatic life? To quote Scott Belanger, who is a fellow at CTAC, ingredient lists, even when accompanied by percentage in a formula, can never tell the true story of how each ingredient enters the environment after going down the drain. Different fate properties, sorption, biodegradation, volatilization, etc., will dictate where and how much will be released. Then, when we layer on the potential ecotoxicity, will we gauge the true potential for not the actual impact. So to answer the question, do ingredient lists tell you about a product's environmental impact? The answer is no. Do 88% of cosmetics have microplastics? This is something that I saw from Formula Botanica. I've certainly seen other sources say this, but I was struck by Formula Botanica because they're purportedly a school for cosmetic science, so you would think that they would know a little bit about this. So let's check in. Where did they come up with this number? Their source for the stat is the Plastic Soup Foundation. The percentage here is from all possible synthetic polymers, whether added in solid, liquid, semi-liquid, or water-soluble forms. And so they surveyed a bunch of products, and that was their stipulation. So quick to source reach for definitions. Disclaimer, definition commonality continues to be an issue, but the thing that is consistent is, well, the materials are synthetic for one, but small, solid, not water soluble, and persistent. Coming back to what the Plastic Soup Foundation says, liquid, water soluble, those are fundamentally not microplastics. So when you go and include a bunch of ingredients that are not microplastics in your stipulation, well, yeah, you're going to find a whole bunch of microplastics, but those are not microplastics. As one example within their report, they highlight Nivea and a couple of examples here for red ingredients. Carbomer, that's a water-soluble gelling agent. And they also have a bunch of PEG ingredients. Those are all water-soluble, fundamentally not microplastic. And disclaimer, inkies, the ingredients on an ingredient list, also don't tell you about the physical properties. So it's hard for you to know whether or not these materials are solid. A good example of this is polyethylene, where you would think that polyethylene equals microbeads, except microbeads have largely been phased out since the Microbead Free Water Act in the early 2010s. If you're looking at a liquid polyethylene, that's actually not a microplastic within common definitions. Continuing on from Formula Botanica, within that same post, they were using it to highlight a course that they'll give you for free. They highlight this idea that DIY beauty is better for the environment. You as a formulator at home, you're going to have to be ordering a bunch of small little ingredient packages. It's all going to be shipped to you, and then you're going to be making it. In what world are you going to have better efficiency than somebody who is ordering large MOQs of ingredients and have efficient manufacturing methods? That's not how any of this works. Probably worth questioning. Is there a conflict of interest here? Do sunscreens contribute to coral bleaching? You'll see this idea all over the press. Here are two headlines from or contributed to by the Environmental Working Group. The overwhelming evidence does not support the idea that sunscreen filters of any type are negatively affecting coral in nature. And under the same extreme conditions used to demonstrate that the banned organic filters cause coral bleaching, so does zinc oxide. So the ingredients that are actually allowed under the Hawaii bans, if you're, I'm sure, familiar with it. Sunscreen is not the issue here. It's climate change. Why do so many people believe chemical filters bleach coral? This comes down to, a few people, but really one person, Craig Downs, who's been the major driver behind these bans based on his 2016 study, where he used an extreme exposure scenario to conclude that sunscreens cause coral bleaching. And then he went on to talk about it with media at conferences. So his exposure scenario to demonstrate that there was coral bleaching was an outlier from the body of evidence. For example, he assumed that there was more oxybenzone in the water column close to the reef than the total carbon content. Oxybenzone is a carbon-based filter that fundamentally doesn't make sense. So there are a few red flags here. One being the recent ACS publication he did in 2021, where he cited various propaganda sources, including your favorite propagandist, Michelle Wong, cited twice out of the 3 propaganda sources. He's essentially just like going after people that disagree with him and then saying they're industry shills. This is something that Michelle Wong actually responded to on her blog. And she highlighted something that Craig Downs said, which was interesting, maybe another red flag, because it's his professional opinion that most of the coral reefs in the last 40 years have died because of your bathroom than anything else. Climate change, oil spills, what have you. Downs' lab runs a program that's a lot like EWG approved label, where they'll certify that your sunscreens are reef safe with their own unofficial procedure. So maybe there's a conflict of interest there. Are mineral sunscreens more eco-friendly? So this is another common idea, and I think it may stem from the coral bleaching misconceptions. As you see with the Planet Aware at Sephora standard, they say that there can't be any chemical UV filters, and by chemical we mean organic-based carbon-containing UV filters rather than inorganic mineral filters, zinc oxide and titanium dioxide. And then to the right, you see EWG added again, where they say mineral-based sunscreens are not absorbed into the skin and are better for the environment. Are they? Zinc oxide is typically required for mineral sunscreens because it has the broad spectrum protection. So looking at zinc oxide, the production is pretty intensive. Zinc release into the environment is also a concern. We're also depleting our zinc stores, and we haven't really figured out recycling, especially in the context of cosmetic applicable zinc oxide or OTC applicable. And then you have to turn zinc to zinc oxide, probably coat it. And that's before we get to the formulation front, because compared to chemical filters, you need a lot more zinc oxide in it to get a good SPF because, it's not a very efficient filter for absorbing UV, which is actually how it works. So you need a higher input of the zinc oxide, which actually translates to higher environmental impact for the formulation. So the answer here is no. And maybe all these eco standards who are making these stipulations are ultimately having the consequence of more environmentally impactful sunscreen products that are available to their consumers, which then brands are held to their standards and maybe they're having a much larger impact. And then there's this idea that there are no compromise sunscreens. I just want to highlight a study that was published last year, I believe, by Shire et al., where they had a bunch of people try a bunch of different sunscreen types blindly. And time again, whenever there was an inorganic filter compared to the organic only, so chemical only sunscreen, people always preferred the chemical sunscreen. So people prefer chemical sunscreens. And by removing that choice from consumers, then you're removing products that they enjoy. And for sunscreen compliance, for people to actually use the sunscreen, which is required for them to actually get protection, and they have to use it regularly, they actually have to like the sunscreens. So are the unintended consequences of some of this conversation publicly and some of these bans and stipulations from retailers, is that going to translate to, for example, a higher risk of skin cancer? It should be noted that fear is profitable. And so what's the incentive for the EWG? By creating this narrative just on the environmental front that we're talking here, but also for safety, you can then scare consumers into demanding their certification and then corner companies into pandering to what consumers want. They also will ask consumers to donate to them directly, where they make the claim that your donation to EWG will support their work to protect you and your family. And so coming to the greater question here, why does environmental misinformation matter? Here I'm highlighting a concept coined by Ford et al. In 2021, which is called misplaced conservation, which describes the collective influence of misinformation and polarization, either unintentionally or intentionally, on conservation outcomes. And so my question here, and this is not a unique example, but since we were just talking about this, are the bans for sunscreens to purportedly protect coral an example of misplaced conservation? It seems to check all of the boxes. We are misallocating resources to do these bans instead of address the actual issue, which is climate change. Probably easier, and you're probably just going to convince your misinformed consumers into, hey, we're doing something. You're further entrenching misinformation by these bans, and certainly there's a lot of misinformation that's already in the marketplace. So now consumers feel that sunscreens are the issue, but they're not. You're then alienating partners. For example, you saw earlier that Craig Downs had cited Michelle Wong as a propaganda source. And I am aware that he's done this for a few other researchers who are active in the space and don't want to speak publicly because of the potential repercussions of being on a public platform. So you're alienating legitimate scientists from the public who then feel that these people are shills because pseudoscientists, probably in my honestly held opinion, are putting this information out there in a very compelling way and are getting a lot of media platform. You're delegitimizing evidence at the same time. Here, you're probably indirectly harming biodiversity, again, because you're focusing on the wrong things. And then my final piece that I'll highlight is this idea of a BS bandwagon, where there is a lot of misinformation that's being put out there. Fear marketing may be one iteration of this, where in the early 2000s, brands started to put out free from claims, and then consumers started to expect more of them. Free from claims started to expand. Environmental Working Group and other NGOs started to amplify that through their own messaging. And then you had retailer standards starting to change, all of this kind of positively feedbacking on each other. You also have the same kind of thing happening with environmental related claims and actions. And so around and around we go. How do we break this bandwagon effect and this positive feedback loop? Probably that's a role for science communication. And so we're going to get into that in a little bit more detail throughout the summit, but this is where I'm going to leave my presentation. Thank you so much for your attention, and it's now time for Q&A. And here I am for my Q&A. Thank you so much for watching my presentation. And the first question I got was from Andrea, who asks, can you speak to how members of the public can help make their lawmakers more likely to seek credible sources when making these decisions? I think demanding accountability is part of it. In my experience, I've been able to interview lawmakers themselves. Lawmakers are misinformed on a lot of these subjects. Lawmakers are consumers. And so when there is a lot of misinformation in the public sphere, when there are very compelling voices that have their ear, such as Craig Downs, such as EWG, such as whoever else is compelling to consumers is going to be compelling to lawmakers, then they're going to have these misperceptions. And so it's until that there's a dialogue that exposes them to this other side in a compelling enough way to convince them that what they're doing isn't really right. I think that there's a lot more to it. Also, I think that there's probably a lot more on the trade association and industry side of things for having and scientist side of things in terms of advocacy, in terms of educating politicians to make sure that they're doing the right things. Politicians are also responding to constituents. So when constituents are misinformed, then they will do what their constituents want. They may want it themselves because they have the wrong information. So, like, ultimately, I think having public conversations as you're learning, for example, actually, it's not your sunscreens that are causing coral bleaching. Having more conversation about that publicly, asking the legislators, why are you doing this when the National Academies of Science just refuted this idea? That's probably where I would be. That's probably where I would start. Andrea, maybe I'll ask you the same question when you get on stage. I would be interested in your take. So I'll just go to the next question. So the next question is from Kagulin. I'm so sorry. I've definitely butchered your name. Let me know how you pronounce it, and then I'll say it right in the future, hopefully. Is that why mineral sunscreens cost a lot more than chemical sunscreens? Because dollar per milliliter, mineral sunscreens require a higher amount of inorganic filters to get the same protection. That may be a question for Myriam, who's going to be presenting next. I would imagine it probably has a role to play, but disclaimer, I do not formulate or produce sunscreens. So probably the better person to ask would be somebody who is developing sunscreen products. From Mita, do you think the FDA will approve new filters for sunscreens in the US, which will likely improve consumers' experience with sunscreen, increasing the likelihood of them reapplying? I mean, I don't have a crystal ball. I think that DSM has had some progress with getting their new filter approved, and I do not know where they're at this point, but they have been doing a lot of advocacy for getting new filters approved. I also am aware of the history where new filter requests have just been uh, like they've gotten a no for reasons that elude me. So Perhaps this would also be a good question to ask Myriam in the next presentation. I don't know. I don't have a crystal ball. I would hope that they would approve new filters, but I do not know. From Dan. So the comment first is I'm really glad you mentioned the feedback loop from NGOs. My question is more, how do we challenge scientists who fall for this cycle? Sadly, this is happening too much in the plastics field, which is their main field. Oh, that's challenging. Like, I think that asking questions, critiquing content when you see somebody posting something inaccurate. I see this a lot actually in the sustainability space. It's such an interdisciplinary space. A lot of people also have not maybe the right background to look at, for example, like ecotoxicological impacts. As one example, if they're an MA or coming from an arts background, to have that lens of sustainability, it's really hard to critically look at that information. And so I see a lot of people just kind of falling for misinformation in the sustainability space. And I know this is similar in plastics. So, and this is probably something that I should do more. I mean, I'm trying to do it with this conference, but just try to have conversations with these professionals. A lot of the times, there are things in their blind spot that they just haven't considered that other side. So I would just, yeah, have these conversations, comment, ask questions, point them to other experts. And if they say no to what you're saying, there's also a whole bunch of Scicommers online right now that are doing debunking, myself included. I typically focus on like the environmental impact side, lots of people on the safety side. So that could be also something to think about. I am now just scrolling through the messages for more questions from you. I'm sorry, I've kind of missed. I see a lot of good comments, so thank you so much for your feedback for my presentation. This is from Kajol, how sunscreen filters impact aquatic coral ecosystems. There is a debate going on. What's your viewpoint on microplastics? Okay, well, I'll start with the debate for coral impact from sunscreens. To the public, I think that there's more of a debate compared to within the scientific community. Within the scientific community, outlier data has been called to question, such as the 2016 study by Craig Downs as one example. And actually, this is something that I looked at in my master's. I reviewed the literature for sunscreen filters. And like, why is there such misinformation? It was actually kind of astonishing to see how much this study had effectively poisoned the well, because then in the future, I saw so many studies citing Craig Downs as their explanation. Just a quick sentence: sunscreens cause coral bleaching, and then they move on to their experiment without actually looking at the other literature. And I mean, like, that's problematic and kind of brings up the point that just because there's a study out there doesn't necessarily mean it's a good study. And you'll hear a lot more about that from Lanesa. So, I mean, I just think that the body of evidence for sunscreens overwhelmingly does not support the idea that sunscreens are contributing to coral bleaching, and it's more other things, especially climate change. I don't have time, I'm sorry, to answer your second question, so I'm going to leave my Q&A here, and then we're going to move on to the next presentation. And if you guys have more sunscreen related questions, then Myriam will be the person to ask them. Thank you so much for watching. Our next presentation will be by Dr. Myriam Sohn, who gained her master's degree in industrial cosmetology in 2002 in Lyon, France. She joined the technical services UV filters of Ciba Specialty Chemicals in 2002 and continued in the sun care field within BASF after the acquisition of Ciba in 2010. Since then, she's been working in the Global Technical Center Sun Care. During this period, she took over different positions, first as lab head, then as technical manager for dedicated customers, and later as senior application technology scientist. In the meantime, she completed her doctoral studies at the University of Basel in pharmaceutical sciences. Today, she is IP manager for the sun care field and involved in various research and application-oriented technical sun care topics as principal scientist. Without further ado, here's Myriam.
Hello, thank you for attending my presentation. My name is Myriam Sohn and I work for BASF. BASF is a leading company in developing UV filters for topical application. The title of the presentation of today is Sunscreen Misinformation. Indeed, a lot of misinformation circulates on the net, spread by non-expert people, and this can be very dangerous when it comes to photoprotection and health-related damages. So I would like to thank Jen to give us the opportunity to reestablish some truth today, and hope that you will spread this new scientific-based information very broadly afterwards. I cannot address all the topics, but I have chosen the one I think are the very important. So we will speak about the safety of UV filters, designation minerals versus chemicals, the effectiveness of sunscreens, the relationship sunscreens and skin cancer, and finally the impact of UV filters on coral reef. But first, let's start with the safety of UV filters. The safety of UV filters is often questioned, but UV filters used in sunscreen needs to be registered to be allowed to be used in sunscreen, registered on a positive list, and this is true for all the regions. So this means they must have undergone a series of tests to demonstrate the safety for humans. And region-wise registrations also explain why the number, the type, or the concentration of the UV filters might differ between the regions. But this also means that no other UV absorbing molecule is allowed to be used as a UV filter in sunscreen products. So when you buy a sunscreen with a SPF claim, it must contain one of the filters registered on the positive list. If it does not contain such a UV filter molecule, then something is wrong with this product. And so the safety of UV filter is often connected to dermal penetration. And the dermal penetration of a molecule is impacted by some factors, some not well-known factors, such as the molecular weight of the molecule, the lipophilicity, the polarity, or the melting point. And from these factors, molecular weight is a main parameter. So UV filters with a high molecular weight will penetrate less than UV filter with a smaller molecular weight. And 500 Dalton is a threshold indicator that is used in the pharmaceutical field for dermal penetration. So filters with a higher molecular weight than 500 Dalton are favored to reduce the risk of skin permeation. A second option is to use nanoparticulate filters because these are big particles, much bigger than soluble filters. And a number of organic UV filters own one or even both of these properties and can be used for reduced risk of skin permeation. A second option is to use effective UV filters, so filters with high absorption. So this means that lower amount will be needed, a lower concentration. And for inorganics, nanoform should be favored because nanoform inorganics are more effective than non-nano. in absorbing properties. So misconception 1 about safety of UV filters. UV filters are registered on a positive list and have undergone a specific test to prove their safety. Then the safety is re-evaluated whenever there is a suspicion of an issue for humans or when new data are available. And the reduced risk of dermal permeation is possible by using UV filters with high molecular weight and or particulate filters. So the best compromise for the efficacy and reduced risk of dermal penetration is to use filters with a high molecular weight and a high absorption. Let's move to the second misconception. Are minerals better than chemical UV
Can you hear me?
First of all, I would like to come back to the fundamentals of the mechanism of action of UV filters. So all UV filters work primarily via absorption, and this is true for the organic and the inorganic UV filters. They absorb a part of the UV light to avoid the UV rays to achieve the skin. This is a quantum physical phenomenon. Then, depending on the UV filter, so the particulate filters can additionally scatter or reflect the light. And this is true for all particulate filters, so the inorganic and the organic particulates. This is an optical phenomenon. This is like a boosting, so it increases the path length of the UV. And so it therefore increase the probability for the light to meet another UV filter molecule. So this boosting is of around 10% of the efficacy. But this means that all UV filters act according to a physical principle. So first, the designation chemical versus mineral. So this designation is basically wrong because all filters are chemicals, all have chemical structures, all are made of atoms. So the correct designation would be organic, that are based on carbon atom, and inorganics, that are free of the carbon atoms. Another possible designation would be soluble versus insoluble. Insoluble meaning the particulate UV filters, organic and inorganic in this case. And now what about the statement that titanium dioxide and zinc oxide are natural? This is also not the case because both are chemically processed. They come from natural origin, but then they are extracted, they are purified, there are coated, so they are chemically processed. So summarizing misconception 2, organics versus inorganics. In terms of efficacy, the organics are more effective, so a lower concentration is needed. Some shows high molecular weight for low to no risk of dermal penetration, and the soluble ones are transparent on skin. The inorganics are less effective, so a higher percentage is needed. They show low UVA protection, but they are particulate, so low to no dermal penetration, and they might leave skin whitening. Regarding the safety, so both categories are evaluated in terms of human safety by the competent authorities. Both are registered as UV filter and allowed to be used in sunscreens. The third misconception relates to the effectiveness of sunscreen. Is SPF 30 twice as effective as SPF 15? Indeed, a popular misconception is that SPF 30 is not twice as effective as SPF 15. And this is linked to a misinterpretation of the amount of UV that is absorbed versus the amount of UV transmitted to the skin. It is important to remember that the UV damages are linked to the number of photons, so the portion of the UV radiation that reach the skin and that are transmitted. So what matters is the amount of UV transmitted and not the amount of UV absorbed. And this is explained in the figure. So in blue, you have the part of the UV that are absorbed, and in red, the part of the UV that are transmitted, and this for different SPF. SPF 1 means there is no sunscreen layers, meaning 100% of the UV radiation is transmitted. And the misconception comes from the fact that for SPF 30, more than 96% are absorbed, and for SPF 15, more than 93% of UV radiation are absorbed. And so this is only a small difference of 3%. But what matters, remember, is what is transmitted, so what is creating the damages. So looking at the red part of the figure, in the figure we can see that only half of erythemogenic UV reach the skin through a SPF 30 sunscreen, only 3.3% than for SPF 15, where 6.6% are transmitted through the skin. So knowing that what matters is the UV transmitted and not the amount absorbed, everybody is able to understand now that SPF 30 is indeed twice as effective as SPF 15, or SPF 60 is twice as effective as SPF 30. And the issue is rather the user compliance, because consumers use in average half less than the amount used for the SPF claim. So of course, they have less protection as expected or written on the bottle. And so also that's why a high SPF is recommended, especially at the beginning of the summer when the skin is not prepared. So let's move now to the next misconception. That is the statement that sunscreens cause skin cancer. So this is not possible to ignore this statement, and it needs some explanation about the relationship between sunscreen use and skin cancer developments. So coming to the facts, the first fact is that UV rays are classified as carcinogenic. But this misconception comes actually from the observation that skin cancer rates yet increase even if people are using more sunscreens. But what we need to understand is that the skin cancers takes decades to develop, so 2 to 3 decades. So to understand the observation of today, we need to look at our habit of consumer user habit 20 to 30 years ago. So we need to look back to understand the observation of today. And now coming back to the 90s, our sun exposure habit. So there was an increase in the traveling in hot countries, and this even in winter with our unprepared skin. There was a culture of the tanning, so exposing ourselves, a lack of compliance from the consumer, and sunscreen were of more poor quality than today. So the average SPF was around 10 to 20, with a low protection and a poor stability. So here in the figure, you see the decrease in the performance of a sunscreen exposed to UV rays. And this is the reason why there is an increase today of the skin cancer. It's not directly linked to the habit of today. So to understand what will happen in future, we need to look on our habits of today. And so what is our behavior of today towards sun exposure? So the positive thing is that there is an increased awareness in the population of the danger of sun. So besides erythema, we know that sun exposure leads to skin cancer or photoaging. And so this led to an improved usage behavior. So increase the frequency of application or protection of the kids. And in parallel, there is an improvement in the quality of the sunscreen versus 20 years ago. The average SPF raised, so the value is about 30 to more. And there is a minimum UVA protection, for example, of 1/3 of the SPF in Europe, so since 2006. And a lot of filters are now photostable, so it's totally possible to produce a photostable sunscreen. The negative aspect is still the culture of tanning in many regions around the world, so we expose ourselves on purpose to get this tanning. So what can we expect for the future? So we can expect a reduction of the skin cancer rates, first due to the better quality of the sunscreen of today than 20, 30 years ago, but we still need to improve the user compliance, maybe improve the education at children, and also to increase the awareness that tanning is UV damage and is a part of the skin cancer appearing later in age. But a key to successfully reduce the skin cancer rate in future is the change of the user behavior. And the last topic I would like to speak about is the impact of UV filters on coral reefs. Indeed, there is a huge concern that UV filters damage coral, and this is based on the publication of some studies that showed the negative impact of UV filters on corals. But these studies showed some shortcomings in the design and might not be suitable to evaluate the real effect of the UV filters on the coral's viability. So it's conflicting because there is also no harmonized criterion, no harmonized test to evaluate the impact of ingredients on corals. And the consequence is that some governments ban the sales of sunscreens containing some of the tested UV filters on the basis of these studies. And this decision might be problematic since the use of sunscreen was demonstrated as highly valuable for human health. So what is the current status or the next steps? So there is a ICCS working group, and BASF is part of it, to work on the development of a method, a harmonized method to evaluate the impact of ingredients on corals. And currently, there is the EcoSunPass tool that is available, that is a scientific-based tool developed by BASF to assess the environmental impact of UV filter combinations. And the EcoSunPass is a holistic approach to assess the environmental impact of UV filter combinations. It considers all relevant environment parameters like acute and chronic aquatic toxicity, the biodegradation, bioaccumulation, terrestrial and sediment toxicity. So thanks to the EcoSunPass, you can develop already today more eco-compliant sunscreens. And to learn more, please check our website mentioned here. And this is my last slide. So re-establishment of scientific facts. Misconception 1, UV filters are carefully evaluated. So official registered UV filters are evaluated for their safety on humans. And inorganics with high molecular weight and high absorption are the best compromise. Misconception 2, organic and inorganic filters. So both act according to physical principles and both are chemicals. Misconception 3, SPF 30 is indeed twice as effective as the SPF 15. Here, due to low user compliance, high SPF are highly recommended. Misconception 4, benefits of today's sunscreen on skin cancer rates can be visible only in decades, and here the change of user behavior is key to successfully reduce the skin cancer rates in future. Misconception 5, UV filters are not proven to impact coral health. There is no harmonized method existing so far, but this is ongoing. So I really hope that you could all learn something today. I hope that I could restore confidence in the filters and in the sunscreens. I would like to thank you all for your attendance at my presentation, and now I'm open for further questions.
And we are back for the Q&A. Myriam, if you would like to turn your camera and mic on, hopefully you can hear me. I'm going to ask a question that I got in my presentation, and I'm just not the right person to answer it, which was, is the higher input requirements of inorganic filters the reason why inorganic mineral sunscreens are often more expensive? What's going on with the price differential?
Hello, can you hear me?
Yes, I can hear
have
you.
already confirmed that you could hear me already for a second time. Hello to everybody, and thanks, Jen, for the invitation to get back to the truth of some of the aspects. So here it's not exactly a question regarding misinformation. So it's not directly the topic of the presentation of today. I mean, for the price of the UV filter, I must say I'm not the expert since I'm the R&D. But what I can speak is about the difference in the performance that you have seen rapidly in the presentation. So for sure, there is a difference in the direct absorbance, so what we call E11, which enables to compare the different UV filters and for sure to achieve the same SPF and UVA protection for a sunscreen that is only solely based on inorganics. You require more in percentage. So this is a fact, and this has also some other misadvantage or disadvantage regarding then the sensory profile. After the cost depends on a lot of different factors, the raw material themselves, the sourcing, the purification, and so on. So I cannot enter here in detail, but for sure there are differences in the performance and in the percentage required for higher SPF. That is difficult for only inorganic based sunscreen.
And another question that maybe is unrelated to truth and beauty. Well, I mean, it kind of is, but this was brought up in my presentation. I was asked this, not the right person to answer. So the question came up again. Why does the US refuse to approve new UV filters? What's up with the slow approval process to get new UV filters on the market?
I mean, I'm not sure that the US refused to register new UV filter. It's just due to the process of registration in the USA. And this is mainly based on the different of the categorization of this type of product. So in Europe, it's classified as a cosmetic. And in the US, as you may know, it's classified as a drug, OTC drug. And so you have all the criteria set for drugs. And drugs normally need to penetrate to act. And so all this setting of test is relating more to the risk that you can have from a drug molecule to penetrate. And sunscreen are the opposite. They should remain on the surface of the skin to act and not to penetrate. But since they are considered in the US like a drug, they have the same setting as the pharmaceuticals. And this is different in Europe. And most probably this is one major difference that leads to the fact that in the USA it's very difficult to register new molecules.
And so sometimes maybe more regulation doesn't necessarily mean a good thing for consumer safety. This next question comes from Kajol, who asks, why do some people claim UV filters cause endocrine disruption and cause cancer and other types of problems? So why? And then what's the reality?
I guess for the skin cancer, you have heard a lot about in the presentation. So this is a big issue, also a health issue for the consumer if they stop using sunscreen because of this misconception. So it's clear that the skin cancer occurrence has a delay between the moment where we expose to the sun and the moment where the first skin cancer will appear, which is several decades. So the misinformation telling that sunscreen causes skin cancer, because unfortunately today the skin cancer rate has not yet decreased, is due to our behavior or exposure 20 years ago. And people exposed a lot, and the sunscreen were not of the same quality as today. So my message really of today is for you today is continue using sunscreen in a large amount. The quality of the sunscreen themselves improved a lot, and it's also your own behavior that is a big factor in what will happen 20 to 30 years in 20 and 30 years.
And I will say on the endocrine disruption topic, it's pretty big. And so I have a whole podcast coming your way this fall. Podcast is going to be coming back hopefully next week if I'm organized enough. And so stay tuned. It'll probably come out sometime in November. Okay, the next question is from Kakulin. Please let me know how I should pronounce your name. I think I've probably said it wrong. Okay, the question, if SPF 30 is twice as effective as SPF 15, why is the current recommendation to use SPF 30 and not SPF 50 or above? And I may just point to that there's been a revision for FDA's recommendations for using a higher SPF. But yeah, what do you think?
I mean, you refer to the FDA?
I am not sure what they're referring
recommendation,
to, and
or
I think that
I don't know to
previously
which.
I think previously they limited it to SPF 50, but now they've made a recommendation to go higher. So I just wanted to point that out. But
Okay,
why?
I mean, it depends when you look in theory or when you look in practice what is happening, and it also depends how the people or the expert were interpreting these part of UV absorbed and part of UV transmitted. That's why today for me it was very important to make you clear that the SPF and the sun, so the erythema and the sunburn occurrence depends on what achieved the skin. So this is the percentage of UV that is transmitted and not absorbed. So this means clearly that SPF 30, when we speak about the value, is twice as effective as SPF 15, for example. Now, why the FDA, if this is what you asked for, recommended only a 30, it's because if the people would apply to the right amount and repetitively, then of course there would be enough protected. But the problem is also the compliance. And this is the same as the topic of compliance for the skin cancer later. When you look on the practical point of view, people are not applying what they should to have a SPF 30. They apply, generally, there are a lot of studies that were done for this, half less. And so that's why clearly we should go to a higher recommendation, especially when you have fair skin, especially when it's the summer start, your skin is not prepared. So I highly recommend to start anyway, always with a higher index. And maybe the new recommendation, as you mentioned, Jen, increased this maximum SPF as well of the tentative monograph of the FDA. So it depends when you consider these from a theoretical point of view or really from a practical, and so the compliance plays here a major role.
And unfortunately, that's all the time we have for this Q&A. 10 minutes is just not enough. Thank you so much, Myriam, for agreeing to present.
Thank you to you.
Oh, and I also wanted to say thank you so much to BASF for being our bronze sponsor. And BASF has supported many of our e-summits. So they are a big reason why we are able to continue to do these e-summits free. So thank you to BASF and thank you to Myriam for presenting.
Thank you.
Our next presentation will be by Dr. Barae Jomaa, who serves as Principal Toxicologist and International Regulatory Lead at Colonial Chemical. With over 14 years of experience in toxicology, regulatory affairs, and scientific communication, he spearheads international regulatory initiatives at Colonial Chemical. These initiatives focus on safety assessments and substance registrants in accordance with global regulations. A European registered toxicologist, Dr. Jomaa holds a PhD in toxicology. His doctoral research centered on the development of alternatives to animal testing. He has significantly contributed to the field, notably through the development of cutting-edge in vitro tests for thyroid-disrupting compounds. A staunch advocate for animal welfare and environmental protection, Dr. Jomaa is passionate about scientific innovation. He is the founder and editor-in-chief of the Journal of the Netherlands Society of Toxicology. His scholarly contributions include various peer-reviewed papers on alternative testing methods. Additionally, he regularly authors and serves as the editor-in-chief for TCDD, the newsletter of the Netherlands Society of Toxicology. Without further ado, here's Barae.
Welcome, and thank you for joining me today as we explore animal testing and try to separate fact from fiction. This is a topic with a lot of strong opinions, and the goal today is to clarify what's really happening with animal testing, especially in the cosmetics industry, and to understand the scientific, regulatory, and ethical challenges involved. Let's start by looking at where we are today globally in terms of bans on animal testing. I am going to share with you a world map showing the extent of animal testing bans. Animal testing bans on products and ingredients are now in place in nearly all of Europe, as well as in Australia, New Zealand, Taiwan, South Korea, India, 6 countries in Latin America, and recently Canada. In the US, we have 12 states that have imposed bans on animal testing for cosmetics, with California, Illinois, and New York leading the way. Now, considering these countries, you may ask, well, what about the rest of the world, specifically the world's second largest economy? You know what it is, China. There's a persistent belief that any cosmetic product sold in China must have been tested on animals. This was indeed true for many years, but this is no longer the case, at least not for all cosmetics. In 2021, China amended its regulations to allow for general cosmetics like shampoos, perfumes, and makeup to be sold without animal testing. This is a huge step forward in the global push to eliminate animal testing. However, this exemption does not apply to so-called special use cosmetics, such as hair dyes, antiperspirants, sunscreens, or skin whitening products, which are still subject to animal testing requirements. And what about cosmetic ingredients in China? Well, it's a bit more complicated. In most cases, new cosmetic ingredients still need to undergo animal testing, but there are still exceptions. For example, if the ingredient can be shown to have a history of safe use in international markets, registration in China can still bypass the need for animal tests. So, despite the common belief, it is entirely possible for cosmetic products sold in China to be cruelty-free, provided that they are general use products and that the company complies with the regulatory changes. Now let's go beyond China and take a closer look at some of the issues with animal testing bans, particularly for cosmetic ingredients. While animal testing bans generally apply to both products and their ingredients, there are still cases where animal tests may be required, particularly when regulators believe it's necessary to protect workers' safety. Workers are often exposed to ingredients at much higher concentration than the average consumer, and this daily exposure raises different safety concerns. Last year, A significant ruling in the EU High Court sided with the European Chemicals Agency, affirming that, in some cases, testing may still be necessary to ensure the safety of workers exposed to cosmetic ingredients. Additionally, it's important to realize that bans on animal testing for ingredients are difficult to enforce. Many substances used in cosmetics have multiple uses outside the cosmetics industry, such as in pharmaceuticals or cleaning products. These substances are often subject to different regulations, and mixed-use chemicals may be exempt from animal testing bans in one industry, but still required to undergo animal testing in another. This brings us to an important misconception related to cruelty-free labels. Many people believe that a cruelty-free label means that neither the product nor any of its ingredients have ever been tested on animals. But this isn't necessarily the case. Cruelty-free claims typically apply only from a certain date, usually tied to the EU's animal testing ban that came into force on March 11, 2013. Moreover, cruelty-free labels don't cover animal tests required by regulators. So in regions with animal testing bans already in place, the label essentially confirms that the company has complied with the law. Now let's shift gears and talk about why animal testing exists in the first place. How did we get to the point where regulators require animal testing to ensure safety? To put this into context, it's important to remember that animal tests were once considered the more humane approach to testing the safety of chemicals. In fact, humans were the first test subjects for many toxicity experiments. There is a well-known painting by Alexandre Cabanel called Cleopatra Testing Poisons on Condemned Prisoners, which perfectly illustrates this point. In those times, human subjects, often prisoners or marginalized groups, were forced into experiments. After the horrific human experiments conducted by the Nazis during World War II, the world realized the need for ethical guidelines. The Nuremberg Code was established to protect human subjects, insisting that their informed consent was required and that thorough animal testing must precede any human experimentation. But we've come a long way since then scientifically. Today, we're on the brink of a new era, where we can predict toxicity and other safety concerns without relying on tests involving animals or humans. This brings us to a key question. Why haven't we fully phased out animal testing yet? In 2022, the European Joint Research Centre identified 5 major obstacles to completely phasing out animal tests and replacing them with NAMs, or New Approach Methods. Let me take you through each one. I'm going to first share with you these issues here. The first issue relates to the validation and standardization of NAMs. There's a common perception that NAMs aren't sufficiently validated or standardized. Now let me explain to you what NAMs are. NAM stands for New Approach Methodologies, and these are methods that reduce or replace animal testing, including in vitro, in silico, and in chemical approaches. For anyone unfamiliar with these terms, in vitro methods use cell-based models, in silico methods use computer simulations, and in chemical methods are cell-free models using biochemical techniques. Are these methods truly undervalidated? The short answer is no. Test method validation is an internationally recognized process involving multiple experiments to ensure a method's precision and accuracy. During this process, we also learn the limitations of the test. For example, some tests may be suitable for mixtures of chemicals, while others may not. Organizations like ECVAM in the EU and ICVAM in the US oversee these rigorous validations. A method that passes validation can then be submitted for adoption as an OECD test guideline. That's a crucial step in the global regulatory framework. This whole process takes years, and once a non-animal test becomes an OECD test guideline, we can be confident that it's been thoroughly validated. Various in vitro tests are now validated and accepted by regulators around the world for skin and eye irritation, skin sensitization, phototoxicity, and skin absorption. Some other in vitro tests can even support an entirely animal testing-free approach under the weight of evidence principle. For instance, tests for acute systemic toxicity using mouse or human cell lines, and acute toxicity using fish cell lines. An example of acute toxicity tests that may be used in this way is AccuTox by Accelerate. Now I'm going to be sharing with you their website just to give you an example of how this looks like. So what we have here is a multi-well plate, and here we see that there are human cells being cultured. Of course, we don't see them with the naked eye. We have to look at it with a microscope, but you can trust me, these are human cells. And what happens is that you get a cosmetic ingredient, which is the test item here, and this cosmetic ingredient is applied at different concentrations from very low to very high. And at very high concentrations, most chemicals will be toxic, and at extremely low concentrations, they will not be toxic. And what this test tries to do is to find the concentration where 50% of the cells are actually dead. So this will relate to the LD50, which is the lethal dose in animals. So this EC50 in this type of experiment is going to relate to the LD50 in rodents. So this is a very good test, very fascinating. Here they're using human cell lines, and there are other tests that use rodent cell lines in a similar fashion. And this is an advantage here for this test, that they're using the human cell lines. In general, these sorts of Q tests are easier to work with. Now, the difficulty comes with longer-term tests and, looking at things like developmental or reproductive toxicity. And nonetheless, I think that there's been a lot of progress being made, and companies like Toxis have found really creative solutions to address this problem. So I'm gonna now, share with you another website, and this time this is another company, and I'm not related to any of these companies. I don't have anything to benefit from them, but I'm just sharing them with you so that you get an idea of what's out there in terms of the most promising alternative methods that have been traditionally very challenging to replace with in vitro tests. So here, what they do, so they're looking at this developmental toxicity test, and they call their test ReproTracker. And they start off with stem cells, and they differentiate them into cardiomyocytes, which are heart cells, and then hepatocytes, which are liver cells, and neural rosettes. So these are neural cells. And they will grow them to have kind of a tissue that is similar to what you would have in your body. And then after they expose these tissues to chemicals, they will look at their morphology and try to see if there are changes to the morphology. And these changes to the morphology, then they can note as potential toxicity. Now, together with this analysis of the morphology and how chemicals affect this morphology, they also look at biomarkers, so genetic biomarkers that are known to be related to developmental toxicity. So all of this together, they come up with a test that is quite highly related actually to what you find in animals. And, fascinatingly, this test has been validated by ECVAM, and they are now on track to get get a test guideline from the OECD. So when this comes out, this will be, I believe, very revolutionary in terms of a test to replace animal experiments. All right. So I hope that you enjoyed this. Now we can move on to the second issue. The second issue is the concern that NAMs are perceived to be less safe than traditional animal tests. In reality, this is far from true. Many in vitro tests often outperform animal tests because they use human cells. These can provide more representative data on how chemicals affect humans. Remember, mice are not little humans. Rodents can be more or less sensitive to certain chemicals compared to us. This means that using human cells in vitro tests can actually provide better safety data. And while false negatives can occur in any testing method, it's important to remember that animal tests don't have a perfect track record either. Now the third issue. One concern raised by the Joint Research Center is that sometimes NAM trigger additional animal testing instead of reducing it. For example, if an in vitro test suggests a substance is genotoxic, additional animal tests may be required to confirm the results. Similarly, endocrine disruption often rely both on in vitro and animal tests for final regulatory approval. So there is some truth to this issue, but it's not the case that alternative methods are increasing animal testing overall. Instead, they often replace animal tests or significantly reduce the number of animals used. On to the fourth issue. NAMs for systemic toxicity require integrated approaches. Now, when it comes to systemic toxicity, we encounter another hurdle. NAMs aren't a simple one-to-one replacement for animal tests. Integrated approaches are needed. But while this may seem more complex, it's not inherently negative. With proper coordination and advanced technologies, these methods can work efficiently without requiring more animals. The fifth and last issue is that standalone NAMs are not used for hazard classification. Well, this is not true. The concern that NAMs aren't sufficient for hazard classification and labeling is not based on reality. This fear is rooted in misunderstanding. If a standalone in vitro test has been validated and accepted by regulators, as is the case with the OECD test guidelines such as 492B for eye irritation, there's no reason it can't be used for classification and labeling purposes. To wrap things up, it's important to remember that animal testing bans are in place in most developed countries as it relates to cosmetics, and the landscape is shifting rapidly. While some challenges remain, NAMs are steadily replacing animal tests, and both science and regulation are evolving to support these advancements. The future of safety testing is moving towards more humane, efficient, and scientifically advanced methods that do not rely on animal testing. As we continue to innovate and validate new approaches, the goal of completely eliminating animal testing becomes increasingly attainable. Thank you for joining me in this exploration of animal testing. I hope this discussion has provided clarity on the current state of animal testing, the progress being made, and the challenges that still lie ahead. Together, we can support the development and adoption of alternative methods that ensure safety without compromising the welfare of animals. Thanks. Hello.
Hello. Barae, thank you so much for that presentation. And I'm just going to put you on the big screen for questions. And we had quite a few. One from Cosmetic who asks, why have animal testing not been completely banned in the US and China? Also, can you speak to like the regional implications globally? Because there's often this perception that there are tests, like, is cosmetic testing common for finished products? I know that this is something that you talked about in your presentation, but I just want to make it kind of plain here. So, what do you think?
Sure. Yeah, thank you for this question. So the cosmetic products are usually not tested on animals because the market as it is a global market. So you wouldn't want to, test your product because it's allowed, for example, in Vietnam, and then you want to market it in the U.S. or in Canada or Europe, and then you're having challenges there. And so products are not tested on animals because most companies, even smaller ones, they want to market their products on a global scale. Um, and when you look at the US specifically, animal testing bans are in place for products, as I mentioned in the presentation. There was that world map. The US is actually a little bit of a fragmented situation, unfortunately. So there are a lot of states, and more as time goes on, that are applying animal testing bans. And it is really unknown to me why the rest of the states don't just go ahead with an animal testing ban and have this then trickle down to the federal level. I think it is going to happen at some point. I doubt that the US is going to be the last holdout. Canada just recently joined the bandwagon of banning animal testing on cosmetic products. So I do think that US will be there. It is just a matter of, I think, politics, just making sure that this goes through. And from a business standpoint, I also don't see the reason why any companies would be reluctant to also, accept such a proposal to have a nationwide ban on animal testing for cosmetic products because it is the de facto situation. So there's nothing you can do about it. It's already in place. In China, it is also, as mentioned briefly in the presentation. So for the products, it depends whether it's a so-called general product or if it is a specified product. Specified products are, sort of like these skin whitening agents. So whenever you're having sorts of claims on your products, and that's going to be another class for them for China. But general cosmetic products, what we understand mostly as cosmetic products, you can go ahead without testing on animals in China. It is not, let's say, a given. You still have to, um, show that the product is safe. And also in terms of the ingredients, you can also not test on animals. But again, you have to show that the ingredient's safe. Could be a history of safe use. It could be in vitro tests, which they do accept. So it is happening. I think the sort of point here to pay attention to is the fact that some of these ingredients going into the cosmetic products are going perhaps into multiple industries. And if they go into multiple industries, they will uh, be tested often because that chemical has to comply with another regulation. So that becomes difficult and tricky. Now, I'm not going to say that every substance has such an issue because there are some substances that are indeed used only for cosmetic purposes. So those are not tested on animals, except in the cases where the regulators themselves are going to require it. So that's another thing. So there's this kind of let's say battle going on between the regulators and the companies do not want to test on animals, and the regulators at one point will say, well, we do think that you need to test on animals. And there has been a lawsuit recently that was lost by one of the European companies, and the European Chemicals Agency kind of forced them. They told them you have to go ahead with the testing. And this might sound a little absurd and strange, but European Chemical Agency is not really out there having a very bad ethical record. And from their perspective, they think that they're trying to safeguard specifically workers. So you might say, well, for people, why would it matter? Because cosmetics don't use substances at such a high concentration. And it's a lot easier to kind of find out what is relevant, especially, for example, if exposure is dermal. You can already discount a lot of issues if you say, well, if you find out that it's not going to be absorbed. But the regulators will, the chemical agencies, they will look at a pure substance. So that's what they're assessing. They're looking at the pure substance, and they're concerned with something called occupational exposure. So that's the worker safety. And these workers are working with substances at very high concentrations. There can be heat, there can be vapor, there can be, they take a lot of different situations. Could be like something like hand mixing of a chemical. So that could be also considered. You might be having splashes of that pure chemical on your face. So that's how far they get. And whether that's ever going to be banned, I think, will be really tightly related to the advancements that we make in terms of developing alternatives to the difficult tests, safety tests. So we're talking about repeated dose toxicity, perhaps carcinogenicity studies, developmental toxicities. These are endpoints that the regulators will really need to know because, it is to their point, I think that if you have people working in a factory and they're working day in and day out, it's chronic exposure. If they can develop after 10, 20, 30 years, perhaps some health issues, and then these health issues, they want to know whether they're related to their exposure. So that's always an issue, and it's very difficult, frankly, because it's always the case that somebody working in the plant will say, well, I have developed cancer, and then try to find out whether this cancer is due to his old age or whether it's due to his to him being working at that factory. Very, very difficult. So that's why the regulators are extra careful, trying to make sure that substances are extra safe. And there is perhaps a direction going towards being perhaps at least from the perspective of the industry being maybe too safe. And it's called kind of a hazard based. So they're not looking at the risk of a substance. So I can use a cosmetic and that's going to be perfectly fine. They look at the hazard only. So they don't look at the fact that you're using a very small percentage and it's not actually getting to your organs, but they will say, well, there's organ toxicity. Like, okay, what does that mean? So that's their hazard-based approach. Yeah, I think that covers maybe part of that question, maybe.
Yeah, and like there are a whole bunch of things that came up in your answer there that touches on other people's questions. For example, Kim says comments slash asks, so best to illustrate safety on the basis of substances, ingredients used for finished products. Like a lot of the conversation I guess we're having is more
Oh,
relevant to those ingredient suppliers rather than finished products. It doesn't make economic sense for brands to test their products on it with animals. Their customers wouldn't like it, and it's also like maybe more expensive. Like, why would they do that? Actually, I don't know the price of animal testing, but like it just doesn't make economic sense if their customers are going to hate them for it. There was other commentary around. So, this was from Joff. I'm sorry, I've probably mispronounced your name. You've told us where animal testing is banned. Are there still countries where animal testing is required? Oh, I guess I wanted to also point out something previously of like, you had highlighted this before. I just wanted to comment on this, and this is my opinion, not Bara's opinion, that I've just seen some like I would maybe even say racist commentary specific to China that they're saying like they're doing this because the Chinese public is like evil, something like that. But it's coming more from a place of wanting to make a precautious decision to safeguard their public and the environment. So it's just like really nuanced. And I think that there's a lot of narratives out there that
Um,
miss the nuance. So maybe you
mhm.
can comment on that, but
I don't
also,
think yeah, I don't think they're evil. It's of course not. But the thing is, as you said, I think as you alluded to, that it's really them trying to make sure that the products are safe. They've had a few situations where some contaminations might have happened or some exposures might have happened where people might have gotten sick or poisoned. So they're extremely careful to make sure that the safety of their products is really paramount. And one could also take into consideration perhaps the cultural aspect. So it could be also that in certain parts, um, the ethical concerns regarding animal testing are maybe not as acute. We can think of whaling in Japan, or, it could be a lot of different things. But so there are different considerations there. And I think China is very focused on the market and on business. So I think, in my opinion, and this might be misplaced, and of course it doesn't cover kind of like all of China, but I do think that they listen to the companies, and the companies are asking to um, develop their regulations so that they're aligned with international requirements, and to also accept things like reader crosses and accept things like in vitro testing. So they've done a great job, I think, at listening to the companies and listening to other stakeholders. And I do think there's still some way to go, but I think clearly they've done great progress so far. Definitely not an evil intention, I think. No. Mhm.
and like a lot of the reservations also come with the view, I guess, for gaps in vitro test methodology and the innovation that's still required. And maybe I'll also say that something that makes me really proud to work in the cosmetics industry is how innovative and I guess progressive we are. And so because we have maybe been disproportionately given attention to on this. Maybe that hasn't made the most sense considering other industries, whatever. But regardless, we've developed, not me, obviously. people like you and other smart people have developed these tools that are useful in cosmetics, yes, but also now can be used in other sectors. So, as an example of the cosmetics industry really leading the way to more ethical safety substantiation. Okay, I'm so sorry. We don't have time for more questions, but I did want to highlight that Barae has come on my podcast to talk about animal testing. And so if you want a whole bunch more from Barae, then go tune into the podcast. It was on our last season. And Barae, if you go on you had many more questions. And if you have time to go on the YouTube chat, you can check out the other questions and feel free to answer people directly there.
Sure. Thanks, Janet. Thanks, everyone, for listening.
Thank you so much.
Bye.
Our next presentation will be by Dr. Aegean Chan, who's a double board certified dermatologist and dermatopathologist practicing in Santa Barbara. She's also an adjunct professor in the Department of Dermatology at the Keck School of Medicine of the University of Southern California. Her area of clinical expertise is in complex medical dermatology, skin cancer, and acne. She has published numerous articles in peer-reviewed medical journals on the science of the skin barrier, electron microscopy, and congenital skin disease. Dr. Chan is an advocate for minimalist, evidence-based, and effective skincare and uses her Instagram platform to provide relevant, useful skin education. For more skincare tips from Dr. Chan, check her out at Dr. Aegean Chan on Instagram or her website.
Good morning, everybody. For those of you who don't know me, I'm Aegean Chan. I'm a board-certified dermatologist and dermatopathologist. And today I'm going to be talking about how misconceptions and misinformation in skincare has really affected my patients. This is something that can cause real harm in the skin. And so this is my perspective as a practicing physician. I have no conflicts of interest to disclose. So as we all know, false information is everywhere, and it seems to be rapidly increasing. Even the Surgeon General of the United States has noticed this alarming trend. This quote says, health information is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. And although this is mostly in reference to vaccine and COVID misinformation, I found that in my practice, this is just as relevant to misconceptions and misinformation in the skincare space. False or misleading information is causing people to make decisions that could have harmful consequences for their health, as you can see. So first, let's talk about sources of misinformation. The reason why it feels like it's everywhere, it's because there are multiple sources. So social media, of course, there are people on social media, they're just lay people thinking they're doing the right thing, sharing health information to their friends and their family. There are creators that are making clickbait, so like these sunscreen causes cancer type posts. There are also physicians or healthcare providers with underlying motives like financial gain. Of course, there are search engine algorithms that are affecting how information is displayed when searches are done. And often I'm finding they're displaying inaccurate information near the top of the search results. There are websites that look professional. And then these AI tools are pulling this inaccurate information from these websites and displaying it. And I fear that many people are just taking those AI summaries at face value. Of course, advertising and marketing disseminates misinformation, especially with the more insidious influencer marketing, sort of clean is better, et cetera, et cetera. Even major news outlets, even ones that are legitimate, can sensationalize studies. They can cherry pick statistics and generalize conclusions of scientific studies when it really shouldn't be applied to the wider population. There are extremely user-friendly skincare databases that, again, present skewed cherry-picked data to support certain agendas and doesn't necessarily present the context, such as understanding the concept that the dose makes the poison. And then there are care providers that are just as susceptible to these sources of misinformation. So maybe the PA or nurse practitioner or even physician that you see may have seen misinformation on the internet and may give you some recommendations with regard to skincare, especially if it's not their expertise. That could be a source of misinformation as well. So misinformation on the internet has been quantified. So this is just a few studies. One on infant sleep looked at 1,300 websites, and less than half of them provided accurate information. And specifically in the dermatology space, one study looked at YouTube videos on psoriasis and found that over half of these videos only discussed natural treatments, which are not the most effective treatments for psoriasis, and that only 28% actually discussed effective therapies that were grade A recommendations through the American Academy of Dermatology. So this is real. And my fear is that when misinformation is so prevalent, it starts to feel like fact. You see it everywhere. And it's almost like this gaslighting effect. Oh, I guess it must be true if it's everywhere. And with the internet and social media, these bits of misinformation are spreading faster and faster. So I've been seeing this a lot with the clean beauty movement, as well as sunscreen misinformation. So now I'm going to dive into some real life cases that really illustrate how skincare misconceptions, which may seem innocuous, actually have caused harm to real patients. So the first case is a 25-year-old female with an itchy rash in her underarms for about a month. She tried over-the-counter antifungal creams for 2 weeks with minimal improvement. And prior to the rash, she switched from an antiperspirant to natural deodorant she found at the health food store. So I get it. Health food stores are aspirational. They're selling this idea that natural is better. They have rows and rows of these natural deodorants, and many of them have labeling that is similar to this one. Say something like nothing is bad. So that implies that other deodorants have bad things in them, which we know is not true, and that this is an aluminum-free deodorant, implying that deodorants with aluminum are perhaps not as healthy for you. So I have a lot of patients that pick up natural deodorants when they're in the health food stores, but when I turn these around, I see the problem when I look at the ingredients. So this natural is better movement has replaced a lot of fragrance with quote unquote, with natural essential oils. And the most common ones are lavender and citrus essential oils, and they contain compounds called limonene and linalool. And when these compounds are oxidized, exposed to the air, they actually become compounds called hydroperoxide, and these become much more allergenic. So these are very famously, to most cosmetic chemists that are listening, that they are famously unstable, and they are the major source of these underarm reactions I'm seeing in patients. And these underarm reactions can be very, very painful and uncomfortable, very itchy, and they could be avoided if there's not this underlying driving belief that natural is better, etc. And actually, not only does this underarm rash come from misconceptions about natural skincare, but there's a second layer of fear-mongering about the safety of aluminum, particularly with regards to the risk of breast cancer and Alzheimer's. So you maybe have seen some infographics that have shown you that, aluminum, especially found in deodorant or sunscreens, etc., can cause Alzheimer's disease and breast cancer. But this has been widely debunked. The American Cancer Society on their website says plainly that there is no strong epidemiologic studies that link breast cancer risk and antiperspirant use. So there's no evidence for this claim. The Alzheimer's Association also says that there have been no studies that showed that there's a role of aluminum in the development of Alzheimer's. But, fear sells. And this fear that aluminum could be bad for you can help sell products and can lead many people to buy an inferior performing product. So we know aluminum antiperspirants are better. They actually stop sweat. And then they're also buying products that can give you a reaction. I see much more armpit rashes and reactions to natural deodorants than I do to just the typical antiperspirants you get from the store. So let's dive into our second case. This is a 43-year-old female with red, itchy, swollen eyelids for 6 weeks. She's pretty upset, been very uncomfortable. She's tried over-the-counter hydrocortisone with no improvement. And before this started, she started a paraben-free eye cream prior to this happening. So why would she switch her eye products to something that was paraben-free? I'm sure you've all seen paraben-free labeling and assume that, yeah, I guess parabens are bad. This product is safer and better. I'm going to buy this one. Everybody wants to make a healthier decision. And when you go on Google and you search, are parabens bad? This is what you see. It pulls from a WebMD article, seems legitimate. And they say right up at top, some studies show that they disrupt hormones in your body. There are databases, we mentioned the EWG, that claim that parabens are harmful to your health, but they don't incorporate the nuance and the fact that there really is no evidence to show that parabens used at the level considered safe in cosmetics have not been shown to be harmful in humans. And actually, the harm from this fear-mongering around parabens has been quantified. So this is a study that looked at the trends of allergies to a preservative called methyl isothiazolinone, which replaced parabens in many products after about 2005. So 2005 was when this sort of paraben phobia started, and concurrently there was also an incidental change in the regulations that allowed formulators to use more MI in their formulations. And this study found that in the US, the frequency of allergies to MI increased steadily to about 10.8% in 2017 and 2018. The EU, they actually saw this increase of allergies to MI. They lowered the amount allowable in products, and they found that the rate of allergies fell to about 4.4%. So this study shows that there is a real documented harm from this unsubstantiated paraben fear-mongering that led to it being replaced by another preservative that is more allergenic. And this led to thousands more people suffering from itchy, uncomfortable skin allergies. And this really impacted their lives. And it also shows the effectiveness of changing regulations and reducing the levels of MI allowed in products. Let me go back. I advanced a little bit too quickly. So now that we know that the replacement of parabens was not as good and that parabens are really an unsung hero, they were actually awarded the 2019 Non-Allergen of the Year award from the American Contact Dermatitis Society. And this is due to how safe it is and its low allergenic potential. Parabens have the lowest sensitization rates, about 1%. And again, paraben-free does not mean allergen-free. The preservative replacement instead of parabens, that replacement was due to media and social media misinformation and just a general public backlash that wasn't supported by real science or data. So just remember, paraben-free products can actually be harmful. So our third case is a 32-year-old woman who is 6 months postpartum. She comes in with persistent acne breakouts that started during her pregnancy and still haven't gotten better. She's still unsure of what's safe or not safe to use while breastfeeding and has stopped using all of her products, including retinoids and sunscreen. And she's really stressed. She's adjusting to motherhood and she has all this acne that she doesn't know what to do with, hasn't felt like she's able to use what she knows works. And when she went on the internet, this is a search that I did. This is information that everybody is seeing. One of the first results is an article from Parents Magazine, so pretty legitimate. And it says here in this tagline, no, you should not use retinol while breastfeeding. So it's pretty clear. So if I were a layperson, I read that, I'd be like, okay, I'm not going to use retinoids while breastfeeding. This AI summary from Google also says retinoids should be avoided while breastfeeding. So again, this is pretty compelling. You don't want to harm your infant unnecessarily. So no retinoids, I'll just suffer through this acne. But really, what is the truth? What does the data say? So I find this very interesting because the sidebar of these AI summaries, they give you the links of the sources, which I don't know how many people are actually clicking on them, but the first one is a link to my favorite resource for checking if medications are safe during breastfeeding. It's the Drugs and Lactation Database. It's found through PubMed, but it's called LactMed. The tretinoin page clearly states that tretinoin is poorly absorbed after topical application, so it's considered low risk to the nursing infant. And there haven't been any direct studies, but theoretically it is low risk. So if this patient saw this information, she would probably make a different decision. And if you think about it, the concern with retinoids, it can cause organ malformations during development. When you're breastfeeding your infant, it's a fully developed infant. There's no, organ development going on. So even if a little bit of tretinoin gets into your breast milk and your child ingests it, there's very little risk of harm to your infant. So it's about having the information to make an educated decision as a person in this world. And I think that the information that's out there, this flood of misinformation, is preventing people from making good decisions about their skincare and be able to treat their diseases that do affect their lives. So our last case is a case of a 14-year-old female with skin tightness, pain, redness, itch on her face for the past 12 days. And she recently started using Sunday Riley retinol, Paula's Choice BHA, and Drunk Elephant vitamin C that she got on a recent trip to Sephora with her best friends. And so all of these ingredients, all of these products have active ingredients that are irritating to the skin. And she's been using them in combination at the same time, morning, night, and this has gotten progressively worse and more uncomfortable. So this is what we would call irritant contact dermatitis, which develops when a physical agent damages the skin barrier faster than it can repair it. So any sort of irritant, so rubbing alcohol, alpha hydroxy acids, retinoids, that can strip the skin of its protective lipids and proteins if it's overused. This makes the skin barrier porous and can trigger inflammation in the skin. You lose the moisture, and that's where you get this progressive tightening and rashes developing. And really, this has become such a problem. This trend with the TikTok teens, young children learning online to use anti-aging products on their very sensitive skin. This has resulted in a proposal by a congressman in California to actually ban the sale of products with retinoids and AHAs and vitamin C to children under 13. And this says to me, skincare has gotten out of hand. Skinfluencers and the overuse of these products that can harm the skin, has harmed children enough to the point that a congressman thought that he should propose legislation to actually restrict the sale. I think this is a bit of an overstep. I don't think it's actually necessary. It didn't actually pass, but it brings up this issue. Are we doing too much? Is there too much information that people aren't digesting, and they're not able to, use skincare products safely? So, through these cases, we've seen that misconceptions and perpetuation of false information can lead to very real consequences for people. I see this multiple times a week in my clinic. And so I sort of see this as this misinformation feedback loop. So everybody's pointing the finger at everyone else. Well, the misinformation is coming from you, then the misinformation is coming from you. But I really see it as it kind of feeds into each other. So, from the media and social media, we see these beautiful results. We see these gorgeous influencers using all these products. We see them telling us that clean beauty is better. And so consumers take in all this information, it percolates in, and that dictates their buying decisions. And retailers say, oh, consumers are loving clean beauty. We only want to sell products that comply with these clean beauty regulations that, they can't have any of these ingredients, they can't have parabens, can't have phthalates, et cetera, et cetera. So they start restricting what kinds of products can be sold in the store. And then brands come back and say, well, I can't sell products with parabens in the store, so I have to formulate without parabens. And then through marketing, they're trying to sell their products. That puts out more information into, influencer marketing on social media. So it's just this endless cycle. So I think we can do things in all of these groups to help curb misinformation. So more evidence-based content, more Scicomm. That's why, BeautySciComm and what Michelle and Jen are doing is wonderful. And I hope we can get more creators and more people, really using scientific data, scientific thinking to inform what content they're putting out there. And, I want consumers to have informed decision making with information that is actually accurate, have the tools to discern what's actually good information, what are good studies, where did this information come from? What if retailers actually had evidence-based decision making rather than just looking at the consumer need? What if they actually said, well, is clean beauty real? Is this regulated? Does it make a difference? And brands have the responsibility to really support truth in advertising and making sure what they're putting out there for consumption is evidence-based and science-backed. So lastly, I just want to put in a word on dermfluencers. You guys have probably seen a lot of dermatologists in your feed lately. There are a lot of us. And I will say that dermatologists are, we have the most training. We're experts in the diagnosis and treatment of skin disease. We have 3, sometimes more years of training, learning about the full gamut of skin disease, actually most of which is not reflected in social media content. We don't just treat acne and tell people with healthy skin what skincare products to use. We treat every type of skin disease. But in this training, we do get very little formal instruction on cosmetic chemistry and how products are formulated. It's just not part of our curriculum that we have. But as somebody that is in this community of scientists and cosmetic formulators, I've learned an incredible amount of information about formulation and what goes into formulating products and being able to communicate that. I use that information in patients because patients want to know about products. So it is something that a lot of dermatologists have had to learn on the side, either, in their information they're presenting on social media, or even just to answer questions from patients because patients are interested in this. But I want you guys to be aware of just checking and making sure that the person that's in your feed that's giving you skincare information is actually qualified to do so. So check their credentials. Anybody can write anything on Instagram, but you can check their board certifications online, check their practice website and see what schooling they've had and any commercial interests and disclosures. Any of that stuff's going to influence what they tell you. So you want to have that information so you can really take everything they say with a grain of salt. So at this time, I'm going to take any questions and thank you for your attention.
And here we are for the Q&A. Thank you so much, Aegean, for that presentation. So we had quite a few questions around the safety of vitamin A during pregnancy, topically, should I say, during pregnancy and breastfeeding. Someone was talking about it specific to bio oil. Does bio oil have a retinol product, or are you referring to just like the natural vitamin A concentration in emollients? I don't know. I'm like way too ignorant of that. I'm sorry. But like, so how do we think about?
I'm not aware. I'm not aware of any sort of retinoid derivative in the traditional bio oil product.
So
Okay,
I'm
so
not
I
sure.
guess like if it's like a naturally sourced vitamin A in like a lipid, maybe not something you need to be worried about. But anyhow, I'll just maybe summarize all of the questions that I was getting of like
Okay.
how do we think about the safety of topical vitamin A for pregnancy and breastfeeding, and where are some of the current concerns coming from?
So I think that the root of it is that isotretinoin, so orally administered vitamin A derivative, and I'm sorry about my child in the background, um, that it is known to cause fetal defects. Sophia, please be quiet. It is known to cause fetal defects, and it is a category X in the prior sort of FDA pregnancy safety medication ratings. So of course that is a big no-no during pregnancy. You do not take any oral vitamin A derivatives. However, with the advent and popularity of topical vitamin A derivatives like tretinoin, over-the-counter retinols being applied to the face, that same standard is generally applied. I think if a medication is known to cause fetal defects, even if it's a low dose topically applied, in general, given the risk benefit scale, if you don't really need the medication for anything that's very medically urgent while you're pregnant, most physicians tend to say, let's be safe and avoid it completely. I'm starting to see some physicians, OBs. I heard of one patient whose OB said, yeah, keep using your retinoid during pregnancy. But I think it's, for the most part, physicians are still recommending no retinoids at all during pregnancy, even topically applied, even though there's never been any reports of fetal abnormalities from just topical retinoids applied to the face. Because as we know, when you think about toxicity, that it's very minimally absorbed. So the dose that your fetus is actually getting with topical application is probably minimal. However, again, medical legally, I think most physicians are going to say stop any retinol, any retinoid product during pregnancy. However, with breastfeeding guidelines, I think the internet is just lazy. I think a lot of the information is sourced from people that said, well, if it's can't use it during pregnancy, can't use it during breastfeeding. So a lot of the blogs, a lot of the sort of magazine articles about recommendations for breastfeeding, I think they're just sort of copy pasting what was recommended in pregnancy, which there is some data to show toxicity data. There's very minimal absorption into the bloodstream with topical and very minimal absorption into the milk. In theory, you can have some vitamin A derivative come out in the milk, but what is the risk? If you think about it, that fetus is fully formed. You have a full grown baby, you don't have that risk of organ malformation from exposure to that drug. So the LactMed database, which is my go-to reference for anybody that's breastfeeding, and they have almost every medication and whatever data is available, although there's no direct studies looking at retinoids during breastfeeding, the risk is very, very minimal. So in my practice and online, I sort of say, I think it's safe. There's no data to say it's otherwise, that using a retinoid during breastfeeding is unsafe to your fetus, because the risk scenario is completely different than while you're pregnant.
And it should be noted with retinol, there's first minimal absorption, second conversion steps required, which there is also the conversion isn't like as efficient as you may think. You're
Right.
not getting all the like active vitamin A. I've gotten some clarifications on bio oil, which is it has retinol palmitate, and so probably that's being used more for like an antioxidant kind of purpose, not for a retinoid type benefit, because the conversion required to get to an active vitamin A just isn't going to be there to give you a vitamin A like benefit that you would expect with retinol. Therefore, probably not something that you need to worry about. Okay, I'm going to just go straight on to the next question. 10 minutes is not enough time. This is probably going to be the last one. It's from
Okay.
Kagulan, who asks, Are patients with skin disorders such as eczema or psoriasis only able to use mineral sunscreens? How about combination sunscreens?
So that is also, it sort of irks me, the whole pro mineral sunscreen. And I think a lot of derms have picked up on it as sort of this blanket statement saying, if you have sensitive skin, be fragrance free, don't use chemical sunscreens. And I think, the fear about chemical sunscreens is really overblown. It's, that 2020 paper from the FDA with that statement saying chemical sunscreens are not grace. We need more data, but that doesn't mean they're unsafe. But I think a lot of physicians and even dermatologists have taken that to say, oh, chemical sunscreens are unsafe. And I've heard many dermatologists say that just in general, better be safe than sorry, just stick to mineral. And it irks me to no end because we need chemical sunscreens. I think having the option for a more cosmetically elegant formula, especially for people with more melanin in their skin, most mineral sunscreens are not going to feel good. You're not going to want to use it. And that defeats the purpose of having sunscreens. So in terms of anybody with psoriasis or eczema or rosacea or any other sort of sensitive skin disorders, I think it really is personal. I think you're welcome to try any type of sunscreen on the market, and depending on whether or not you are have any reactions to it, I think that's what should gauge what you're using or not. So unfortunately, there's no sort of blanket statement. Yes, it's safe. Yes, it's unsafe. If you have severe eczema and you are actively flaring, yes, chemical sunscreens may give you a burning type reaction, whereas mineral sunscreens won't. If your eczema is well controlled, you don't have much issue around your eyelids, honestly, probably most chemical sunscreens or combination sunscreens are fine. And for some people, it's the filter, and a lot of it is the burning of the eyes. And it's just, sort of trial and error. So a lot of people, it may be the octisalate. So you can use other combination sunscreens that don't have an octisalate in it, and you should be fine. Michelle has a great trick where she uses the mineral stick right around the eyes and then uses, whatever better cosmetically absorbed sunscreen she likes on the rest of the face. So I think you can do sort of a hybrid method as well. And it really is, it's just whatever works for you. And I think I always say, and many derms say this, use whatever sunscreen you will actually put on your skin. And obviously that you're not reacting to.
And perhaps this should be a red flag if they don't say this, that maybe they're not that reputable of an information source. And this is something that Aegean had highlighted in her presentation, kind of like the scope of expertise, and it's something to be mindful. There is no one true expert for skincare. It's such an interdisciplinary space. And so for many of these topics that we're talking about right now, there are people who do sunscreen research, sunscreen-specific formulation, toxicology. These aren't regulatory specific to that toxicology. This isn't really within the scope of dermatology, and that's okay. There are different experts. And so if somebody is saying that they're the one true expert and this is why they're right on this subject, maybe cause to get your haunches up and keep your skeptic's hat on. That's all the time.
Nuance is good.
Nuance is good. That's all the time we have for this Q&A. Thank you so much, Aegean, for that presentation.
Of course. Good to be here. Bye.
Our next presentation will be by Meredith and Dr. Ooka from the Independent Beauty Association. Starting with Meredith, Meredith Petillo is the Senior Director of Technical and Regulatory Services at the nonprofit trade association IBA. Meredith leverages over 15 years of experience in cosmetic regulatory affairs, legal advertising, claims, product testing, and product development to support IBA member companies with regulatory and technical solutions in order to grow and thrive. She joined the product development team at Bayer Essentials, where she established an in-house regulatory department. She was responsible for all regulatory compliance activities and product testing for the US and international launches for Bayer Minerals, Boxom, and MD formulations. She then returned home to the East Coast working on North American regulatory affairs for Banana Boat, Hawaiian Tropic, and Schick at Energizer, now Edgewell. She then joined Reckitt Bankster Legal Department as advertising claims manager. At RB, Meredith developed claims testing protocols, supported NAD challenges, and was responsible for legal approvals of all claims and advertising material for RB's health and hygiene portfolios, including Mucinex, Delsim, Airwick, Lysol, Veet, Clearasil, Durex, among many others. Before joining the team at IBA, Meredith also provided regulatory and technical consulting services for cosmetics and personal care companies at Product Integrity Laboratory. She holds a BS in biochemistry and molecular biology from the University of Richmond and an MS in regulatory affairs for drug, biologics, and medical devices from Northeastern University. Joining Meredith is Dr. Akemi Ooka, who is the head of supply chain and sustainability resources at the IBA, with over 20 years of CPG experience from Fortune 500 companies to small startups. Akemi's experience ranges from product development to sourcing and supply chain transformation. Akemi has worked at the Clorox Company, Method, and was most recently VP of Product at J.R. Watkins, overseeing development, quality, regulatory compliance, claim support, and third-party manufacturing, oversight for hand care, personal care, home care, and OTC remedies. She now heads up the Independent Beauty Association's Global Supply Chain and Sustainability Programming, supporting small to medium-sized businesses in the beauty and personal care sector. Akemi holds a BA in chemistry from Rutgers University and a PhD in chemistry from the University of California at Los Angeles. Without further ado, here's their presentation. And so this presentation is going to be a roundtable looking at the impact misinformation has on regulations. I think some people may be surprised to hear that sometimes it does. And so to take us through this conversation, I thought the Independent Beauty Association would be a really great association, especially because of the position that they have. They are a trade association that represents medium to small size cosmetic companies, whether that's ingredient suppliers or brands or contract manufacturers. So many positions within the cosmetics industry. Joining me for this chat, Meredith Petillo, who is the Vice President of Technical Regulatory Affairs at IBA, and Dr. Akemi Ooka, who is the Vice President of Global Supply Chain and Sustainability Resources. And I will get right to it with my first question. So probably to start to peel back the layers of the onion to understand how misinformation may have a play here. What is the legislative process from federal to state processes? And how does that enable the influence of misinformation? Also, is there a difference from long and short-term legislation? What is the landscape?
It's a good question, Jen. I'll start, and Meredith, you can kind of jump in and probably correct me if needed. But one of the things we thought we might do is share really high level, if you really take a step back, because it's not intuitive to people, how regulations are really made. There is sort of this hierarchy, right? So you have obviously the US Constitution, which governs all of our legal framework, but laws are then made by legislative bodies. So that could be federally with Congress, it could be at the state level with state congressional legislators. But you have a law that gets made, which creates these statutory provisions around an area that needs oversight. It then goes to regulators who are separate agencies, typically with people who have a lot of experience in this area that they're trying to oversee, to then translate the legal statutes into regulatory language. That moves down from regulations and then gets codified and then is shared with the public with guidance, right? On, this is what this means. And certainly you can call any of your agencies and ask them for guidance privately as well. But there is this sort of bigger framework. What people don't really know is that, there is this sort of two-pronged system where you make the law and then the law has to be interpreted into a regulation by an agency. There also, I think, is, and we'll maybe go into it a little later, there is sort of a rough process for the rulemaking that accompanies that reduction of statutory language into regulation. But there's opportunity for input, influence, which information and which can include misinformation to permeate a lot of different places in that process. I don't know if Meredith, you have thoughts as well.
No, that was an excellent overview. And I think to add on to that, speaking about the legislative process and some differences from the federal to the state level is just the speed at which things are happening. So MOCR is a really good example for us to just take a look at as a piece of federal legislation. So it took a very long time for modernization of cosmetics legislation and regulation to materialize and to actually pass through Congress and the executive branch. So we now have a new law. So that took, decades in the making. Whereas at the state level, things can move much, much, much more rapidly. So a law can be drafted, proposed, and passed incredibly quickly. So if we're talking about, points of potential misinformation getting worked into the legislative process, the speed at which things can and are happening at the state level, I think is something that's very interesting to look at.
Just to add on to that, there's some complexity as well at the state level because different states have different ways these laws materialize. So for example, SB 54, the extended producer responsibility law in California, there were two paths for that to become law. The bill that did become law was one that was hammered out with a lot of different stakeholders. There was a competing law that basically was being put on the ballot, I think at the time in California. Essentially, if the negotiated law had not been signed by the governor, the threat was that the voters were going to vote on the other bill, which I think had much less collaboration and much maybe fewer stakeholder input, than the original one. In the end, I think the governor signed the negotiated agreement, but it just shows like there are also these really different pathways for laws to be enacted. And that also makes it really challenging just from like an information management standpoint, and then ultimately seeing kind of like what gets passed. Once you get from a law to the regulatory body that needs to reduce this into final rules, there's actually a process that's followed there. We showed a little slide here that just demonstrates all of the places where there is formal input sought from the public to create that regulatory guidance. There are a lot of formal places where where regulators are asking for public comment or input. They may have meetings with specific stakeholders. So there are a lot of input opportunities into that process that are formalized throughout rulemaking. And those are areas where, again, like information, misinformation can make it into the process. And then there's a lot of like informal areas where information sort of gets into the process. So like as staffers are trying to summarize information for legislators to vote up or down, or want to add something into a bill, they have to go somewhere to find information. There are a lot of other places where you can see information, good or bad, work its way into the process. The other thing that's happened this year that's a little bit new, and we'll have to see how it plays out, is the Supreme Court ruling on Chevron deference. That was essentially a provision that allowed regulators and agencies to interpret federal statute and rely on the expertise embedded within the agency. And that's now been really stripped away at the federal level, which effectively means that federal legislation has to be much more prescriptive in a way, because it can't necessarily be left open to interpretation. And what that means, I think, is that there is this really big difference now between how agencies may work at the federal level and what kind of oversight and role they play in deciding regulations versus at the state level, because that's not a ruling that necessarily affects the state level. So what you're seeing is state legislation moving really quickly, and they still have a regulatory framework. And then you have federal that's moving slowly, but has sort of lost some of its traditional regulatory guardrails. So it's a little bit unclear like how that's going to play out over time.
To give one additional layer to that and just a bit of an example. So we're all sort of sitting on the edges of our seats waiting for some proposed rules from FDA in terms of MOCRA implementation. Those proposed rules are the things that Akemi is speaking about that would be potentially impacted by Chevron deference. That's the regulation that we're talking about, not the statute, not MOCRA, the law, but these proposed and then final rules from the agency overseeing, in our case, cosmetics. So any ambiguities in the law and in the resulting regulations, time will tell now what the impact of that Supreme Court case will be. So we don't have a crystal ball to say, whether there will or will not be impact, or what the scope of those impacts could be for future regulation for the cosmetic industry at the federal level. But it is certainly something that needs to be watched and is going to be watched across every industry, certainly not specific to cosmetics.
This is a topic that I find myself thinking about a lot. What is the impact of misinformed consumers? Also, can legislators be misinformed? Maybe this is an obvious question, but I'll ask it anyways. What's the balance of appeasing constituents, short terms of selected elected officials, and the dynamic of politics versus science in policy development?
So if I could handle the first part of that really quickly, I think, it might be a bit of an obvious statement, but what is the impact of misinformed consumers? Can legislators be misinformed? Legislators are consumers. They're all the same. They're all the same pool of people. So I think, it's important to note that our elected officials and the regulators that are working at the agencies overseeing these products are all consumers as well. So when we're talking about misinformation, working into the consumer's world, it's just inherently baked into what legislators and regulators are also grappling with on a daily basis at work and in their personal lives. So when we talk about, misinformation as it applies to consumers, those who are making these legislative decisions are right in that same pool.
To that point, then there is an awful lot of opportunity for misinformation or misconception, right? I think that sort of by definition, these representatives are representing their constituents. They should be sort of an everyday person, that is representing, their district or their jurisdiction in this legislative body. It's I think quite challenging to think about overseeing the number of issues that legislators are asked to review. And there just isn't really a scenario where you have legislators that can reasonably be expected to have sweeping expertise over all of the things that they are being asked to oversee. And so where are they going to go to get their information? They go to their staffers. Where do their staffers go to get information? There are opportunities for, misinformation to leak into that information gathering process that staffers do and that legislators do, because, they're not an expert on like some kind of obscure energy alternative, right? That may be new and has to be regulated. I mean, you can think about tech and whether legislators are really prepared to weigh in on generative AI and how quickly innovation moves. We talked earlier about Chevron deference. Like at the federal level, effectively, that's just pushing legislators to have to, again, be like much more prescriptive, descriptive, right, in statutory language. Well, what do you do if you're not really an expert in what you're being asked to, write legislation on? Where does that expertise then come from? legislators are consumers and they can be misinformed. There's a lot that they're asked to do. It's impossible to be knowledgeable on everything.
Now, speaking to the information gathering front for legislators, who are some of the stakeholders who have a seat at the table for this process?
So when you're talking about something like cosmetics that's so ubiquitous in pretty much everyone's lives, the stakeholders run the gamut. It's everyone from industry, for those who, our professional lives are dedicated to this product category. There are a lot of NGOs and so non-government organizations that their mission and their work is focused on this product category. There are universities and researchers who clearly have a strong professional interest in either these products, the ingredients, the test methodologies that are used that surround this industry, and then, of course, the consumer. So all of those voices are very strong and very passionate and are all valid and active seats at the table for these conversations. Akemi, what did I miss? Because I'm sure that I missed something.
IBA, like any of these other stakeholders, also has a vested interest, right? I mean, we're a trade association that acts on behalf of small to medium-sized entrepreneurial companies in the beauty industry. So we're really focused on small business interests. We're really focused on freedom to operate for this industry sector. And that's the point of view that we bring to the table when we're sitting with lawmakers, right? We also are interested in having legislation and regulatory policy ultimately be seated in, common sense and evidence-based science. The other thing, we didn't touch on it from your previous question, but I think that does become really challenging. You'd asked a question about sort of the term of elected officials. And some of what we see too is that you've got well-meaning, probably politicians and lawmakers that are acting on issues they think are really in the public interest because they've heard about it somewhere or their constituents are asking about it, or maybe some of these stakeholder groups are asking about it. But those could be just as well fueled by misinformation and misconception. And so the result could be like really short-sighted legal or policy creation because like the issue isn't really well developed and fully formed. And as you get into more technical fields for oversight, the policy that gets created could actually be a lot further ahead than the actual scientific data or understanding of that issue at the time the legislation is being proposed. And so there's some, I think, particular challenges for technical areas or areas that require more data gathering or more time to get data and make sense of what's going on.
And now what I'm going to say now is not the views of the Independent Beauty Association. They are my views. Maybe it's obvious, though, because you know who also has a seat at the table, obviously. NGOs like the Environmental Working Group. Throughout this summit, you would have heard a lot about some of the misinformation that has stemmed from some of the communications that they've put out there. But they have the ears right now because of the information landscape and fear-mongering that's taken hold of the industry. They have the ears of politicians who want to do the right thing. And so this is going to lead really well to my final question. Again, what I just said was my views, not the views of the IBA. But what's the importance of advocacy from industry? Maybe this is obvious after I've just said what I've just said. And what can that look like with respect to combating misinformation?
Education is just, it's super important. It provides the context for compliance. As we mentioned before, often lawmakers and regulators who are overseeing specific sectors or issues or just are not experts in those areas. So the more we can get industry advocates involved, the more we can illustrate the practices and realities of given businesses, but also the impact of, legislative or regulatory policies, along with the realities of compliance with these laws and regulations.
I echo that. Education is just, it's so critically important for myriad reasons. Going back to some of the questions, Jen, that you had asked previously, right? We're talking about the short term limits of legislators. Regulators change their roles within the agencies. The importance of industry advocacy is a constant education and re-education, because there are things that are very obvious to those whose professions exist within this industry that are not very obvious. For those of you who work in the cosmetics industry, I'm sure in your personal lives you've experienced this, that not everyone is aware that the brand on a product may not have owned the plant, right? The manufacturing facility where that was made. Contract manufacturing is a big part of the beauty industry. And so why is that important? Why would it be important for a legislator or regulator to know? Because if they're talking about defining manufacturer, and if responsibilities or obligations are being assigned to a manufacturer, we should all be speaking the same language, making sure that they are understanding the current lay of the land from just those basic fundamentals through some of the really complicated and very complex areas that proposed legislation is going right now on some really important issues, across formulation, packaging. There are some very complex things, but if that initial foundation and the education isn't there to really understand one another, it makes it very easy for there to be, misinformation, or just not even misinformation necessarily, but just, something as simple as that, right? Like if I'm writing a guidance document to cosmetic manufacturers, but I really want the brands to be reading this document, it's important that the title reflects the audience. It's not only a one-time conversation of education to make sure that those who are involved in a particular bill get the information that they need to make an informed decision, but it's making sure that the next group in line, the next group of elected officials, their staff, it's constantly being refreshed and being brought up to speed as the industry evolves and changes and innovates as well.
As we're coming to the close of this presentation, and we will have time for Q&A, I just wanted to put this out there. When you're thinking about advocacy, especially if you are someone who is an independent professional or maybe a small business somewhere or medium-sized business, you're not like a conglomerate with a whole bunch of money to throw at advocacy and making your voice heard. I think that if you want to do something in terms of advocacy, consider joining a trade association like Independent Beauty Association, because while individually maybe you don't have a voice, or maybe you don't feel that you have a voice, especially with the tools you may have at your disposal, the value of joining a trade association like the IBA, who is there specifically for medium to small size companies, is to come together and make your voice heard, to advocate for reasonable, sound legislation that is going to be feasible for you. Because I think smaller brands sometimes are not aware of sometimes the economic impact of some misplaced legislation. And this is something that's going to be touched on throughout the day today and already has, but I just want to put it out there. I also wanted to say that the inspiration behind this whole summit was the thought leadership from the Independent Beauty Association, who has spearheaded this truth and beauty conversation at conferences. So far, I think I've moderated 4, maybe it was 5 different panels in collaboration with mostly the Society of Cosmetic Chemists. They've done some independently as well. Maybe this could be something also to other conferences. Consider collaborating with the IBA to host conversations like that to help bolster education, truth, and beauty. And so that concludes this presentation, and it's now time for Q&A. And we are just about to go live with Meredith and Akemi. Here we are. I really liked this question. Well, firstly, thank you so much for that presentation. But I really liked this question from Dan. So they say, well, glad you talked about politicians not being experts. I'm a member of a group to aid MPs to gain the knowledge. We struggle to get scientists on board because politics. How do we get them to help?
That is a great question. And I think that there are professionals in this industry like yourself, Jen, that have been really great about pulling together experts and those who are willing to communicate the science. I think, that question could be a whole nother session in and of itself. It's sort of what are the topics that you're looking to provide education on? Are you looking for academia assistance, or scientists that are in-house with brands? There are a whole bunch of different ways to approach that. Akemi, I don't know if you had some thoughts right off the bat.
Yeah, it's an interesting question, because I think one of the challenges, I'm a scientist, and I think one of the things that's hard is sometimes the communication to lay people can be really challenging for scientists, and that's really how you have to think, right? You almost have to think on two planes, and so to try to get more scientists involved, it's like, we need your expertise, because we need evidence-based information to be able to share with politicians and their stakeholders and maybe lay people in the community. But we also need to be able to translate it in a way that this audience understands. So I think, I think that scientists could be really helped by, whether it's groups like ours, like the Trade Association, or your group that says, hey, we're going to take your information and translate it into language that is clear and understandable to people in formats that meet them where they are, right? And as frequently as we need to make sure that we sort of get the message out, because you can't just say it once and have it been done and then it's done. I mean, that's why, we've partnered with Jen to have multiple conversations around this, because just one time is not enough. That's a point in time. So I think the more you can help scientists understand what role they play in that communication and education of lawmakers, and kind of help them along that journey, I think that that's really helpful.
I think meeting them where the key piece as well. And I'm not sure, there are obviously differences between the UK and the US, but the staffers are critically important here in the US. So where are they looking for information? How are they consuming this? So there's, you ultimately need to get the message to the decision maker, the MPs in this case. But, there's also ways through, social media. IBA has a really great Instagram account where, some of this, just very fact-based information is presented in a really consumable, concise, succinct way. So I think Kemi's right, trying to develop different strategies of how to present the ask to the scientists that you need, their input for, could be really helpful.
And also, like, as I'm listening to you, I'm thinking, like, how a scientist may react to, like, please educate the politicians. And that's like, oh, I don't want to do that. I'm kind of triggered. I went to a science diplomacy summit for my university, and I left with, like, oh my gosh, that's terrible. That sounds horrible. But I take a different model of how do I put communication out there. And so there's many ways that you can communicate to the public. And so just putting out accurate information just in general can be a place of advocacy, because then the other people may find your information and maybe they're better communicators than you, for example, and that can help with that kind of advocacy conversation. We're over time, but I just wanted to quickly answer. There was a question from Kajol of, like, how do we join IBA? If you want more information, go to independentbeauty.org or reach out to, what's the email? Is it info@independentbeauty.org.com? So go there and check out their Instagram page at independentbeauty.org. Thank you so much to Meredith and Akemi for agreeing to participate in this conversation, and to the IBA for the thought leadership as a trade association for this topic in general.
Thank you, Jen.
Thank you.
Our next presentation will be by Dr. Andrea Love, who's an immunologist and microbiologist with over a decade of experience in basic sciences, translational medicine, and clinical research. She is a subject matter expert in infectious disease immunology, cancer immunology, and autoimmunity, and is adept at translating complex scientific data and topics for the public and healthcare providers. Andrea works full-time in life science biotechnology in the fields of vaccinology, immunology, immunotherapy, cancer cell and gene therapy, and more. She is author of Immunologic, a newsletter and science information hub that communicates evidence-based information on science and health topics. Andrea is also executive director of the American Lyme Disease Foundation, a columnist for Skeptical Inquirer, and was the 2023 American Medical Writers Associate McGovern Award recipient. Andrea is passionate about science literacy starting from an early age and encouraging children towards a career in STEM. Without further ado, here's Andrea's presentation.
So today I want to talk about the impact of misinformation, particularly science misinformation in the cosmetic space and beyond what might be obvious. So a couple of statistics that might surprise you, but it really sets the stage for why we struggle with combating misinformation is the fact that only 28% of Americans are considered scientifically literate. And in the context of this, we're talking about civic science literacy, where civic science literacy is not simply just taking in information and understanding it, but it's knowing where to find credible information, how to make sense of it, how to use that information to actually engage in discussion or making decisions based on it. And that includes voting for things or having conversations with your legislators who are actually the ones that make policy and law. So only 22% of high school graduates are considered civically scientifically literate. And this is lower if you look at people with just a high school diploma. But on the flip side, 52% of adults consider themselves interested in science and technology issues. And so this disparity is obviously problematic because if people are interested in it, but only 28% of the population can appropriately interpret and make decisions on it, it means that those individuals may be relying on misinformation, either intentionally or not. So when we think about what underpins cosmetics information and really all science and health misinformation, it really relates to this idea of chemophobia, which is the irrational fear of chemicals. And this chemophobia causes people to believe that chemicals are inherently harmful, no matter the dosage, no matter the exposure, no matter the route of exposure, no matter the species. And everything is chemicals, right? We are sacks of chemicals. Water is a chemical, air is a mixture of chemicals. And so we really need to get people to view chemicals in the scope of context, right? Any chemical can theoretically be harmful at a certain exposure, even things that are essential for life. But often you'll hear messaging related to wanting natural ingredients, or people can't pronounce certain chemicals or ingredients, or they say they don't want things like preservatives or additives, right? Added chemicals. And these really play into this appeal to nature fallacy and the appeal to emotion. And so what ends up happening is that people falsely believe that naturally derived substances are automatically better, safer, ecologically friendly, that things added to substances or products are inherently harmful when we're adding those things for a good reason. And the fact that a chemical has a very long, complex name, which to scientists helps us understand how it's structured and what groups are attached to it. Those things really exploit that low science literacy and this chemophobia. And so chemophobia is further exacerbated by media articles that don't present context. They're just making these kind of blanket statements without nuance. And what they're doing is they're using confirmation bias. People are reading these and they're like, see, I told you, these things were toxic. I told you these things were harmful. And it really exacerbates and enhances that fear. And that fear makes people less likely to actually listen to nuance and fact. Beyond that, the general public is unlikely to fact check after reading something, especially if that evokes emotion. And so we saw that in the context of the California AB 418, where they banned red dye 3, and every single media headline was saying red dye 3 is banned in Europe, but it's not. A simple fact check would have explained to people that it uses a different name because it's regulated by the European Food Safety Authority, and they name food colorings differently. It's called E127 in Europe. And of course, people are more fearful of human risks, human-made risks, especially things that are synthetic, because of this appeal to nature fallacy. And that's particularly true when you're talking about, things that you're putting in or on your body, or decisions that you're making that you feel like you have direct control over. And yes, there are organizations, I'm looking at you, the Environmental Working Group and Consumer Reports and Children's Health Defense, who actively profit by promoting misinformation. They make money for themselves, they make money for their donors, they make money for their vested interests by scaring people about things that we don't actually need to be scared by. So I want to talk about parabens because they're such a good case study in this sort of health misinformation space. So parabens are a class of chemicals. They're multiple different chemicals, and they're esters of 4-hydroxybenzoic acid. What ends up happening is that we remove this alcohol group and we replace it with an ester, which is an oxygen, with these different functional groups. So you have methylparaben, which has a methyl group, ethylparaben, an ethyl group, propylparaben, a propyl group, and so on and so forth. But these are all different chemicals. It's like saying mushrooms are harmful when we say parabens are harmful, because each of them are different, even though they're in the same bucket. And so we know that not all mushrooms are harmful. There are some that are harmful at certain doses, and there are plenty that are perfectly safe, even if we eat a lot of them. And so we need to view chemicals broadly in the same sort of context and nuance. But these are important preservatives that prevent bacterial and fungal contamination in products, and they've been used in products, cosmetics, medical, since the 1920s. We've really had no consequences from these. Unfortunately, the rise of social media and this kind of expansion of the appeal to nature fallacy that really kind of goes along with the unregulated wellness industry has led to this expansion of this clean beauty industry that claims things are chemical free or they're not filled with toxic chemicals, yet the chemicals they use are better. But it really placed this scrutiny on chemicals in formulations. And so this really accelerated with this study that was wildly misrepresented that came out in 2004 in the Journal of Applied Toxicology. And so what the study actually looked at, and this was really where the fear was fueled, was they basically took 20 different breast tumor biopsies, they digested them, and they used analytical chemistry techniques to look for trace levels of these 6 different parabens in question in these breast tissues. And what they found was there was really small levels of these things. And we're looking at this in units of nanogram per gram, which is, in other words, called parts per billion. So the first thing is that this whole study was based on correlation, not causation. These were breast samples that existed already, and these researchers kind of took them and were like, well, let's see what we can find in them. On top of that, there were no healthy controls. They didn't have healthy breast tissue to compare to. They didn't have healthy any other tissue to compare to. So they're making these insinuations that somehow these parabens are related to the breast cancer because they were found in the breast tumor. But there's no way to actually say that because it wasn't related to stage of disease. It wasn't related to exposure relative to diagnosis. These were biopsies that were just like in storage, and there was really no contextual information, and you couldn't even standardize or normalize to healthy tissue because those weren't included. They also took all of those 6 different chemicals and just kind of added them up. And like I said, these are different chemicals. They have different interactions. They have different functions. And they made these assumptions about how these are probably related to breast cancer because parabens have this estrogenic impact. But if we think about these levels that we're looking at, these are minuscule levels that have no biological relevance. For context, a part per billion is the same as 1 second of time across 31.7 years. So just think about that scale for a minute. That this study really was grabbed by the reins and exploited people's health anxiety because we're talking about hormone disruption. We're talking about cancer, especially breast cancer. We're talking about these chemicals that are in cosmetic products, and it really exploits that chemophobia. So what's real? Parabens have what we call weak estrogenic activity, which means they can mimic estrogens weakly. This is going to be important. So this is estrogen signaling. I'm not going to get into it, but estrogens bind estrogen receptor, and this leads to downstream phenomenon like cell survival and growth and reproduction. And so these terms that you hear like hormone disruptors or endocrine disruptors are basically things that can mimic a hormone and can interfere with these signaling pathways. But the weak part is really important because first, parabens, as soon as they get into your body, they're rapidly metabolized into that precursor, that hydroxybenzoic acid, and that's excreted in urine. And so a lot of studies that look at paraben levels, they're looking at excreted urine, which isn't an indication of what's being absorbed. It's literally an indication of what's being flushed out as a waste product. But on top of that, when we say it's weak estrogenic activity, when we look at estradiol, which is one of our biofunctional versions of estrogen, the binding affinity to estrogen receptor of estradiol is 100,000 times higher than ethylparaben and methylparaben. And it's 10,000 times fold higher than butylparaben and propylparaben. So when we say it's weak, it is not something that we need to be concerned about, especially at the levels of parabens that we would find in products. It's not outcompeting estrogens. It's not going to be clinically interfering with this sort of pathway. So what do the data actually say when we're thinking about how parabens impact us? So the reality is there's hundreds of studies that have examined the safety, the toxicology, the potential long-term impacts of parabens, and these include animal studies, toxicological testing, epidemiological studies, clinical trials, and regulatory reviews. And they have all concluded that parabens, especially at the levels we would be exposed to, are perfectly safe. There's actually an acceptable daily intake for parabens, which is 10 milligrams per kilogram, and that's ingestion. That's not even using them on your skin and skin products, and that's per day. So say a person weighs 70 kilograms, they would have to consume nearly a gram of parabens every single day. Now we're talking about topical application on our skin. When we're using these products, the concentrations of parabens that are needed to inhibit that microbial contamination really don't exceed 0.3%. So that's 0.3 grams per 100 grams of product. Pretty much have to bathe in a tub of these products to have any sort of potential risk. A lot of the studies when they talk about these reproductive issues and these hormone signaling issues, this is really when we're looking at animal studies that are being force-fed parabens or compounds containing parabens for long periods of time. And these studies are looking at orders of magnitude higher dosage. All global safety agencies that assess these sorts of compounds have all concluded that parabens that are used in cosmetics are safe at levels we would be exposed to. Unfortunately, misinformation continues to circulate. The misinformation ecosystem is really exploited by a few different factors. So you have media amplifying these stories or these studies that are being taken out of context that are not representing the reality of the study. You have misinterpretation of science, as wonderful as it might be, everyone cannot do their own research. Everyone, even in the science field, has a niche, an area of expertise. And outside of that, it can be really difficult to critically analyze data because if you're not familiar with the research model being used, you can't even interpret whether it's relevant to the study they're conducting. Oftentimes, we have people using the wrong experts. So for example, particularly in the cosmetic space, we often have dermatologists who maybe are not as well versed with the chemistry of products that make fear-based claims that can scare people. Because it's this appeal to authority, they're a clinical provider, it can cause undue and unfounded fear. You have the clean beauty movement, which makes a lot of money marketing fear. Oftentimes it's positioned as paraben-free is safer. And then, of course, we have the social media landscape where you have influencers who are given product or paid to promote products or disseminate fear-based messages. We're plagued with headlines and stories that are insinuating, oh, parabens are linked to hypertension and pregnancy. Americans are being poisoned. We need to ban parabens, paraben-free face washes. Parabens are skincare nasties. You should be avoiding these ingredients. And this one actually came from a dermatologist where they say that parabens are one of no ingredients, but there's actually no data to demonstrate this at all. It's really all based in this chemophobia. When you're thinking about the misinformation landscape, it goes beyond just this is false. It starts with the media sensationalism, and it really branches out from there. And this is going to underscore the far-reaching impacts. From there, the media sensationalism leads to the spread of misinformation. That spread of misinformation causes consumer fears. That consumer fear leads to public outcry. The public outcry drives market demand for companies to now make things that don't include these chemicals that people are scared of. Raw material suppliers, you have formulation chemists, you have companies that are trying to figure out a way to produce a similar product that performs similarly, is similarly safe, is similarly effective. It's very often the case that if they're looking at a replacement, it's not going to have as much data. If companies do reformulate, it legitimizes that misinformation. And it's not because it's science, it's because consumers are saying, I want this product. And companies are trying to balance what's science-based and what people will purchase. That legitimization leads to the implementation of things that are anti-science, policies, laws, bans of certain chemicals that will then lead to interference with regulatory oversight and the ability of toxicologists and regulatory experts to be able to autonomously evaluate safety of these compounds. And yes, it can impact other industries as well. This can actually worsen health outcomes and economic outcomes. So in the case of parabens, forced reformulation because of public outcry and unfounded fears has led to a couple of replacements. One example is phenoxyethanol. Phenoxyethanol is used as a preservative. It's an antimicrobial, but it's not as effective against fungi. It's only really effective against bacteria. So if you need to have a product like going to resist the growth of all pathogenic microorganisms, you need to include other chemicals. It's actually less stable than parabens, so you have to augment it with other stabilizers. So it needs higher concentrations compared to parabens for similar efficacy, and it's more expensive as a baseline. Now you have an increased cost of raw materials, increased cost of manufacture, and increased cost to you, the consumer. So now you're paying more for something that is maybe not as good and certainly not superior. Another example is methyl isothiazolinone, or MIT. This is one that was also used as a replacement as a result of paraben fears. And similar to phenoxyethanol, it's less effective against fungi, so it needs to be added with other antimicrobials. It is less expensive, but because it needs to be combined, now your total cost is probably equivalent. But the big issue here is that MIT is actually less safe. MIT has high allergenic potential compared to parabens. And so these switches in these products to MIT based on this public outcry actually led to an increase of dermatologic allergies. So you're actually legitimizing it and you're worsening the health of people's skin as a result. Then you have the other side of the coin where you have preservative-free products. So people are like, well, we don't want to include parabens because that word is scary. So we just won't include preservatives. Now, there's an obvious risk here because these are products like that people are using over time. They're opening, they're closing, they're reusing, they're putting their hands in it. There's very obvious sources of contamination with pathogenic microorganisms. So this can lead to skin infections, eye infections, and systemic illness. So there's been a lot of examples of this, but a few that I want to call out. The Yes to Baby carrot wipes in 2013, they had severe contamination with Burkholderia cepacia, bacteria that can be really, really serious, especially in immunocompromised people. And yes, that includes children, infants, which these products were designed for. Honest Company had baby powder and it was preservative free. And this was recalled because of microbial contamination. Burt's Bees baby wipes had various contaminants, including Pseudomonas aeruginosa, Pseudomonas fluorescens, and Enterobacter gergovii. Because of lack of preservatives, all of these can cause serious human illness. Beauty Counter baby oil was contaminated with Staph aureus. Staph aureus can cause serious skin infections, impetigo, but even more systemic infections like sepsis and cellulitis. Baby Ganex, they market as free from harmful chemicals. They had preservative-free baby wipes and lotions. These had bacterial contamination. Because of this growth of these indie, these small beauty brands, these green products, these clean products, there have actually been quite a few recalls from pathogenic bacteria like Staphylococcus epidermidis, Pseudomonas aeruginosa, and these are actually global. So regulatory agencies have really had to step in and reiterate that preservatives are critically important to maintain product safety of cosmetics and of skincare. And that's particularly true for things that you're frequently opening and closing in moist environments where fungi and bacteria like to thrive, like things that you might store in a bathroom. And the problem again here is that this reformulation is giving legitimacy to this claim that parabens are inherently harmful. Impacts go beyond the beauty space because parabens are not just used in skincare and cosmetics. And this is really the harm of the misinformation is you have a situation where you've demonized a product that you think only exists in a single industry, but it's going to impact a lot of different things that we interact with on a daily basis. In the context of medical products, we use parabens for preservatives, for things like topical creams, ointments, eye drops, and injectable medications. And so the same public outcry and misinformation in the cosmetic space has forced a lot of companies to reformulate, even though there's no evidence to support these claims about parabens. We're thinking of antifungal creams, corticosteroids, and antibiotic ointments. Pharmaceuticals, there's injectable medications. There are certain multi-use vaccines that use parabens. Most of those are in developing nations. And you have a lot of ophthalmic products, especially contact lens solutions and eye drops. And you've had similar issues with contamination as a result of these reformulations. Keratitis, which is inflammation and infection of the cornea, this can actually lead to blindness. And there's been several outbreaks from eye drops that were manufactured without preservatives as a result. Cellulitis, sepsis, and other infections. This misinformation landscape is beyond just, oh, my lotion doesn't have paraben, my shampoo doesn't have parabens, it has really broad implications. How do we combat this misinformation? If you're a scientist, if you're a scientific expert, or if you're a health expert, we have to make a greater effort to discuss things. We have to discuss the limitations and the relevance of expertise. If you're not an appropriate expert and someone seeks you for guidance, refer them to a relevant expert. None of us are experts in all things, and we need to help combat the notion that that can be true because it just simply is not. We need to use vocabulary that the public can understand, and we need to not dismiss fears, but explain to people why those fears aren't supported by everything that we know up to this point. Media has a critical role to play. They need to be better about focusing on the limitations of scientific evidence and how to interpret data. They have to make a greater effort to report things without clickbait, without bias, without misleading headlines, without omitting the fact that this was a Petri dish study, or there was no causal data found, or they used a sample size of 3. That's really where the fear starts. And once that misinformation is out the door, it is so much harder to combat it. And of course, they need to seek credible experts. If you're talking about safety of a chemical product, a healthcare provider is not the person that is going to provide that information. If you're seeking how you might treat something, then we want to go to a healthcare provider. And then members of the public, you guys have a role to play too. Understand headlines are not accurate. They're designed to drive people to their website to click on those articles. You see something, especially if it evokes fear, cross-check it. Look at other sources. Cross-check with credible sources. Remember that just because someone has a lot of followers on social media doesn't mean that they're credible, especially if they have no relevant expertise. And if you have a visceral reaction to information, pause before you share it. Do a quick logic check. Does this make sense? Do I think that this is real? Most of the times you're going to find, no, this definitely sounds exaggerated. Misinformation is a public health crisis. And in order to combat it, we need resources. We can't continue fighting this game of whack-a-mole. We need infrastructure. We need funding. We need societal ways to combat this misinformation landscape that is really accelerating. Thank you. And I'll take any questions. Oh, they say they can't hear.
My mic was muted. I am so sorry. Okay, I'm going to ask the question again. I'll ask the question again. So, this is from Dan, who says, I love your work, firstly, and I use my platform on LinkedIn to talk about topics as a chemist, but the constant exposure to misinformation and the pushback are hitting my MH? What do you mean by MH? How do you cope? Any tips? So how do you cope with maybe you know what MH means, but how do you cope with this like berating of firstly scientists online, but also the constant influx of misinformation? And you see it a lot on LinkedIn too, where you would expect the information to be a bit better, but what do you think?
Yeah, I mean, it's a great question. I don't have the answer. I think he's referring to mental health. And
of course he is.
And this is something that I deal with too. I mean, I have mental illness and I'm very open about it. And I talk about it a lot because I think it's really important to discuss it and destigmatize it. But yeah, I mean, it gets to me as well. And, sometimes it's a sign that, you can't do this in isolation. You can't combat misinformation if you're pouring from an empty cup. And so you have to take care of your own, health and well-being. And there are days where I'm like, listen, it's too much. I have existential dread. It feels like the misinformation landscape is really accelerating. And there's a lot of reasons for that, including social media and the unregulated wellness industry. But, you've got to preserve and focus your efforts when you have the bandwidth to do so. So there's absolutely nothing wrong with that.
Now, this question comes from, I'm not sure you're the person to answer this, but perhaps there's a way that you can address this question. This is from Kim, which is why not create safer preservatives in general? And like there is a lot of development in, for example, multifunctional ingredients, and there's a role, but also like some ingredients actually have really good safety data. And also when you're constantly chasing this bandwagon and limiting the palette of preservatives, maybe there's an issue there. What do you think?
Yeah, totally agree. And obviously I am not a chemist. I use chemistry in my job, but I'm not the one kind of designing new compounds, but I will say that this kind of question really goes to the issue, right? There's a perception that parabens are unsafe preservatives, and they're not. There is over 100 years of data to demonstrate that parabens at the concentration we're using as antimicrobials, as preservatives, are safe for use. And actually, as Dr. Aegean Chan noted, they have a very good skin safety profile as well. They're non-allergenic. So, we have to kind of separate that misinformation and understand that these compounds actually are quite safe. And also, note and acknowledge that now that we have advancing science and advancing technology, there is the potential and the opportunity to expand and develop new compounds. But we also need to understand that when we release novel chemicals, novel treatments, novel therapeutics, they're always plagued with misinformation, because then it's the appeal to novelty. Well, we don't know because it's new. So it's a double-edged sword.
This next question comes from Mark, and I'm not sure how familiar you are with the output from the PCPC and CIR or other cosmetic-specific trade associations. Maybe this is a trade association-specific question that could be more generalized. But the question was, why does PCPC/CIR not come up with consumer-friendly systems like EWG? That's an obvious way to combat misinformation. I will also say that PCPC recently launched an update of their cosmeticsinfo.org that I think is an improvement. So it looks like that they're trying, but maybe I will make this a two-pronged question with my own question that you brought this up, and I just have to ask you about it because I know there's a lot of really influential people watching that can do something. And so, like, okay, well, you've got the role of putting out information from trade associations, sure, but also for science communicators who are independent. So how do you see industry groups creating or helping support infrastructure to make science communication, like what we're currently doing, something that is actually sustainable?
Yeah, I mean, I think that this really goes to the crux of it. It's, and I know you and I and Michelle and many others kind of, commiserate about this never-ending game of whack-a-mole, and we think about organizations like the EWG who bring in $13 million in revenue every year, and we're doing this in our free time outside of our modest scientist jobs, and we don't have the time and the resources and the reach and the ears of the politicians that they have. And so there does need to be some sort of organized infrastructure that can help spread credible information. And we see every single day that there's a new app that's rating products, and this is not just cosmetics, it's food, it's other consumer products like Ooka, like the EWG's rating app. And these are really all based in misinformation, and they exploit this chemophobia and they scare people unnecessarily. So I've had this vision of some sort of app like that is actually the nuance, like the evidence-based version. But of course, that's not within my power to create, but there are a lot of people doing a lot of important work that could be leveraged into creating these user-friendly, informative hubs that help alleviate this unnecessary fear, that help start to combat this misinformation landscape on a broader scale. And I really implore people who know legislators, know politicians, to encourage them to actually seek the input from credible science organizations, because we see legislation coming out of California that is lobbied from the EWG, and they're banning chemicals that actually are not posing risk to health, but it's very performative, and we're not actually addressing the things that impact health. And so it's really multifactorial, but it needs to start with people who have financial resources and networks of other individuals that can help amplify these messages, because we're not taking sponsorships and funding from people with ulterior motives. And so we don't have the bandwidth and the reach that those who spread misinformation do.
And so there's going to be more conversation about this throughout the day as we have more focused presentations on science communication. That's all the time we have. We have gone over time, and I'm so sorry to all my audience. I tried to crunch in so much information in this summit, and so it's really hard to keep on time with so many presentations. So your lunch break will be a little short. I'm sorry. But thank you so much to Andrea. I also, before I leave the audience to flip to the next screen, is please share. If you value what we're doing, you can do something here. You want to see more truth in beauty. You want to elevate the information that Andrea just shared here or any of the other speakers throughout the day. Share and follow them. They all independently do really great work in their relevant fields. And yeah, you can share the live stream that you're watching. Thank you so much to Andrea for participating in this summit. Oh, and I know she's going to be in the chat probably. So if you have more questions, you can keep talking with her.
Thanks, Jen.
As mentioned at the start of the summit, over the last 2 months, Michelle Wong and I have been collecting entries for a Scicomm contest, brought to you by BeautySciComm, our side social enterprise dedicated to increasing the quality, volume, and reach of accurate beauty science content. Part of that includes support to prospective Scicommers. For this contest, we partnered with the Society of Cosmetic Chemists, Cosmetics and Toiletries, and the Independent Beauty Association to offer these prizes: $250, a one-on-one with Meredith Petillo from the Independent Beauty Association, who you heard earlier for regulatory train-up, and a year membership with the IBA, all sponsored by the Independent Beauty Association. The choice of an SCC online CEP course or year SCC membership, mentorship on Scicomm with Michelle and I, and the chance to be featured in Cosmetics and Toiletries. We had so many amazing entries, it was really difficult to pick just 2. But here are the entries we landed on.
Our lipstick comes from the crushed exoskeletons of these beetles. Hi, I'm Neva, and these are my notes on the cochial insect. Today, this dye, called carmine, is still used as a colorant in cosmetics, and it takes around 1,000 insects to make just 1 tube of lipstick. It's also used as a colorant in food, like ice cream, soda, and cake. The industry loves it because it's stable, safe, and long-lasting. But you need over 70,000 insects for just 1 pound of dye, and the demand just keeps on rising. So scientists are trying to create this dye by tweaking the natural processes of microbes. Through metabolic engineering, they're getting fungi and E. coli to make this red pigment. The results are promising, and it could be a lot cheaper and more eco-friendly, but there's still a long ways to go before it can be scaled up to market. Follow for more cosmetic science.
How do these color-changing lipsticks and blushes make the perfect shade for you? I don't know if anyone remembers that nostalgic neon green Barae lipstick. I used to be obsessed with my older sisters, and I genuinely thought that it was some kind of magic. So lots of these products will claim to make your perfect shade depending on your pH. The magic ingredient behind this concept is Red 27, as seen here, which is a colourless pigment below pH 2.5, and above this it becomes a vibrant, bright pink colour. This means that with any contact with water, which takes it above 2.5, it will begin its colour changing process. So when it touches your lips or your skin, you're going to see a development of this pink shade. Here I was making some colour changing lip balm samples. It's really hard to work with Red 27 because you have to make sure that every piece of equipment is bone dry. You can see here as I'm filling the lipstick moulds, my gloves are turning pink and even the top of the lip balms are shifting slightly. Luckily these were only lab samples, so it didn't really matter too much. So unfortunately, these colour changing products don't exactly magically give you the perfect custom shade, as it's always going to be that Red 27 that shows. However, they are lots of fun, and you're going to get a gorgeous, long-lasting pink colour from that Red 27.
Congratulations to Rosie and Neva. And to the rest of the contestants, you all submitted such phenomenal work. We've got a lot more coming your way from BeautySciComm. If you're not already following, be sure to follow us and check out what we've already been up to at www.BeautySciComm.com. Huge shout out to Nawal at Derm Element for being the brainchild behind this contest and for putting so much hard work into getting it off the ground. Thank you so much for your help. And with that, we're going to enter our lunch break. We'll be back at 12:30 p.m. Eastern Time. Our next presentation will be by James Welsh, who's a skincare enthusiast that not only reviews and tests skin and hair care products, he also takes a deeper dive into those products, looking at ingredients and exploring problem areas for viewers, helping to educate his audience on their purchases. Previously a stylist who worked for ASOS and Top Man, James is your go-to guy for personal grooming and self-care advice for both men and women. Alongside his social media channels, James also has a podcast he hosts with his brother Robert called The Double Cleanse. Without further ado, here's James's presentation. And so I'm here with James Welsh to have a fireside chat for this presentation. This is in response to, I'm sure many of you have seen in the media recently, a lot of influencer blame for example, sunscreen misinformation. And here is an example from CNN. A couple weeks later, here's another example of one of their publications. Something seems to be wrong there. Maybe it makes sense to talk to an influencer about how they see the information landscape. And so that's going to be the topic of this presentation. And so just to get right to it for my first question, influencers have been getting a lot of flack lately about being the driver behind dangerous sunscreen misinformation as one example. What's your take on these headlines?
You know, I'm the first to kind of point out any kind of bad behavior, I guess we can say, from influencers. I'm always on it. I think we play a really important role in being responsible for giving out correct information, well researched. But I do agree to some extent, but I also disagree with it. So the extent that I agree is yes, influencers being the people with the most influence and probably the highest follower numbers, even above those like real professionals within the industry. Of course, because of that higher follower count, we are going to be the main people kind of pushing out that misinformation. But it's where that misinformation comes from and where the influencers are getting this information from that I think is the real kind of issue. I think influencers are an easy target, but the information that we're getting isn't just made up. You know, I group myself within that because I am an influencer, even though I don't spread the misinformation as much as I try. The way we get this information is from people we deem as professionals in the industry, news headlines like from CNN, from ABC, and the vast majority, not to put us all in one box, but a lot of influencers, you know, everyday beauty influencers, aren't doing that research that's needed to kind of really look into what the article's saying, where those claims are coming from, who that doctor is, you know, who that esthetician is, who that dermatologist is, or who that doctor in general is to be sharing this kind of information. So yes, influencers are, I would say, part of the chain of where the misinformation is coming from and how it's being spread rather, but the misinformation is coming from people we deem as professionals within the industry. Influencers are an easy target and a nice headline as far as like blaming where the misinformation is coming from, in my opinion. We're guilty, is what I'm saying. Like, it's definitely coming from influencers as well as certain professionals, yeah.
Yeah, there's obviously some blame to influencers, no doubt. To contrast different media headlines coming from the initial source, CNN, one week they're talking about influencers are spreading misinformation. The next week they're talking about how there are dangerous ingredients in sunscreens. So obviously people are going to be concerned about that, including influencers who are just like the general public, kind of, for how they're digesting the information out there. And they're trying to do the best based off of what they understand. In that CNN article, they quoted a dermfluencer to talk about the issues of influencers online, but then going to her blog, she was citing the EWG, which is one of the major sources of sunscreen misinformation. They even went so far to quote the EWG in this article to talk about sunscreen misinformation. Another thing that I've observed is this influencer blame in industry. But in light of the marketing that we've had in industry with like free from fear marketing and how that's kind of snowballed to misinformation that we have, to take a step back to my next question, from your point of view, can you describe the information landscape online? Where is the information coming from for influencers? As you say, they're getting it somewhere. Where do NGOs like EWG, brand marketing materials, and news headlines come in? And also the rising trend of medfluencers.
So I think we all have like a common enemy in the EWG, Think Dirty, Ooka, all those kind of ingredient listing apps, because a lot of influencers who aren't well into the beauty industry and are just trying to sell something online, for example, or they think they're doing some good, will use these apps and they see that as a really credible source of information because it sounds like science, everything sounds very scientific. So I think a lot of that, the EWG, Think Dirty, Ooka, is a trend that comes around every couple of years. Like people rediscover it every so often. Then I feel like all the science communicators and educators have to come online and kind of debunk it again. And then it's like a vicious cycle, I feel like there's two other main places that influencers get the information from. And one is the brands themselves, especially when it comes to sponsored work, when it comes to just brands that people are fans of, because we don't talk to the cosmetic formulators, we don't talk to the scientists who work for the brand, we talk to the PR teams, and the PR teams are given whatever kind of information they think is going to sell the product. So whether that's fear through making certain ingredients sound dirty, something's not clean. So a lot of influencers learn their skincare science or information from PR and marketing teams rather than the people that actually make the product themselves. So things like free from claims always stick out more to most. Reef Safe, for example, is another new one when it comes to sunscreens. That one, not new, it's been around for too long. That a lot of influencers think is a real thing because the PR teams have told them so. They're speaking to somebody who they believe is creditable. Why would they not have all the correct information? They're a huge brand. But then also with the rise of, what do you got, the dermfluencers? I don't know what you call it. The people with titles online. You see somebody in scrubs, you see someone in a lab coat, you see somebody with a title. As like an everyday consumer myself, you kind of just presume they know what they're talking about and what they're talking about is true, regardless of where their actual education comes from. So, for example, I made a list today of like the kind of misinformation I've heard and the titles that these experts use. So we have, of course, dermatologists, because they're the main people talking about skincare on platforms like TikTok. We have estheticians, medical estheticians, a midwife, a surgeon, a brain health practitioner, a holistic beauty expert, a natural plastic surgeon, and a cancer doctor. All just today I have heard talking about skincare and the misinformation that they're spreading around sunscreens, parabens, all the stuff that we've learned thanks to people like yourself is misinformation. But if I didn't know you, if I didn't know, all the other people involved in all of this, other science educators, and I would believe them, I don't know why I'd believe a midwife about skincare, but I would, because, she works in like the medical field, it's just little things like that, that as an everyday consumer or just somebody who loves beauty, you would believe these people with bigger reaches, wearing lab coats with a title, So yeah, I think especially with the rise of TikTok, it still feels fairly new, but TikTok's been around for so long now. And I feel like that has also introduced the rise of certain influencers who are dermatologists, who are scientists, which is a great thing. But as we say, like not all doctors are made alike. You get your bad, you get your good with everything, but people will take their word as fact. And people are happy to believe that, just straight out without having to do any research because they don't feel they should have to, because they just take what this doctor or whatever title is saying at face value. So yeah, and that spreads more rapidly than the science because it's so much easier and catchier to say this product causes cancer than explain and go through with the whole reasons why that's misinformation. Especially in a 15-second TikTok, it's easier to digest the misinformation and the fear and the catchier kind of titles than it is the whole science behind the truth.
Oh my gosh, as you're talking, I'm just reminded by Michelle Wong recently had a kerfuffle with the dermatologist, I don't remember his name, that went on the Huberman podcast and then was saying some like outrageous things about sunscreen. For example, it's a hotly debated topic that UV filters work by absorption and not reflection. It's like, that's not hotly debated. This back and forth between her and this dermatologist who then is talking about he's right because he has the relevant expertise, that he's a dermatologist. Now, dermatologists do not have the relevant expertise to talk about cosmetic chemistry, toxicology, regulatory. That's not their background. But there's so many dermatologists online right now that are stepping over the line to mislead their audience to talk about why they are the expert in this one thing that they're not. I think a lot of people in industry or in the media really don't realize how big of an issue this is. And it's not that all dermatologists online are bad actors, but there is a growing crowd of medfluencers online who are behaving like this, and then the white coat bias is so much stronger than the appeals to other influencers. So when we're talking about like where is that really sticky misinformation coming from about sunscreens, I don't think it's the general influencer. I really don't. When I look at where that stick is happening, it's from the rising expert community, and like for good and bad, it's great that there are more relevant experts coming online, but it's also super problematic that there is this equal rise, if not greater rise, because of the opportunities that you can have by making yourself appear as the one true expert. With respect to, for example, like you can get paid a lot for a reel as a dermfluencer because brands right now, that is what they're seeking. This is going to lead into the next question really well. Brands right now are seeking this, and I go to conferences and the marketing departments are always talking about, well, this is your opportunity to have a greater connection, build greater trust with your audience because your audience trusts dermfluencers. And like, I'm sorry to start to paint this conversation as like dermfluencers suck. That's not true, but there's just like a few that maybe are bad actors. And so this is bringing me to this, like the opportunities for you can get paid like at least $10,000 for a single reel post that doesn't take you that much time. You maybe didn't research it at all. That is probably a problem if you're somebody who is an expert. You can do that every day. Think about how much money you can make. And then you can get taken on all these trips, get all these PR, and then maybe there's some gray area. Maybe there's some like shady conversations with brands that incentivize you to not disclose this. Okay, so this brings me to the next question, and comment on anything that I've said prior. But the question is, can you speak to the issue of undisclosed or poorly disclosed advertisement? What and where is the issue right now?
I have a lot of thoughts on everything, everything you just said. When it comes to dermatologist influencers, the dermfluencers doesn't roll off my tongue. Sorry, I need to practice that. The issue comes, I think, from people not knowing, I guess, the process of what makes a cosmetic product. And I feel like if people knew that process, they wouldn't just have faith in dermatologists because they are the more popular voice of education and reason, I guess, on social media platforms. I see a lot of discourse in the comments when I go from, a cosmetic chemist, for example, to a dermatologist who are saying vastly different things. And most often the cosmetic chemist is right over the dermatologist. Not in general, just in one particular case I've seen. And people in the comments are just like, I just don't know who to believe anymore. I don't know what's right. I don't know what's real. Like, are my products safe? Does my product, there's so much confusion. So I think an education in how the structure of even creating a skincare or cosmetic product would be so interesting and so good for people to actually know. So they know who to trust along the way, I guess we can say. I've been very lucky to know a lot of people within the industry who own management companies, who represent talent, especially when it comes to the beauty space. And I know for a fact that dermatologists at the moment are getting paid more than any other influencer because brands are after people who have an education, who have a voice of education when it comes to one of the most popular kind of moneymakers online at the moment, which is skincare, more so than makeup, because skincare is still having its moment despite it, kind of plateauing a bit after COVID. With the rise of TikTok and the rise again of K-beauty trending again, people are so much more interested in skincare than they ever were again. And I know that dermatologists are being paid twice as much as a bog standard influencer to advertise and talk about a skincare product. Where this bothers me, and this isn't all dermatologists, and I feel like we're going to keep saying this isn't all dermatologists, they're not doing anything different to what I would receive as a brief. So I would receive the same brief as a dermatologist. And you do get your dermatologist who may go into a little bit more about a personal experience with a client, but that's very rare. So whilst when I started getting popular on the internet and people are saying, well, you're not a dermatologist, why should I believe you? You don't know what you're talking about. Dermatologists are now just doing what I was doing and what other influencers were doing 2-3 years ago. They are influencers, So I saw a recent campaign, which brands we won't talk about or name specifically, but a woman in her 20s in her beauty room who was just an influencer was saying the exact same thing about this product as a dermatologist who was in his scrubs in his clinic or whatever it's called, saying the exact same thing, not really adding anything new to the conversation. But I feel that that dermatologist would have been paid more because he is a voice of reason, a voice of education, for saying pretty much the exact same thing. And when it comes to being an influencer, no matter who you are, no matter your level of education, you don't always have a say in what you're allowed to say and not allowed to say in an advert. So when it comes to actually being paid to talk about a product, there are going to be certain points that this brand wants you to hit, whether you believe in them or not. But that's where your management come in. I'm quite lucky. My management would be like, James isn't saying this. He doesn't want to say that, and we'll work something out. But not everyone's going to have amazing management. Not everybody's going to want to go through that hassle of fighting a contract. There are going to be times when, no matter your level of education or what you truly believe in, you may have to say something you don't believe in unless you have a good manager. And we don't know all these professionals or dermatologists have management who can do that for them, or if they're even represented. There have been times I've seen dermatologists go back completely on things they've said in an advert because it was an advert. They were being paid for it, so they're going to say it. I think there's a disclosure issue as well when it comes to TikTok in particular, and I would say TikTok mainly, that people just aren't disclosing their adverts. Brand partner is not enough at the end of a list of hashtags to show that you are being sponsored. I think especially when it comes to dermatologists, they have a responsibility to be extremely transparent when it comes to products that they're advertising and product claims and what they think it can actually do for your skin, in my opinion. But again, it is really down to if you feel you can fully trust them as an influencer, not just as a professional in their field, but as an influencer, because there are certain lines that they're going to cross when it comes to an influencer. And I feel like that's when it gets quite confusing, if that makes sense. The lines get quite crossed because it's like, when do you say, no, I can't say that because of what I do, or I won't say that, or this is a brand I don't want to represent, over money. And I'm not questioning anybody's I'm not questioning anybody's kind of I'm not saying all dermatologists are going to be like, I'll take that job, I'll take that job, I'll take that job. But what I'm saying is that I don't feel their best interest is always there when it comes to their viewers.
And that leads me to my final question to kind of change this to more positive. Can influencers be a force for correcting misinformation? What would that look like for that to happen? And do you have any suggestions and comments? And I'll just maybe say, obviously, I'm an influencer. And if you think that this is helping with information, then there's just one example. But James, what do you think?
We have to do the old-fashioned thing of collaborating. I love just reaching out to people who actually work in the industry and being like, listen, I'm talking about this in a video. Do you mind if I use one of your videos correcting this misinformation? So I can guide people to the right people. So I can guide my followers to the correct information, reliable information. And I feel like we do have... Not everyone's bothered. That's not a lot of influencers do not care. They'll say whatever information they find and they'll run with whatever. But I feel like if you want to take your job seriously and you have respect for your followers and your subscribers, then you want to give them the correct information, lead them to the right sources. Working with people in the industry like yourself, I think has not only massively benefited myself as far as knowing what I'm talking about to a certain extent, but also my followers find it super interesting. Yeah, I just think good old-fashioned collaboration. And if you've learned something from somebody, say who that person is, tag them, or remember to, flash up their name or whatever. Just we have a responsibility to lead people to the right sources. I think for a lot of years, way back when, before, skinfluencers became a real thing, we kind of felt a lot of pressure to be the voice of education because there was nobody else. Dermatologists weren't huge on the internet yet, science educators weren't. Whilst we were trying to be scientifically accurate and give out good information, it was usually whatever we could find on Google. A dermatologist, an article said this, an esthetician said this kind of thing. So we thought we were doing the right thing, but the right thing to do is to just say, listen, this person knows what they're talking about, go and check them out. It's as simple as that. If you have a bigger following than people who actually know what they're talking about, send your subscribers over, send your followers over. I think it's as simple as that, really.
And I think maybe the opportunity from industry to do something about this is to maybe think about, and this is kind of the strategy that I take. Most of my audience is not just the general public, it's mostly industry, but I have some influencers who follow me. And the strategy is to influence the influencer by sharing information that there were gaps historically. People like to fill in gaps. People want to make sense of the world. That's just a human thing to do. And so fill those gaps for them. help them understand this whole story so that influencers want to do best by their followers, and with the right information, then they can. And so that concludes the presentation part of this fireside chat, and it's now time for Q&A. And here we are for the Q&A. Thank you so much, James, for presenting today. I really like this question from Ruby's resource, so I'll ask it first. Do you have any advice for how smaller influencers can approach negotiations when they want to say no to making claims they're uncertain about in sponsored content?
Thank you for having me, by the way, also. There are two ways. One is probably the least professional way, but something I definitely did when I first started, I'll start with that one, is to pretend you are a manager. So I had a fake name, like, hi, my name's whoever, and, I represent so-and-so, and that kind of takes away that awkward edge of being like, you won't say this, you will say that. But I think as the correct thing to do now, I would say, I think as, becoming an influencer becomes more of a well-recognized job, I think brands are expecting influencers of any size, be it micro or however big, to have almost like a checklist of what they will and won't do and kind of be more professional from the outset. Whereas like back in the day when I first started, I was on like 5K, I had no idea what I was doing, and brands would take advantage of that. But I feel like just be honest, just saying, no, this is my ethos, this is what I will and won't do, what I will and won't say, and brands usually respect that a lot more.
This next question was from Mark, and I think that there's a greater question here, so I'll start with their question. Do you collaborate with cosmetic chemists in forming your opinion on a product? My follow-up question: what's the landscape like for influencers in doing this kind of thing? Do they have to collaborate with subject matter experts to give their opinions on, do I like the way that this product feels and applies, and so on and so forth? Mm-hmm. What's your opinion on this?
That kind of answers both the questions. Sorry, both my answers. So it's hard to explain because I feel like from my point of view, there's two things I should be doing. One is definitely speaking to chemists so I get a whole new appreciation of what the product is, what went into it. If there's ingredients like maybe I as a consumer misunderstand, at least I can kind of speak to a chemist and be like, oh, that does make the product a little bit more interesting. Maybe it is a little bit more worth my money, etc., etc. But then also, I'm a consumer and I want to reflect the average consumer. And going into buying skincare, cosmetics, I'm not sure how much they need to know from that side, if that makes sense. They just need to know if it works. So I kind of take like a two different standpoints. One, definitely if there's like a question or if I think a brand has been a little bit misleading, I'll say like my cosmetic chemist friend says this, but I wouldn't necessarily use it to sway my opinion or try and sway others on the product, if that makes sense. Or maybe if there's like a new technology, then definitely, yes, bring that into the conversation. But I do always try and come from the approach of what a everyday consumer will probably want to know, need to know, and not dive too deep into it without giving too much information. It's a real hard like in between.
Yeah, and I just wanted to comment on like a narrative I've heard with especially maybe more senior cosmetic chemists that aren't that aware of the social media kind of landscape. I think that you know more about products on the market, aesthetics, what you might like, especially what you personally might like about it, but like all the different products out there, you know more than me, despite the fact that I have experience as a formulator. And so I think there is some undervaluing of the expertise one may gain from trying a lot of different products when we're thinking about like, like a consumer is looking for a product that is non-greasy XYZ, and you've tried a whole bunch of products, like you're going to give them a better recommendation than I will give them.
Right. And I think that's how influencers started in the first place is people actually didn't want professionals' opinion. I know that sounds awful, but like they wanted these opinions of everyday people who just want to know, you know, did the product work? What does it feel like? Does it smell nice? Does it not smell at all? I think that is still rooted in what being an influencer is. I think it's nowadays, with all the misinformation floating around, is so important to have these professionals online. But at the end of the day, people presume their skincare works, they presume their cosmetics work, which, like, you know, they should do, really. You know, everyone's making their products right. They just want to know, did it work? And I feel like, you know, you don't necessarily need an expert for that. But I do feel like influencers have become experts in the way that maybe like a beauty editor was an expert back in the day, you know, like a magazine. But I feel like we definitely do still need to like raise the voices of those actual experts, whilst also not crossing the line of like, we are just consumers at the end of the day. We might not want to be too bogged down with all the information.
And I wanted to highlight here, speaking of that, a comment from Ruby's Resource, who mentions that James was how I found the Eco Oil years ago when he listed in a YouTube video some of his favorite experts to defer to. So thank you so much for that.
Yeah.
This next question comes from Andrea. So she comments and then asks, as an influencer, oh, sorry, this is just an ask. Sorry. As an influencer, how do you reconcile a medical professional organization citing misinformation from, for example, the EWG when creating content? I know my approach as a scientist, but what's your approach as an influencer?
It's tough, honestly, because I'm not a scientist. So there's a lot of like, even when it comes to fact checking for me, it's still probably not the best fact checking I can do when it comes to a subject that I don't have the education in, which is like the real science behind this kind of stuff. So that's when I'm lucky to have people like yourself or Michelle or like other like cosmetic chemist friends. I can literally just be in their DMs and be like, does this look right to you? You know, like, what's this about? But again, it's hard for me because I take the stance of we shouldn't be doing our own research. I know some people often like argue with that, but you know, you can find anything you want in Google on Google, and it's hard to really fact check something when you don't have that education in it. So really, it's just kind of like asking around. If I'm unsure, I guess kind of like present both sides of the argument, then just kind of be like, just be honest, be like, I don't really know. But I think really it's like asking those who I do believe do know the right information. But yeah, it's hard as an influencer to really fact check something I don't have that education in.
This next question comes again from Ruby's Resource, who asks, has your fact-checking process changed as your channel has gotten bigger? Do you rely on an assistant/editor to help with that? How does your process look now versus when your following was smaller and you were new to this?
Yeah, it's very different. It's very different. I mean, I like to call myself a creative because my writing skills aren't really that good. So like I do have a writer, I have like a script writer, I have a researcher as well. So usually what I'll do is I'll compile a big long list and like a timeline or like the basics of like what I want to talk about, fact check certain things with people that I know. You know, the right experts, relevant experts, and then I'll pass that over to a researcher and a writer who will compile it into a script. Then I'll look back at it and then we'll film, etc. So it has changed. I think it's also changed. I also take a lot more time now. I think with the responsibility of trying to present the right kind of information and correct information, or at least lead people to the correct information, it does take a lot longer to kind of make sure I'm doing that, you know, and checking all the boxes that I'm not spreading much, hopefully no misinformation. So it takes longer, but I have a lot more help nowadays for sure. But that also comes, sorry, from building up relationships with people in the actual industry, which I'm very lucky to have done. So yeah, that's definitely helped. It's just networking, I guess, as well.
And I guess another, I know I sound like a broken record, but another reminder to industry about the importance, I guess, of making accurate information accessible and like having this role in influencing the influencer, guiding them in the right direction so they can share the right information with their followers, because I think most of them want to do right by their followers. I think.
Yeah, 100%. Yeah. No, they do. Well, I like to think so. Yeah. I like to hope so. And I think that's why we definitely appreciate, well, like my group of like skinfluencer friends, I think we appreciate being corrected or having like a quick, a little nudge in the DMs that, oh, that's not quite right. Or, oh, you actually said this, it's really this kind of thing. I think we all appreciate that. So yeah, like you said, it's like leading, the people, influencing them to go to the right people.
And that's all the time that we have for this Q&A. James, thank you so much for agreeing to present and be a part of this summit. And yeah, we're going to move on to the next presentation, but I hope you have a great rest of your Sunday. Thank you so much.
Thank you for having me. Bye.
Our next presentation will be by Lanesa Mahon, who's a cosmetic chemist and second-year PhD student in pharmaceutical sciences from the University of Cincinnati. Originally from Columbia, she obtained her bachelor's in chemistry from Vanderbilt University in 2020. After her bachelor's, she decided to combine her passion for science and beauty, going on to earn her master's of business and science in cosmetic sciences from Rutgers University in 2022. She has completed several industry internships during her academic career and does Scicomm work on her IG and TikTok platform at Rania Faces. Her current PhD research investigates the relationship between skin aging and fibroblast senescence. Without further ado, here's Lanesa.
Hi, everyone. My name is Lanesa Mahon, and today I'm here to talk to you about good evidence. I'm losing my voice a little bit because I've been sick, so please bear with me. On the agenda for today, first thing we're going to talk about is finding evidence, the different types of research, how experimental design plays in, and where to find reliable literature. And then we're going to go into evaluating evidence, for which I have a case study that we're going to go through, thinking about some of the important concepts of critical evaluation of literature. So before we dive in and we start talking about evidence and information, we first need to talk about misinformation. Mainly, we need to talk about why misinformation is so prevalent in the cosmetic industry. And I think it's a culmination of three different things. Number one, technology and product development and developing a technology to go into a product is expensive. It takes a lot of money, time, and knowledge and manpower to be able to not only develop a technology, but also take an existing technology and put it into a new product, whether that be an active or a delivery system. All of these things take time, money, and effort. On top of that, you have to navigate existing patents and their claims, as well as go through the work of substantiating your own claims. So all of that is extremely expensive on the part of the company. On the other hand, fear sells. And fear is one of the most powerful marketing tactics that people use because it plays to consumers' emotions and fears for their well-being and health. On top of that, here in the US, we do not have certain regulations about the claims that can be made about other ingredients. So in the EU, it is banned to do free from claims because it makes it seem that the safety of those ingredients is in question, when in reality, it's not. So there are certain claims that we allow here that are not allowed in other countries. Finally, and I think a really big portion of this is just a lack of scientific literacy all around. We have to really put ourselves, if you're in industry, you have to put yourself in the shoes of the consumer and think about where people are getting their information, and what type of sources they're going to be looking at. The average person that's not a scientist isn't going to be looking in scientific journals for this type of evidence. They're going to take it from news articles where, it's about clicks and trying to generate traffic. and they have a desire for these big flashy headlines that can kind of exaggerate the truth. On top of that, there's just a general inaccessibility of scientific literature, whether it be through the technical jargon and the language used and the amount of background that you need to be able to understand certain studies, or just paywalls and having to pay for these types of articles. So all of these factors together make it really easy to take data out of context. Another thing is that at times people tend to overextend their expertise into different fields, and they can end up parroting talking points that sound legitimate but actually aren't. The fact that somebody has credentials doesn't mean that they are qualified to speak on the topic at hand. And I also don't think that industry does a great job of combating misinformation. The most impervious aspect of misinformation is that they often cite evidence and use technical jargon or use figureheads to disseminate the information that make it seem more legitimate. But just because something offers evidence doesn't mean that that evidence is good evidence. And we're going to talk about that more as we go through this presentation. Before we dive into evaluating the evidence and figuring out what good versus bad evidence is, we need to learn a little bit about the types of research and the different experimental designs and how those are implicated in whether something is good evidence versus bad evidence. So in the cosmetic industry, you'll primarily be dealing with three types of research. Characterization research is analytical studies that usually describe the composition or makeup of a substance or ingredients. This is particularly helpful for ingredients that may be a blend of substances such as natural oils or extracts, but it can also be used, for example, in pharmaceutical science, it is used to describe trace impurities. Performance and efficacy data details how a compound works, or if a compound works. And these studies can take many faces. Safety studies are kind of the same way. They can be done in many different types of ways with many different types of models. And they primarily deal with the toxicology of a substance. And they are primarily done using animal studies. However, there are other in vitro safety models as well. The two types of research that I primarily see get misinterpreted are performance and efficacy and safety. So now we're going to talk about common study designs and their implications for how good of evidence is being presented. So first and foremost, we have in silico studies, which are computational modeling and simulation studies. These are typically used in permeant modeling and trying to screen compounds to see if they would be a good fit for something. Next, you have in vitro. These are typically cell incubation or artificial membrane studies, and they can range in application from trying to explain the effects of something on a cellular level and elucidate a mechanism, to seeing if something can work or has the potential to work. So I think of these as like validation or proof of concept studies, and they're not always applicable to real use. Ex vivo in cosmetic research typically takes frozen skin samples and looks at the permeation of a compound through a skin sample, whether that be excised skin or cadaver skin. And for in vivo, these can range from animal studies to clinical studies in humans. And primarily, these are used to try to get an assessment of the therapeutic effects and adverse reactions of a compound or a composition. The applicability of these depend on their design, the model, and what is being studied. So altogether, all of these studies are necessary and they all have their place. However, certain studies cannot be used and extrapolated to say certain things. So that brings me to the 3 R's of research. And you're going to want to make sure that any study that you are looking at has these 3 R's. Even if it's an analytical study, So this ranges from whether it's just a characterization, performance and efficacy, or a safety study. You want to make sure that the research is rigorous, reproducible, and relevant. In terms of rigor, you want to ensure that something has adequate controls, an appropriate sample size and number of replicates, and especially for finished publications, a peer review. Reproducible means that the experiment can be replicated and isn't just a one-off. So you want to have a lot of detail on those experimental conditions. And also you want to ensure that the samples that you're using to test were stored and handled appropriately. Lastly, you want the research to be relevant. So that means that it's meaningful, it's applicable to real life, and good methods are being used so that that extrapolation can be made. So now that we know that, we are going to talk about evaluating evidence. So now that we are familiar with some common research design and types of research, we have to think about critically evaluating the evidence that is brought before us. So I broke this up into 4 buckets of things that you need to think about. Number 1 is the source. What are the credentials? Is it a primary or a secondary source? The second thing is experimental design. What was the study type, the model, the size of the study, the length of the study, were there control groups, and what were the endpoints that were being measured? Third is the methodology. What is the strength of the methods? Are these methods and endpoints meaningful, and are they exhibiting the 3 R's? Like, are they rigorous? Are they relevant? Are they reproducible? Those are really things that you have to think about with the methodology. And are they modeling real life conditions? And the last thing is results. And do the results match the conclusions? You may have seen these headlines. This was a study that got blown up a couple of months ago. And so they said that cancer-causing chemicals were found in skincare brands, including Target, Proactive, and Clearasil. So let's dig a little bit deeper. And let's read a little bit about what one of these articles has to say. So in the first paragraph, we can see that high levels of benzene, a cancer-causing chemical, can form in acne treatment products containing benzoyl peroxide, according to a new report from Valisure. The report says that benzene can form at unacceptably high levels in both prescription and over-the-counter benzoyl peroxide products. So what we need to do first is look at the study. You cannot take scientific evidence from news sources because they're not always reliable sources for scientific information. Oftentimes, the people writing these articles don't have a scientific background that allows them to really pick up on the nuances or the considerations that you need to have about this type of literature. You have to go to the original source. So for this, I went to Valisure. They have a citizen's petition that is about 34 pages long, and they also linked a separate study that is a little bit shorter. So for the purpose of this, we are going to look at the longer 34-page citizen's petition. Let's look at the source. It says that Valisure had conducted extensive testing that showed that on-market benzoyl peroxide products can form over 800 times the conditionally restricted FDA concentration limit of 2 parts per million for benzene. And the current evidence suggests that this problem applies broadly to benzoyl peroxide products on the market. They said that high levels of benzene were not only detected inside the products, but in the air around incubated benzoyl peroxide products, showing that benzene can leak out of some of the product packages and pose a potential inhalation risk. Valishure's tests on dozens of prescription and over-the-counter BPO products suggest that the currently formulated medications are fundamentally unstable and can generate unacceptably high levels of benzene when handled or stored at higher temperatures that the products may be exposed to during handling by consumers. So they said that these benzoyl peroxide containing medications are fundamentally unstable and under normal storage and handling conditions will form high levels of benzene. Next, looking at the study, the first thing I want to point out is that it says here that BPO is known to be thermally unstable and can thermally decompose. This is already something that's sort of known. Benzoyl peroxide, upon high temperature, will decompose. So let's see how they got to this conclusion and look at the experimental design and methodology next. Here they said that they tested 175 products total, 99 containing benzoyl peroxide and 58 containing other acne ingredients such as sulfur, adapalene, azelaic acid, niacinamide, and zinc. 18 of the products that they tested had no drug. They did a baseline benzene quantification. They looked at all of the acne treatment products and the ones that contain benzoyl peroxide. And they found that 70 of the 76 non-benzoyl peroxide products had no detectable benzene, but 94 of the 99 benzoyl peroxide containing products contained benzene. What I notice here is that they're purposely vague with the BPO products when they talk about them. So often with values well above 2 ppm in an initial analysis, doesn't tell me how many of those, how many were below 2 ppm, especially when up top they went into such detail about the numbers that had detectable benzene and what levels that they had it at. So next, they chose 50 degrees Celsius and 70 degrees Celsius as accelerated stability temperatures. For reference, 37 degrees is 98.6 Fahrenheit or body temperature. 50 degrees is 122 degrees Fahrenheit, and 70 degrees Celsius is 158 degrees Fahrenheit. On top of that, they do not have a room temperature comparison, and they also do not have relative humidity specifications that are normally needed in the details of accelerated stability tests. On top of that, the thermal instability of the compound is already known. So we know that what happens at room temperature is not what happens at an elevated temperature because it is thermally unstable. Also, going back to choosing 50 and 70 degrees as the temperature, the ICH guidelines have accelerated stability testing recommendations at 40 degrees Celsius. These are way higher than typical accelerated stability tests. Here, the petitioner notes that 70 degrees Celsius or 158 degrees Fahrenheit is not only a reasonable temperature that the product may be exposed to during distribution and handling by consumers, and it is within the reported temperature range of a hot car. But really, are 122 degrees and 158 degrees reasonable temperatures that these products may be exposed to? And even if your car does get up to 158 degrees, how long are you exposing your products to this temperature? Usually, you're going to get in your car and you're going to turn on the AC. So that 158-degree temperature is already unrealistic for an extended period of time. Then they said that means to achieve the expected minimum shelf life of 3 years for a standard pharmaceutical product, the product should exhibit stability for at least 43 days at 70 degrees Celsius. But does 43 days at 70 degrees Celsius really equal 3 years at room temperature? And the answer to that is no. And per the FDA, it is not reasonable to perform accelerated testing at high temperatures for a very short time and expect to extrapolate results to a very long expiration dating period, since the actual mechanism of degradation at high temperature may be different than at room temperature. 70 degrees Celsius is just not only not realistic in a practical sense, but even per regulations and per regulatory bodies, it's not reasonable because there are different mechanisms that may happen that accelerate that degradation at such high temperatures. So it cannot be extrapolated to say what is going to happen for an extended period of time at room temperature. The best way I can describe this methodology, and the best analogy I can make is like sugar. If you take sugar and you put it on your hot stove, you can create caramel. But that doesn't mean that you can take that and say your sugar is going to form caramel in your pantry. It's not going to happen because there's a temperature that needs to be reached for that reaction to happen. When we're thinking about our 3 R's of rigor, reproducibility, and relevance, these methods aren't particularly rigorous or relevant. So now let's move on to the results. What I noticed about this paper is that for the data presentation, they only had graphs and no tables. And for them to have mentioned the baseline values, there was nothing that clearly stated the baseline values of any of the products. On top of that, there is no comparison with any controls. So in the words of Aretha Franklin, beautiful graphs, but not really any substance here. So among other glaring errors of this study is that the framing is intentionally misleading. The no safe level and known carcinogen are meant to play on people's fears of cancer. No safe level really means that a no adverse effect level has not been established yet. It doesn't mean that any small exposure puts you at risk for cancer. Known carcinogen, almost everything is a carcinogen, okay? The sun is a class 1 carcinogen. We have to really be careful about how we throw the word carcinogen around because there's more that goes into the potential of something to exhibit carcinogenicity than it just being a carcinogen. And then we have to think about the carcinogenicity from topical exposure. And I talked about a lot of considerations for topical exposure in my Actives eSummit. But if we take the study on the right that talks about the percutaneous absorption of benzene in man, the percentage of the dose applied that was found to be absorbed was 0.07% and 0.13%, which is like a small, tiny percentage of what's already a fraction of the amount of benzene that would be present in these packages at room temperature of normal storage and use conditions. They cooked sugar and made caramel and said, hey, we cooked this sugar and we made caramel. So you got to be careful about how you store your sugar or else your sugar is going to form caramel. And that's just not how it works because there's things that are going to happen at those high temperatures that aren't happening. In terms of inhalation risk, if this benzene is forming and leaching out into the environment, the amount that's going to be measured in a small 5.8 liter container is what they used in the study is not going to be the same as what you're going to see in a car or in a room. Things will dissipate. So all of this taken together, I hope that going through this presentation, we can understand how we have to really evaluate this evidence to determine if it's good evidence and if it is modeling realistic conditions. So the main takeaways from this presentation is that not all evidence is good evidence, and people, as well as scientists, overstate the significance and applicability of their findings, and critical evaluation is really necessary for that reason. The second point is that scientific studies used as evidence should be rigorous, reproducible, and relevant. So as you go forward, do not forget your 3 R's. And finally, I think that industry really needs to find better ways to combat misinformation in ways that are accessible to consumers. At the end of the day, we need to find ways to better combat the misinformation in ways that will facilitate understanding on the part of consumers. So with that being said, I want to thank everybody for listening and bearing with me with my raspy voice today. Feel free to connect with me. I'm on Instagram and TikTok. And I really want to thank you, Jen, for inviting me back for my 3rd eSummit. I really appreciate it. It's always an honor. And now I'll be answering any questions that you guys might have. Thank you again.
And we are back for the Q&A. So I guess I want to ask my first question, or ask my question first. I think this conversation has been coming up throughout the panel, so I wanted to get your point of view on it. What are your thoughts on this notion that consumers, the general public, just need to do their own research?
Um, so I feel kind of conflicted about this because on one hand, I do think that people should try to seek out their own information. But I think the issue with that is that you can kind of find anything on Google. And a lot of the times, if you even just go search a study, like if you go search an ingredient and you search that ingredient's safety, what's going to be the first thing that's going to pop up? EWG or something like that. And EWG, what they do is like they use language that's accessible to a consumer, but they don't actually use good evidence and good data. So sadly, because of that, I really do not think that consumers should do their own research, even though in a perfect world where, scientific literacy was everywhere and everybody knew what a good source was. Um, Truly, a lot of consumers don't have the background to make informed decisions on some of these studies. And so they will be prone to misinterpretation. So I think that industry really should do more to put science communicators like yourself and like Lab Muffin and like other people on this e-summit in positions where they can start, talking about this misinformation and debunking it and pushing it to the forefront rather than consumers doing their own research.
And I would also just add that doing your own research in fields that aren't your own, even for scientists, is difficult. And like there have been publications about this, about the increasing inaccessibility of science amongst experts, even because science is getting more and more complicated. And it just reinforces that science communication, even to scientists, is so important. Okay, the next question comes from Conjol, who asks, what are some resources to find good cosmetics research papers? Where would you go about finding them? I guess there's you can answer this and comment on this, whichever way you'd
So
like. What do you think?
I would say it depends on what you're looking for, right? If you're looking for like characterization data, if you're looking at an ingredient and saying like, for example, an extract, if you're trying to figure out what's in an extract, I would do like a Pub Chem or Chem Spider. So there are different papers that will predominate in different journals. If you're looking for safety data, I would go directly to CIR or SCCS, the Cosmetic Ingredient Review by, I believe, the PCPC, the Personal Care Products Council. They have a whole portal where they go over research and toxicology research on ingredients, and they summarize it all into these kind of long documents so that you can actually see exactly what study was done, what it was modeled on, what the exposure conditions were, and et cetera, and how they came up with their guidelines, as well as the SCCS. They also have summaries of a lot of different toxicological studies. If we're talking about more performance and efficacy, experimental data, you can find that in places like the International Journal of Cosmetic Science or the Journal of Cosmetic Science. Elsevier and Wiley Library also have some pretty good journals that you can pull research articles from.
It should be noted that just because something is published in one of these journals doesn't, even if they're a reputable journal, doesn't necessarily mean that it's as
It's
good
great.
of, yeah. And I guess this brings me to my own question. It's something that I think a lot of people miss, of like the notion that one study on its own will give strong evidence in one direction or another. So my question is, what should the average person know about the body of scientific evidence? And how do we view studies in that? as pieces of like good quality information, strong evidence, and whatever else? How does the average person think about this?
I would just say, think about those 3 R's, right? From like it rigor, is it re and I like
Oh no,
reproducible can be one thing that you focus on.
your reception was just a little buggy.
Okay.
Maybe try one more time.
Can you hear me now?
Hopefully I could hear you a bit better. I'll let you know if I can't hear you. You can
The best
also
to
turn your camera off. Maybe that'll improve improve it just for this last answer.
for is you can really think, especially with scientific research, second R, reproducibility. You want to study repeated times, or you would the same results from multiple studies. So thinking about work, one study or something particular, it can be, but it's not the end all.
I'm so sorry, Lanesa. We can't really hear you that well, but maybe I'll just like, I think I heard the gist that one study doesn't mean that. I mean, I alluded to the answer in my question. It's all about the body of scientific evidence. One study is just a piece of it, but you have to look at the evidence in totality. If you'd like to expand and maybe I've misinterpreted what you were trying to say, then feel free to go in the comments. I feel like I
That's
probably got the gist.
yeah, that's exactly one of
I'm so sorry.
the
Your bandwidth is not agreeing with you on top of being sick. But this is actually at the end of our Q&A anyways. So thank you so much, Lanesa. Lanesa made this presentation. So she's been sick all week. And then yesterday, she's still sick. She was hoping she'd be better. Yesterday, she made the presentation and then she's here today while she's still sick. So thank you so much, Lanesa, for presenting today. And make sure you follow her at rhea.faces on Instagram. Lanesa, feel free to go in the Q&A of the live stream if you'd like to answer anyone directly. But yeah, thank you so much. And also to my audience, be sure to check out Lanesa's presentations at our previous summits. There's a reason I keep inviting her back. All of her presentations have been phenomenal. Thank you so much, Lanesa. Our next presentation will be by Dr. Rania Ibrahim, who is the founder and president of SkinScience Analytics, a CRO on a mission to help brands and entrepreneurs obtain the scientific backing they need to grow their businesses. With a PhD from the prestigious University of Cincinnati's Pharmaceutical and Cosmetic Science program, she is the author of papers on skin permeation and drug delivery through the skin. Previously, Dr. Ibrahim spent the last 10 years as clinical director of a leading CRO, and through her work with large brands and small, established herself as a trusted expert, partner, and thought leader. Without further ado, here's Rania.
Good afternoon for those of you joining us on the East Coast, and good morning for those of you joining us on from this side of the country. My name is Dr. Rania Ibrahim, and I am the founder of SkinScience Analytics, a lab specialized in safety and efficacy testing of cosmetics and personal care products. And it is such an honor and a privilege to be a part of this Truth in Beauty Summit and to get an opportunity to speak about something that is very near and dear to my heart. So when I was initially approached to give a talk on this topic, my first thought process was I'm going to focus on efficacy claims. And as I began to think about it a little more, I realized that I get a lot of questions about other types of claims as well. So For the purposes of this talk, I'm going to spend some time talking about safety claims, followed by non-comedogenic and non-acnogenic claims, and then finally efficacy claims. So the most common and standard test that we are all familiar with is the RIPT test. As you know, it is a test that is performed on a minimum of 50 adults. It does not replicate true use at all because none of us use a face cream on our back and then wrap ourselves in saran wrap. This particular test will allow you to make claims on your product around it being non-irritating, non-sensitizing. If you're testing on a population of self-proclaimed sensitive skin individuals, you can make a safe for sensitive skin claim. And then dermatologist tested means that the test is being performed under dermatologic control. Now, I get a lot of other different questions regarding claims that can be made off of the RIPT. And the most common one that I get is, can I make a hypoallergenic claim? Now, the FDA defines the term hypoallergenic as being essentially meaningless, and they put the onus on the company to determine what that term means to them. So what that essentially means is that there are no guidelines in terms of what kind of testing is needed in order to establish this particular claim. There are industry standards, which tend to be testing on at least 100 to 200 subjects. I know many companies like to follow the requirements of the National Eczema Association seal, which is testing on 50 normal skin, 50 sensitive skin. But at the end of the day, it really falls on the company to determine, the regulatory teams, their legal teams to determine what does the term hypoallergenic mean to them. The next two claims that I get a lot of questions about is, can I make a dermatologist recommended and or a dermatologist approved on an RIPT? And the short answer to that is no, you cannot. I'm not saying that you can never make these claims. I'm just saying that the RIPT is not the appropriate test to support what is required to properly make these claims. And if you actually look at the NAD and the FTC stance on these claims, more often than not, companies are requested to discontinue the use of these claims. The next claim that I get asked about quite frequently is, can I make a pediatrician tested claim on an RIPT? And I personally find this claim to be one of the most misleading claims in safety testing. I put myself in a consumer's shoes and I pull a product off of a shelf that says it's pediatrician tested. And what that insinuates to a consumer is that this product was tested on children and that a pediatrician was directly involved in the testing and assessing the safety of the product. However, in an RIPT, that is not the case. It's performed on adults, and there's no direct assessment by a pediatrician. It's probably more of a sign-off on the report. And so from a claims perspective, this seems to be extremely problematic and very much so misleading. For companies that are interested in making a pediatrician tested claim, my recommendation is to perform an in-use test where the product is tested on children who fall within the age range that the product is intended for, and for a pediatrician to do an assessment on this subset of individuals before and after the use of the product. There are other types of safety and use tests, whether that is gynecologist tested, dermatologist tested, ophthalmologist tested. These are true use tests, unlike the RIPT, where individuals are using the product as it's intended to be used. One thing I think is important to note is that the in vitro eye test is not an appropriate test to extrapolate a safety use around the eyes claim, simply because the in vitro test really doesn't tell you what is happening with the visual acuity of the individual. It does not tell you what is happening to the cornea. It is simply telling you, it is a membrane, and it is indicating if the product were to go inside the eye, if it causes some level of irritation or not. Another recommendation I have for these safer sensitive skin claims, if you have a product that has high levels of alpha hydroxys in it or high levels of known irritants, while you can get this claim for an RIPT for liability concerns and really just to have a clear representation of how the product would behave in sensitive skin, I would highly recommend doing an in-use test on sensitive skin individuals simply because the skin on the back is very, very different than what is happening on the face. So the next topic of conversation are non-comedogenic and our non-acnogenic claims. So there are two primary methodologies. The follicular biopsy involves taking the product, placing it under a patch, much like the RIPT. You put it on the back and you do that for 4 weeks. And at the end of the 4 weeks, you take a superficial biopsy of the test area and you assess this biopsy for clogged hair follicles and you compare it to a positive and a negative control. The other method that is pretty common is the in-use test, which is a face count test. Products are used under normal conditions. They are given individuals to use for 4 weeks. And the face is assessed for open, closed comedones, acne lesions before and after the 4-week use test. And so if you're looking to make a non-comedogenic claim, either of these two methodologies are appropriate. The follicular biopsy is much more economical, especially if you're testing on a shared panel. However, if you're looking to make a non-acnogenic claim, the only methodology that you can use is the face count method. Now we dive into the world of efficacy claims. The first group of products we're going to focus on are your moisturizers, your lotions, your creams. Please note that these are not the only claims that you can make on these types of products. These are just some of the most popular claims and standard claims we see. So for moisturizers, lotions, and creams, you're not really looking at any anti-aging benefits. You are simply focused on what is the hydrating potential and how well does the product impact the skin barrier. The nice thing about these particular tests is that you can test multiple products at the same time, so you get a bigger bang for your buck. For face products, we test them on the inner forearms, and for body products, we can test them on the lower legs, and we compare the test product to other products, but you're also comparing them to a control. So for hydration skin barrier, immediate claims are extremely popular. That's probably your highest percentage increase that you're going to see. We have all-day claims. How a company defines that is based upon their regulatory and their legal team. So that could be an 8-hour day or a 12-hour day. We usually recommend that subjects be sequestered at the facility for that duration of time where they are kept in temperature and humidity controlled rooms. We can also look at the hydration potential and the skin barrier potential over longer periods of time, such as 24 hours, 48, 72. It's important to note for these particular types of study designs, the improvement and the measurement intervals are based upon a one-time application of the product and not multiple applications over time. Another type of test that helps you substantiate a maintaining hydration claim are regression tests. And these tests involve subjects using the product usually twice daily, multiple days in a row. And then what we're interested in looking at is once they use these products for multiple days in a row and we stop the use of products, let's say for a week, what we're trying to determine is how much of that hydration maintains in the skin even after the product is stopped being used. And then in terms of skin barrier function, these are measured in conjunction with hydration. There are two main ways to look at skin barrier function. Either we're looking at the improvement of skin barrier function. So we started at point A and the product got us to point B. And then we can also look at repairing the skin barrier where we intentionally damage the skin by tape stripping. And because the skin is such a wonderful and magnificent organ and is able to naturally repair itself, what we're looking at is to determine whether the test product repairs the skin barrier quicker than what the skin naturally does for itself. So our next grouping of products are our cleansers, our exfoliators, our scrubs. So much like moisturization studies, we can actually assess more than one product at the same time if we're only looking at hydration and skin barrier function. Generally, with these type of products, you really don't want long intervals. You're not going to go up to 8 and 12 hours. We usually recommend going up to 30 minutes, 1 hour max. For products that are harsher, that might have some alpha hydroxys or some microbeads that can be abrasive to the skin, we can look at how the product is affecting the skin barrier, where you can make a gentle on skin claim. And then there are other attributes. If you're just testing the product directly on the face, we can look at the minimizing of the pores, the glow or radiance of the skin. We can look at how an exfoliator or a scrub affects the skin texture, smoothing out that texture, also exfoliation, and looking at how well the exfoliator is removing the dry skin flakes and dead cells, makeup removal, which is a pretty popular and standardized test where we compare the removal of your cleanser versus just soap and water, or maybe a different type of product like a wipe. And then finally, the reduction in sebum. So are we reducing the oils after the use of the cleanser, exfoliator, scrubs, etc.? So the next group of products that we'll talk about are your anti-aging topicals and devices. These tend to be longer studies if you are looking at fine lines and wrinkles. You can, based upon the formula and how well the product works, you can see some measurable results perhaps at 4 weeks. But if you're looking at things like skin brightness and hyperpigmentation or skin tone, we usually recommend longer studies like 8-week studies. So there's a variety of attributes that you can measure. The way they are measured can vary from expert grading to using software analysis to look at specific attributes. Some of these attributes can be assessed on 2-dimensional or 3-dimensional for more of your topography, like fine lines and wrinkles and skin texture. One thing to note, and it's a common question that I get when we're talking about data coming from the cutometer, which measures the firmness elasticity, it is not uncommon for one attribute to improve and not the other. And I often like to compare this to a mattress. If you are looking for a firm mattress, then you kind of have to forgo that bounciness or that elasticity, and vice versa. If you are kind of person that kind of likes to sink into your mattress, you have to forgo that element of firmness. So moving on from anti-aging products, we come to our color cosmetics, and these are some of my favorite studies because I find makeup to be so fun to play with. And these are usually much shorter term studies. There are a variety of attributes that you can assess. So one of the most popular tend to be your long wear. These can be measurement intervals of 8 hours, 12 hours, 24 hours, or longer. We can also assess the water resistance if the product is running when exposed to water, transfer resistance, which is so important for products like foundations and concealers because nobody wants their makeup on their shirt. Smudge proof, sweat resistance, which is very different than heat resistance. When we're looking at sweat resistance, we are looking to do activities that are actually inducing sweat, where we have individuals participate in a 30 minutes of like rigorous exercise and then assess to see if the product is still maintained in place. Crease proof, looking at the intensity of the color over time. We can also look at what mascara does to the lashes in terms of volume and curl. Also coverage when it comes to foundations and concealers. Is it actually properly covering the imperfections of the skin. We can also look at oil reduction, oil control. The measurement is the same, the analysis is just different. We're either looking to see if the oil is being reduced and is staying reduced over time, or if it is being controlled. So it starts at point A and kind of maintains itself at point A over time. And then you have your shine proof and mattifying, which is a pretty common attribute that we measure for foundation. So we're definitely seeing a lot of brands starting to branch out into deodorants, and more specifically all body deodorants. And there are two primary ways that you assess deodorants. The least rigorous and least expensive method is subjective assessment. So you give the deodorant to individuals to use and they fill out a questionnaire, let's say like 8 hours or 12 hours or 24 hours, on how well they think the deodorant controlled odor. The more rigorous method is the ASTM method, which is a very specific protocol, and it involves the use of odor judges. And you're usually comparing it against to either an untreated site or a benchmark deodorant. And we're seeing a lot of these studies also including microbiome analysis, where we're swabbing the armpit and it's being analyzed for the presence of the bacteria that is responsible for malodor. And actually, this analysis is not terribly expensive. So it's actually become quite popular with deodorant testing. The other type of testing, which is pretty self-explanatory, is acne testing. Acne testing is quite expensive because it is wildly difficult to recruit. And outside of just assessing lesion counts, we're also assessing the symptoms that may be associated with acne, such as sebum or the inflammation or the post-inflammatory hyperpigmentation, scarring, and so forth. So we come to our hair products, and hair care is probably one of the fastest growing segments in the cosmetic industry at this time. Some of the more popular claims that we see are hair growth or hair volume, depending upon whether you are following the monograph or not, will dictate the language that you use. These tests are obviously performed in vivo and tend to be longer tests. You definitely want at least a 6-month clinical trial, and we can assess the skin density, the thickness of the hair, and we can also look at the anagen and telogen hair ratios. It changes the study design a little bit, makes it a little more complex, but definitely can be accomplished. And then there are other attributes such as shine, manageability, breakage. All of these claims can be assessed both in vivo and in vitro. And I always tell individuals, if you can assess your attributes using a hair swatch, that is your best bet, because it is much less expensive than testing in vivo. And finally, some of the misleading claims we see coming from efficacy testing. The number one that I tend to see is companies reporting not statistically significant data. And what is statistically significant data? Statistically significant data basically means that the improvement that you saw is not a fluke. It's not by chance. It's actually based upon the fact that the product is actually working. So when you're reporting not statistically significant data, you are reporting data that is essentially a fluke. It's a meaningless value. Also, marketing claims that are based upon data where the treatment group was not different than a placebo group or an untreated group. Also reporting the highest improvement and not the average improvement. And this was actually one of the highest paid out FTC claims with L'Occitane, when they had a body firming product and the data was based upon the best users. That obviously is not indicative of what is truly happening with the product. And then using results from consumer use studies as clinical data, and then drug claims on cosmetics. And really what it comes down to is being truthful in claims not only establishes this trust with your consumer base, but at the end of the day, it protects you from potential lawsuits and challenges. And with that, I would like to say thank you so much for your time and attention. I hope you walk away with something interesting and new from this talk. Up here is my contact information. If you have any questions, please feel free to reach out anytime. And if you're ever in the Phoenix area, please do come visit. This is the view from our lab. And the good news is if you come anytime between now and May, you will not melt. And with that, thank you so much.
Thank you so. Oh, I see that you can't hear me. Thank you so much to Rania for that presentation. I certainly learned a lot. We had a few questions. So the first was from Amin, who asks, "How many people are needed for statistically significant data?"
So the FTC says that at least an N of 30 is a good number for you to be able to get some statistical relevance out of a study. If you're going up against a placebo or another treatment group, you definitely have to increase the number of subjects significantly in order to be able to see the difference between the two groups. Because, when you're dealing with topicals, you don't see like these huge changes. So usually for those type of studies where you're going up against a treatment, another treatment group or placebo, I would suggest at least 50 per group.
This next question comes from Ruby's Resource, who asks, "How prevalent are these kinds of misleading claims? Can consumers generally trust that product claims are well substantiated? Does this vary between small and larger brands?"
Yeah, that's a loaded question. It does vary between larger and smaller brands because of just the liability risks. When you have a more exposure, the chances of you being sued are higher. Hence, you tend to be a little more buttoned up than when you're a smaller brand, maybe perhaps don't have much regulatory guidance. But it's not to say that I haven't seen some crazy claims from some of the larger brands.
Yeah, this reminds me of a conversation that we had previously. The parts of it were published on the Independent Beauty Associations, which, surprise, I run their Instagram right now or do the interviews. But she brought up an interesting point about when brands come to you as a testing lab, they just like kind of assume that they're going to get results, where that's just not how it works. They may or may not get those results. And that's hard to wrap me in like the formulator role. It's hard for them to wrap their head around the uncertainty of like, we're going to spend how much and we don't know that it's going to work. And then like, what happens if it doesn't work? I don't know if you want to expand on this.
It's really simple. I mean, that's why we do clinical research. That's why you do a clinical study. If you knew that everything worked and it did exactly what it was supposed to do, then why even engage in a clinical trial? So I definitely it's definitely a struggle. And I find sometimes that when you're dealing with larger brands, that conversation of, oh, this didn't work doesn't really come up. It's kind of an expectation. Like maybe there's like 15 claims and maybe we'll get 5 out of them. Whereas with the smaller brands, sometimes I find that the expectation is a lot different and a lot of tears, and I get the pressure that everyone is under
But that's just the reality of research. You just don't really know. I mean, I would have loved my PhD thesis to work every single step of the way, but it just wasn't the case.
And I guess this also speaks to feasibility between large and small brands. Large companies might be able to weather these kinds of expenses better. They will be able to, and they expect it because they have more history behind it, where that may not be the case for a smaller brand, especially if they're a startup. I really like this question from Mark, who asks, from your point of view, what claims are the least valid scientifically that brands are making?
Ooh, the least valid. I mean, honestly, to me, the least valid are just the misleading claims. And I think I talked about it in my first slide when I was talking about safety. Seeing like dermatologists recommended, dermatologists approved, pediatrician tested off of an RAPT done on adults. Like to me, like that's just it's kind of bananas. I have like really strong kind of moral stances on that. And so I find that the misleading claims or the ones that are just, you really can't just feel good about. Those are the ones that I find to be the least valid.
Maybe we have time for one final question. This comes in from, I'll do Emma's question. Where can the everyday consumer look into the testing that brands have undergone? Are they required to post this kinds of information? I'll maybe ask this a different way, because I mean, no, there's no, but there may be inclinations on the types of testing used, but they're not going to post. They don't have to necessarily post it. Maybe I'm wrong, but by seeing certain claims that might imply certain types of studies. So, yeah, how do consumers go about looking at some of the claims and thinking about the studies attached to those kinds of claims?
Well, sometimes some brands actually, like if you go look at their marketing, like they'll say in a clinical trial of like 30 people, like these are the results were obtained. Are there regulations that they have to post that information? I do not think so. The trial has to exist in the event of like a challenge or a class action lawsuit to be able to substantiate that, yes, we've done our due diligence and the results were like valid and real and came from an actual clinical trial. But I don't think that companies are really required to publish or to even put up the reports. Like I've seen some brands put up like the report, which I find for a consumer is just, I mean, it would be really difficult to navigate in terms of trying to extrapolate information from that. So I really think it's just, when they use specific words like clinically tested in a clinical trial, proven, shown, and, there's also some diciness between using the word proven versus shown. But yeah, I think I've seen it so many different ways. And then obviously with some of the larger brands or some of these breakthrough products, you'll see like white papers and publications where they actually like disclose the data in the trial that was done.
And so we are now at the end of our Q&A. 10 minutes just isn't enough time. But Rania, thank you so much for agreeing to present and then join us today on a Sunday for the Q&A.
Thank you so much. I'm going to go back to my resort spa and spying it out for the rest of the day. So,
Thank you, Rania. Enjoy.
thank you. Have a great day.
Our next presentation will be by Reese Richardson, who is currently a PhD candidate in interdisciplinary biological sciences at Northwestern University in the laboratory of Louis Amaro. His research focuses on reproducibility, bias, and fraud in the scientific literature. He is specifically interested in using meta-scientific research approaches to better understand the commercial enterprise of scientific fraud, which includes businesses like predatory publishers, diploma mills, and paper mills. Reese writes on issues of scientific reproducibility regularly at reeserichardson.blog. Without further ado, here's Reese's presentation.
Hello, everyone. My name is Reese Richardson, and I am a PhD student in interdisciplinary biological sciences in the laboratory of Luis Amaral, about a month out from my PhD at Northwestern University in Chicago, Illinois. I am a biologist, according to my graduate program, but generally I'm interested in meta-science, or the science of science, literally applying the scientific method to studying the organization and processes of the scientific enterprise itself. I'm here to talk to you today about research fraud, systematic fraud within science and the forms that it takes, such as predatory journals, and about science integrity in general and why it is important. So now let me make sure that I can advance my slides. Okay, a good point to start from when we talk about science integrity are the Mertonian norms of science. And this is a set of ideals put forward by Robert Merton that he suspected that all scientists more or less hold each other to. These are standards that are expected within the scientific community and which are held to varying degrees. The first is communism or communalism. And this is expressed in the sense that scientific discoveries should be accessible to everyone. Basically, that science is about advancing humanity's understanding, and the processes of science and its results should be widely shared. They should be humanity's shared heritage. The next ideal is called universalism, and this is the idea that science does not change based on the way that you look at it. It does not change if you are a conservative or a progressive. It does not change based on your race or national identity, and that there should be universal standards to which scientific claims can be assessed. The next is disinterestedness. This is the idea that scientists should not have a personal stake in the things that they're discovering, that the benefits of science are for everyone, and they're not about personal or institutional advancement. And the final is organized skepticism, or just skepticism. And this is the idea that a question is not answered until the answer is questioned. That when claims are made, scientists should meet them with a degree of uncertainty, a degree of skepticism, and should apply a healthy amount of scrutiny to claims before moving on and accepting them as fact. This norm is where we see institutions like the institution of peer reviewing science come from. So sometimes these Mertonian norms are violated. And I'll just go over a few violations of the Mertonian norms that we see very often in science now. One is irreproducibility in legitimate research. Everybody wants their findings to be reproducible, wants them to be accessible to others. That's that communalism norm that we talked about. But sometimes it's just not because of factors that are intentionally or unintentionally introduced by these scientists. So one is a lack of data sharing. Sometimes scientific articles will just not share the data that they have automatically. And even if they have a statement like this, where they say the underlying data is available, it really isn't. It's really hard to get that data from the scientists in question. So this is one source by which the norms of communalism and universalism can be violated. Another, which I'm sure we'll be talking about a lot over the course of this summit, are conflicts of interest. So a study might be funded by a company that has a vested stake in the success of the product being studied, or a scientist might be receiving payments from a particular funder. Whether those conflicts of interest are declared or undeclared, they can represent a violation of the norm of disinterestedness. And then you have things like gatekeeping. Not all scientific articles are publicly available. A lot of them, like this one, which is cheekily called The Growing Inaccessibility of Science, are paywalled, so that you have to have the funds or an institutional affiliation to actually read that article. And this can be a violation of the norm of communalism. And then we have fraud. Fraud is the deliberate introduction of lies into scientific findings to make them say one thing or another. This can be a violation of all four norms, depending on the way that you look at it. On the right here, we have a series of results which were published in a peer-reviewed journal showing an assay called a Western blot. And you can see that there are various parts of these Western blots that are identical to one another. And that's because this image has been manipulated. Western blots will never be exactly identical to one another, but here you have these results of this cancer paper that have been tweaked to show a particular thing. I call this small scale because when you see fraud like this, normally these small scale image manipulations will happen within a single laboratory, or there's a single person that is fudging the results and other people, even within their laboratory, are not involved in it. And then sometimes you have very well organized fraud, which we'll prefer to call systematic fraud. One instance or one example of systematic fraud is called paper milling, or paper mills, or research paper mills. And these are organizations that sell pre-written scientific publications and sell the opportunity for people to add their name onto those publications and get them published guaranteed in peer-reviewed journals. So here's an advertisement from a paper mill where our model is suggesting that you can send papers to this paper mill and they will get them published quickly, guaranteed, in journals that are indexed by services like PubMed, Web of Science, Scopus, etc. So you'll see a lot of advertisements from paper mills if you just go looking for terms like co-authorship available, Scopus index publication, PubMed index publication, on Facebook, on Twitter, on WhatsApp. You'll find these advertisements everywhere. Here's an advertisement from a paper mill that's selling authorship positions on 3 different papers, and they give the titles. And if you look up these titles, you'll actually find that these papers have been published now. So this was a successful advertisement. But the variety of there's a huge variety of services that paper mills can offer. They can sell pre-written manuscripts. They can just sell guaranteed acceptance. They can sell authorship slots. They can sell data underlying manuscripts, images. They can offer to manipulate peer review. They can sell citations, which we'll talk about in a second. But generally anything that you can think of as belonging to a scientific paper, a paper mill is selling it. And often these are the same businesses that are also selling, will write your essay for you, or will forge this certificate for you, or forge this degree for you. This is a well-connected ecosystem of different services that are offered within the global enterprise of education and scientific fraud. One of those services, or one of those manifestations of systematic fraud in science, are called predatory journals. And these are journals that, broadly, the definition is controversial. Nobody wants to be called predatory. But broadly, I like to think of these as journals that masquerade as legitimate peer-reviewed journals, but are lying about their services in some way. So that could be saying, we have all of these well-recognized scientists on our editorial board, and in fact, they don't. None of those scientists actually agreed to be listed. Or we peer review all of our publications, and in fact, none of their publications are peer-reviewed. They'll just publish whatever anybody sends their way and sends the money. They might even lie about publishing it altogether, because you'll send the money and then you'll see that that money is now gone and then the journal has disappeared. And you'll also see lots of other predatory behavior from these journals, including blackmailing, identity theft, lots of other stuff. These are 3 different journals that are widely considered as predatory. These first 2 journals are actually a category of journals called hijacked journals. And the idea behind them is that these were once legitimate journals that their publisher stopped working on them, or their domain name expired, and then an illegitimate journal moved in and started accepting articles under that name. And you'll see lots of articles in these publications that are not at all relevant to the stated scope of the journal. So you'll see like articles about medicine in this Egyptology journal. You'll see articles about the design of engines in this journal about HIV/AIDS nursing, that sort of thing. I alluded to the sale of citations. So citation counts are a very common way that scientists are evaluated. So it can mean a lot if you have a higher citation count for your career prospects and for your opportunity for promotion. So you'll often see advertisements from businesses that will boost your citation counts in services like Google Scholar, for which it is very easy to do. So easy to do that myself and my colleague Nick Wise actually devised a plan based on this advertisement and finding out exactly how they manipulated citation counts, to give my grandma's cat Larry 130 citations to his papers. And these papers were auto-generated by a very old scientific paper generation program. And they made it into Google Scholar. And for a time, Larry was the most cited cat in the world. And it took maybe an hour of work for us to do this. So this is beside the point. Citation mills are yet another manifestation of paper mills, education fraud, and all of the services that they can offer under the same roof. So broadly, the sentiment is that scientific fraud is becoming more frequent. This plot shows counts of papers over the years, with a cutoff in 2020, but with projections up to 2020 or 2030. And it's shown on log scale. So we have 10 at the bottom, then 100, then 1,000, then 10,000, and so on. And here at the top in black, you can see all scientific articles are doubling at a rate of about doubling every 15 years or so. Whereas articles that have been retracted, removed from the scientific literature, and articles that have been pub-peer commented. Pub-peer is a post-publication peer review site where people can leave comments on any article, and I'd highly encourage people to use it. These have been growing at a rate where they're doubling every 4 years or so. And then suspected paper mill products are suspected to be doubling at a rate of every 1.5 years. So relative to the growth of the overall scientific enterprise, science that has been labeled irreproducible or potentially fraudulent in origin has been growing at a much faster rate. So how do these things get spotted? Generally, there is a large global community of people that I myself am a proud member of. You'll see them referred to as the post-publication peer review community, or the science integrity community, or the community of scientific sleuths. And these are people that go through the published literature and look for markers of impropriety and basically try to make science better at self-correcting by looking for these errors. So one way that a lot of fraud gets spotted, or a lot of improprieties get spotted, particularly paper mill products, is the reuse of images. You'll see this a lot in biomedical publications because images are used very often, particularly in preclinical studies. So in this instance, you have these 3 images of cells that have been used in this paper to represent 3 different conditions. In fact, if you rotate those images, You can find the exact same images on another paper. So it goes to show that one or both of these papers is lying about what these images actually represent. And you'll see concerns like this abound on PubPeer, which again, you should be visiting, especially if you're a practicing scientist. They actually have browser extensions that will let you know when a paper has been commented on PubPeer. You'll also see things like articles will pop up in journals where they are definitely not supposed to be there. So on the right, we have a article about breast cancer image classification, but the issue of the journal that it's in is about wearable devices. So this is an indication that it wasn't actually peer reviewed and it was just agreed that it was going to show up there. And you can also see that it was accepted in only around 40 days, which is really fast for a scientific publication. That's another way that some of these things get spotted. One of my favorite ways that improprieties get spotted, and indeed these signatures have been found in tens of thousands of publications now. You can look at something called the problematic paper screener to see a lot of them, or read the reference at the bottom here. Something called tortured phrases. And these phrases come about because it is much easier to plagiarize a scientific paper than it is to write an original scientific paper. However, a lot of journals now employ plagiarism detection software. So you'll get caught if you're trying to plagiarize something, but you won't get caught if you put it through a synonym engine, a rephrasing engine like Quillbot or Grammarly. So it will change the text to something that's more original, but sometimes it will take established scientific terms and turn them into something that they're definitely not supposed to be. So on the left, you can see the text that an author is trying to plagiarize that will say like breast cancer is the leading cause of cancer-related deaths. And the tortured version of this that comes out the other side of the rephrasing engine is bosom disease is the leading cause of malignancy-linked deaths. Nobody would actually talk like this in a scientific publication. But the fact that you see these in the literature anyway means that the publication was probably not peer-reviewed at all, because any peer reviewer would see this and reject or request a change to it. Here are a few pairs between tortured phrases and the term that they're torturing. One of my favorite is man-made brain power instead of artificial intelligence. And there, again, are thousands of instances of tortured phrases like this that you can browse in the problematic paper screener. You can also look at instances where the tools that are listed in the article don't actually work. So one of those tools is nucleotide reagents, which are used to probe a particular sequence in a genome. So often these will be included in the publication just to show this is the sequence that we use for this. And actually you can double check to see if these sequences actually target the gene that they claim they're targeting. And often they don't. You'll also see stuff like implausible experiments. This is one that I found where they were saying that this particular gene deleted in azoospermia 1 or DAZ1 was being found at elevated levels in these breast cancer tumors. The issue is that DAZ1 is on the Y chromosome, and all of these breast cancer cell lines are in female 2X chromosome from female patients. So it is literally impossible to find this gene in these cell lines. So this is clearly something's gone terribly wrong. Another signature that I work very often in is the use of scanning electron microscopes and the documentation of the instruments that they use. So sometimes the instrument that gets listed in the text is not actually the instrument that gets shown in the images. So in this one, they said that they used a Leo 1455 VP in the text. But if you look at the metadata banner that's included in the image, you can see that the image actually came from a test scan Mira 3. And we suspect that this is an indication that the images and the text were plagiarized from different sources. So briefly, why does detecting all of these improprieties actually matter? As a demonstration of how far things can go if fraud is not detected quickly and at scale, I'd like to tell the story of the biochemist Bharat Agarwal. Bharat Agarwal was a professor at MD Anderson Cancer Center that worked on natural products and their role in cancer for many years. And one of his favorite compounds that he would publish about is called curcumin. You'll find it in turmeric, and it is a staple in Indian traditional medicine. And Bharat Agarwal published frequently about how curcumin is a potent inhibitor of inflammation. It can help treat neurodegenerative, cardiovascular, pulmonary, and other diseases. It can treat arthritis. It can treat eczema, all sorts of stuff. You'll see curcumin hyped up a lot in cosmetics, actually. And like I said, he published on it very, very frequently. And as a result, I suspect of his work on this compound, which started in the late 90s, curcumin has become a very popular research topic. There's been thousands of studies published on curcumin, and the majority of them to this day still cite Agarwal. The only problem is that Agarwal likely made all of his studies up. 30 of his studies about various compounds have been retracted, and many more have serious problems with them. And it's likely that Agarwal was a serial fraudster in making up a lot of his research. And also, curcumin is what's known as a pan-assay interference compound. And it actually will just light up in any biological assay you throw at it. So it can mislead you into thinking that it is actually working, when for any of these diseases that I've mentioned already, it doesn't work at all. There is no proof that it works for anything, really. And no well-powered clinical trial has actually found it to be an effective preventive or curative treatment for any disease. Despite that, and I would speculate in large part thanks to the prolific research fraud of Agarwal, curcumin has remained incredibly popular as a research target. And for instance, the NIH has poured hundreds of millions of dollars into research on curcumin. And it's been researched heavily throughout the world. I would contend that these are funds that have been misdirected. And you'll also see a lot of misinformation about curcumin online that will lead people to believe that it is preventing them from developing cancer or even treating their cancer. And I think that that is a shame. And this is all something that I believe could have been avoided if Agarwal's fraud had been caught earlier, and had not allowed to metastasize into this large global enterprise of curcumin research that we have today. So with that, I'd like to thank you for listening. A few of the sources of my funding are on the right side of the screen. I have a somewhat old picture of my laboratory on the right side as well. If you're interested in this sort of thing, I have a list of resources and people that you can read more about science integrity issues from. Yeah, and you can reach out to me. My email's at the beginning of the slides if you have any questions. Thank you.
Thank you so much, Reese, for that presentation. We got a question.
Absolutely.
About your cat. Or sorry, your grandma's cat.
My grandma's cat, yeah, Larry.
For a time, did another cat overtake Larry?
No, Larry is still king, especially in my heart. But as soon as we made our announcement that Larry had done this, a bunch of media organizations started reaching out. Some of them reached out to Google. And in fact, Google took down Larry's profile a week later, on his birthday, no less, which made it very personal for me. But the worst part about all that is that Google Scholar did not actually, still hasn't removed any of the papers or profiles of the people that we caught paying for these citations. They just took targeted action against a cat instead.
And now your topic is super interesting to me, especially when I look at some of the journals that some of the research in my space is published in, from sustainability and also cosmetic science, biotechnology. It's MDPI. Is what I think about. I see a lot of activity from this journal on my LinkedIn, and it's been called to question as a potential predatory journal. Can you speak to that? And like, what's the issue of when there's like a week turnaround from submission to publication? What does that maybe tell you as a reader? Why is this important to consider?
Right. So MDPI is, I believe, a Swiss publisher. They publish like 300 different journals with names like Nutrients, Cells, Antioxidants. Anything that has a plural title is usually an MDPI journal. Cosmetics is another MDPI journal. Generally, the standards for peer review at MDPI are considered to be quite low. And as a result, a lot of junk winds up getting published there. Does that make them a predatory journal? Depends on your definition. I would contend that they do publish many predatory journals. And when you have these articles that are published very quickly, so like a week or two after they have been submitted, they've been accepted, or even a month or so, that's an indication that peer review was not performed very well. As anybody that has submitted a scientific article will know, it takes a while for the journals to find qualified peer reviewers that will agree to review your article. It takes even longer for the reviewers to actually review the article and to get your feedback back. And then often the peer reviewers will have comments that require you to revise parts of the article. And then you go back and forth and back and forth. And this process can take months, if not years, when it's done genuinely. So when you have these lightning fast turnaround times, that's an indication that not a lot of scrutiny was applied to the article before it was rubber stamped and sent to press.
And peer review is important, but maybe beyond the scope of this. Well, it's not beyond the scope of the time that we have. I'm just going to go on to the next question from Andre. That's fair. In what ways do fraudulent authors benefit? It seems very high risk. Maybe I'll just like tack on like, what has the structure? What have the structures in science been to incentivize this kind of behavior, from publishing in predatory journals to whether knowingly or not, because I think a lot of people don't realize, to employing fraud?
So funding is very limited in science. Jobs are very limited in science. In some contests, increasingly so. So science is a collaborative enterprise, but it's also characterized by very intense competition. As a result of that, if you want to get a job, if you want to get promoted, if you want to keep your job, if you want funding, you have strong incentives to perform better than your peers. And a lot of the ways that this is measured are by the number of publications you put out, the impact factor of the journal that you put it out in, the number of citations you have, the H-index, which is a measure of your scientific productivity. These are all things that you can juice, things that you can manipulate by engaging in fraud, be it at a small scale or by contracting the services of a paper mill company. It does seem like it would be high risk if you're caught. And that's the key, is that very, very few of these instances are actually caught, and fewer still actually wind up with consequences for the perpetrators in question. So there are we know that there are hundreds of thousands of studies out there that have very serious issues that indicate fraudulent provenance or other things that would be retractable, but only around 10,000 articles get retracted every year. And then there are many people that have lots of retracted articles and just don't see any career consequences. So there is very, very high reward with relatively little risk.
This next question comes from Cream Scan. What about studies in legit peer-reviewed journals that are pre-designed to prove a certain formulation or ingredient work? So, does this happen in legit journals? I just want to remind people of the presentation that Lanesa had, and this kind of conversation came up. And then also of one of Reese's slides with Argawal, however you say his last name.
Mm-hmm.
The journal was Elsevier.
Yeah. These things happen frequently in all manner of journals. So journals that are legitimate from these big international publishers, or that have these really high impact factors, are not at all immune from this. In many cases, these journals will be targeted for fraud specifically because of their impact. So you spoke about studies that are designed to prove a particular hypothesis. That's very frequent, and you're going to see legitimate scientists doing that all the time, sometimes unintentionally, just selecting for results that they know are going to give them that. And you're going to find that in all manner of journals, legitimate and illegitimate, however you define those terms.
I'm just going to ask one more question. We're over time here, but
No,
man,
okay.
This topic is so fascinating to me. It is within my research interests, so obviously it's particularly interesting to me. I'm sorry. We're just going to be running a little late, maybe 5 minutes late. Okay, this
I'm
question
always
is
happy to talk.
from Victoria, who asks, do you consider there is a lack of reproduction studies in the literature? Do you think that they're seen as not as important? Also, maybe you can speak to the journals don't necessarily want to publish negative results, and therefore there may be an incentive for the researchers who've been dedicating so much time to something to get a positive result. Yeah. How do you think about this?
It is a lot flashier for everyone involved to publish a study where you're like, we found this new exciting thing, we invented this new thing, something that's completely novel, something that's completely new, than saying we replicated the study that this person did and we found the same results, or we found different results. It's perceived as, being higher value to science. It's definitely is in some circumstances, but there is immense value in revisiting the published literature and testing claims that have been made in the past, or evaluating those claims with scrutiny. That's one of those Mertonian norms that I mentioned of organized skepticism. You should revisit things. Unfortunately, this is just something that doesn't happen a lot. That's beginning to change. There are a lot of large-scale replication efforts that have been launched recently. The journal Nature Human Behavior is now revisiting all of its published studies and trying to replicate them, which is pretty cool. And we're seeing more and more journals publish replication studies. Will there ever be enough? Probably not. But this is something that would be really crucial for enforcing the idea that science is a self-correcting process.
Well, that's all the time that we have for our Q&A. We did go over. If you want more from Reese, he was on my podcast last podcast season where we had an hour and a bit, I think, of a conversation on this topic. So tune into that. But thank you so much, Reese, for
Thank you
contributing
so
to the
much, Jen.
summit.
Yeah, this is amazing. Thank you.
Thank you. Our next presentation will be by Dr. Jeni Thomas, who is the Senior Director and Principal Scientist at P&G Hair. Jeni has been studying hair and scalp science for more than 17 years. Her fascination with hair began at age 13 when her once straight hair mysteriously turned curly. More than a decade later, and after completing her PhD studies in analytical chemistry, she turned her scientific curiosity to the world of hair. She learned that her teenage hair mystery could be explained, yet many other unanswered hair and scalp questions remained. Jeni's work at P&G Beauty has included research and partnerships with experts around the world to deepen our scientific and consumer understanding across all topics related to hair and scalp health. Throughout her career, Jeni has designed studies to answer common hair and scalp questions, such as, does rinsing your hair in cold water really give you a better shine? Published research on a range of hair and scalp topics, and co-founded a new brand focused on improving scalp condition to improve hair retention. She now leads P&G Hair's global scientific communication and education programs to provide women and men with information they are seeking for the best hair and scalp results. Without further ado, here's Jeni's presentation.
This fireside chat is going to be about BeautySciComm strategies, sponsored by Procter & Gamble to offer thought leadership to other brands and leaders within the space, with some Scicomm campaigns from Pantene and Head & Shoulders as case examples. A massive thank you to Procter & Gamble for sponsoring this fireside chat. It's because of our sponsors that we're able to continue making our e-summits free and accessible to anyone, so a big support for our science communication here. Joining me for this chat is Dr. Jeni Thomas, who is currently leading the Procter & Gamble Global Hair Science Communication team and has close to 20 years of experience working with Procter & Gamble hair care portfolio brands. So my first question to you is, why do you think Scicomm is important for brands, and what can that look like?
So first of all, Jen, absolute pleasure to be here with you and the science communication community, which I feel is doing such important work. And science communications really has an important role to play when it comes to helping people make more informed choices. There's more interest, there are more platforms than ever before, so there's more that we can do with it. As you mentioned, I've been in this area for about 20 years, so I've seen the big evolution and love the appetite there is for science information today. And brands, like any science communicator, we have the responsibility. We must respect the objectivity that science brings to the conversation. And in doing so, we can help people sort myth from evidence-based fact. And then you even have some categories, hair care, for example, where a large majority of the body of publicly available scientific information comes from the investment that brands and manufacturers are making in research. So we have an important contribution to make, and we have to take that role very seriously with the responsible approach to it of bringing good science to the conversation.
Yeah, and I feel like this is something that I've talked about quite a bit, and I know Michelle Wong at Lab Muffin Beauty Science has as well. Just this need for science communication, both in actually doing it and or supporting Scicommers to combat some of the misinformation. Because I think that part of the informational landscape that we currently are contending with comes from? Well, first, there's been a lot of misinformation coming from many angles, from marketing departments and maybe some unscrupulous claims to some of the things that we see out in the media. But I think the other part of that is to fill some gaps, because some of this information historically hasn't been accessible. Now we see, well, people are filling in the gaps because they don't understand about regulations in chemistry and toxicology that, well, cosmetics are unsafe. With that, in your time with Procter & Gamble doing what you've been doing, what have you learned about science communication strategies?
A lot. I think in terms of overall approach, I tend to describe this by thinking about finding your path. So I'm sure in many places, but definitely in P&G, there's a love of acronyms, and PATH is a good one for how I think about science communication strategy. So the P being the purpose. What is it that is important to communicate? Is it a myth that you're busting? Is it a need that you want to address? And why does that matter? A is the audience, which is who is going to care about the science behind the topic that you're focused on or you're interested in. Is that audience receptive to what is going to come from you as a brand who wants to talk about it, or from whom else would they appreciate hearing the message? But then the message is like, what's the theme that you want to communicate? Because there's no end of choices when you're working with a brand. There's so much stuff that goes into creating a product or creating a brand. You're always in a land of making choices. What are the most important themes for the brand to be communicating? And which of those should be rooted in science and should be explained with the science behind them? And then the H in PATH is, how are you going to get there? What do you need to most effectively communicate the theme that you're trying to get across to your audience? Assuming that oftentimes your audience may not have the same level of technical depth. I mean, this is the nature of all of the science communication work that this community is doing. So how do you clearly communicate something that might be rooted in really in-depth science to those that they want the so what of it or the significance of it, but they may not want to go into the great depth that some other people might really enjoy. So really, how can you effectively get your theme across, which may be through other people, not just through you, depending on who your audience wants to hear those messages from.
And I think it's really interesting that science communication is like this brave new world, I guess, because about 10 years ago more than that, oh my gosh, I'm getting older. 15 years ago, since I was doing my undergrad, science communication wasn't really a career path that a lot of people were talking about. When did Procter & Gamble really start to think about this? Like, historically, I've observed, and I think this also maybe ties into some of the misinformation that we've seen on the market. There's been a disconnect between the marketing department and the science department, and so maybe the science communication part kind of closes some of these gaps there. I also wanted to say, while you were speaking, another really important thing when I'm looking at science communication strategies for brands is just to make sure you're factual. So it's easy to say for P&G, you've got the smartest people in the industry. But if you're a smaller brand who maybe doesn't have those same kind of resources, maybe consider working with an external fact checker to make sure that what you're saying is right. Just because this is something that I've observed on social media is brands talking about important science topics, but then just kind of getting it wrong and then losing trust in some of the communities that they were trying to build trust in.
I think this goes back to, the foundation that we were talking about. I think there are many people that are doing their best to inform their communications based on what's out there. And when there are a lot of gaps in that, really objective science foundation, it makes sense that people will draw their own conclusions. And so one of the things we need to do is shore up that foundation as we learn more, publish more, get more of that real research out there, which can enable people to, find their own communication that's rooted in the research that they feel confident is as factual as we know it to be based on research. So the more that we can do the research and publish the research, I think the more that we enable people to have fact-based science communications. In terms of P&G supporting science communications, I mean, this group has been around since the early 2000s. The work was being done before, but recognizing, hey, there really is interest in this, and there's a skill set that should be fostered that is rooted in first a deep technical understanding, but also just a passion for the education part that comes with it, that you're helping to bring deep science information to a wide range of people who are interested in it, but are interested in to it different degrees and different components of it. Some people really want to get into, well, how do you know that that claim you're making about, a hair care product, that it's reducing frizz, for example? What testing have you done? And so you can go into great depths about the testing that's been done or the chemistry that's involved in giving hair the ability to resist frizz longer. And then there are others that just want to know, like, what is this ingredient, why it sits in there? So you need to be able to have a grasp on all the science behind the research that's been done and the product chemistry, the anatomy, the way that it's working on whatever part that it's serving, to be able to satisfy the curiosity that any range of people have. And I've loved seeing over the almost 20 years that I've been doing this, how the audience that's interested in this information has grown exponentially. It used to be just a very small audience who wanted to know more about it. So take, for example, academic partners or, dermatologists who were being asked a lot of questions by their patients about cosmetic products, and they were curious to know more about ingredients and formulations. And we had people who wanted to engage in these conversations. And now you have, just across the general public, this vast interest in science. And it's up to us to find the right ways to get this across to them in a way that's satisfying the curiosity and helping them make more informed choices.
I really like that you brought up publishing more, because I think historically a lot of the science, and I know many people who are watching will know this, has been kind of kept behind closed doors within corporations and not published into journals. So publishing into journals is huge to now make this information accessible even to academia, let alone to other brands. And then the other thing that P&G does that's been a huge help to me, and I'm sure many other people, is publishing white papers on more difficult subjects that there's a lot of noise. And one example, it's not a brand that's represented in this talk, but is with Herbal Essence. You had a white paper on safety standards between synthetic ingredients and botanicals, and it was just very informative, very easy to understand for somebody who, when reading, didn't have a background. And so that's the kind of thought leadership from larger brands that can cascade to contribute to knowledge in smaller brands and independent professionals. But then moving on from what we've been talking about to more specific cases within P&G, can you give some examples with the two brands represented for this talk, Pantene and Head & Shoulders? What were the misconceptions? How did you go about addressing them? And what were some of the challenges the brands had navigating along the way?
Happy to give those examples. I do want to say kudos to you and to the science communication audience broadly, as I think that you've helped encourage others to publish that research, because you show that there's more usefulness for it, beyond it being out there, but using that as a tool to help people better understand, what's really behind this and what they should be considering and what's known or not known in this space. So thank you for giving this a bigger role to play in sharing all of this research with the broader public. So you've had a big role in this too. On to a couple of examples of science communication and, taking this idea of the path and bringing it to life. There are a couple of examples here, but there are many. First is around debunking the myth of the scrape test on hair, which, Jen, I know you've seen this. We've talked about this, and we believe that there was a lot of misinformation that was spreading because of this test that is not only leading people to decisions that may or may not be right for their hair, but the test itself is incredibly damaging for hair. And it was causing fear too, that hair care products that are more affordable, like those that you might find at a drugstore, fear that it's doing harm to their hair. And for people, shame if perhaps you're someone that's not able to afford higher price products, that they might feel shame that that is accessible to them. So that's not okay. But if you've seen the scrape test, which is about using very sharp scissors to rub along your hair, look at a residue that's created, and that being communicated as proof that products are causing a lot of builder residue in your hair, we thought, this probably isn't true, but we needed to be sure before putting efforts behind busting this myth that it really was a myth. We had our own beliefs as to what was happening. So then we ran our own scrape test to see what really is in this residue. When you see the scrape test, it's usually done on somebody's hair and you only see that one hair sample. So what we did was we ran the scrape test on hair that had been treated with a Pantene shampoo and conditioner, and another one that was treated with a very high price shampoo and conditioner, because that would say, hey, if you see residue on the Pantene but not the other one, then maybe there is truth to the idea that a drugstore product is working differently on your hair. And then the third sample was clarified hair. Like, if this is a test of product buildup, then you would expect to see no residue on a sample of hair that had just been purely clarified. So we wanted to put the right controls in place, because that was not often shown whenever people were seeing the scrape test in a TikTok video or wherever they might be seeing it. And so the research said, yes, this is indeed a myth. The residue that is coming off of hair when it's scraped with sharp scissors is cuticle. It's not product buildup. And we also saw there's not a difference in the residue between the hair that was treated with a drugstore system versus that was treated with a pricier product. So really, this is not saying it's a test of product performance. And because it was the same residue that came off of the clarified hair, it was proof this is fiber destruction. And it's not product related. So then after having this data, and because Pantene is a brand that's all about hair health and improving hair health, that made it especially important for us to bust this myth. So that became our purpose, because we felt like people were being misinformed, were being put in a position of feeling shame or like they needed to pay more to do right by their hair, when in fact they can do right by their hair with many options. So then our audience was those who see the scrape test in social content, or maybe they've been the one in the chair at a salon where someone has done this to their hair to try to convince them that they shouldn't be using drugstore products because, being told that those are bad for their hair. Our theme then, coming out of this research that we did to better understand what's really happening when somebody does the scrape test, became 1, the hair scrape test is a myth and it's destroying your hair. And 2, drugstore products can work as well as higher priced products. And what matters most is really what you find works best for you and your hair. And if you want to do some digging, really look into what's out there to help you understand, like, hey, drugstore products can be just as good. So then how we went about communicating this was with the help of others who shared our interests in going against this purpose. So we found partners among this community, Jen, looking at you, who wanted to help with the science communications behind the scrape test. So we shared with them our research and asked them, hey, what do you think? Do you think we're missing anything? Do you agree with the conclusions that we're drawing? Would you want to help us out to communicate this, or even give the test a try yourself? Jen, kudos to you, because I know you even sacrificed your own hair in the name of hair science.
I'm sure you've seen videos of people doing similar scrape tests, saying that all this is silicone buildup. Actually, it's not. Here's what's happening when you do a hair scrape.
As part of busting this myth, that was really important, because in how we got this across, we couldn't really go as far with Pantene sharing these results directly. We can go far, but not as far as we were able to, because it's just not so believable. Like, hey, Pantene says Pantene does not cause buildup on your hair, which is something that so many people have come to believe over the years. This scrape test is working to bust that myth. But, as we learned from the responses to our partners' content, like yours, Jen, we were able to find our own ways to build on it and share what we saw in our own labs and keep that conversation going. I know you had asked about challenges and what challenges did we face along the way. It's the nature of any, brand science communications or brand communications in that there's so many things that a brand could talk about. So it always comes down to a matter of choices. What's worth putting the spotlight on or investing in, and why is something like this that's so atypical worth investing in? It's just a matter of choices. It's not traditional marketing. It's not even promoting Pantene. And overcoming a negative is really, really hard to do. So why give this attention? But what got people on board with giving this some attention was really the belief in the purpose, that this misconception that people had creates a significant challenge for Pantene consumers as well as the brand. As you hear people talk about, I'm sitting in that seat and I'm being asked to pay for this product that I can't afford, but I feel really bad that I've done something wrong to my hair. That purpose is strong enough to say this is worth going after. And then the second way was to say, hey, I know this is atypical, but let's start small. Let's learn as we go, and then we can gradually do more as we see how receptive are people to this kind of information. And because myths take time to, really take hold, they also take time to bust. Doing new things means learning as you go and having partners in your marketing team who are also happy to learn as you go. That's the scrape test example.
For everyone who's watching, this was my first, I think, sponsored post I've ever done on this platform. Previously, I was allergic, and then I realized, wow, I probably need to think about this to be able to make money doing science communication, to actually make this a viable career. I just wanted to interrupt this to say that this is one way that brands can support science communication, obviously doing their own thing, but supporting independent science communicators who've built up this platform, who's doing all of this work generally for free. Doing sponsorships like this every once in a while is a huge help to make this sustainable for us to continue. And then to the Head and Shoulders example. I'm not as familiar with this one.
Okay, so this is about correcting misinformation when it comes to treating dandruff. And I know we've talked about when the foundation isn't fully there, either because it's not fully known or hasn't been published yet, people will draw their own conclusions as to what kind of advice to give. And so that's something that we're trying to do more and more of, is shore up the foundation with research that makes it clear, what has become the norm, as in recommendations or accepted beliefs that sometimes is right. And sometimes we realize, that could be better, and science says so. And this is one of those cases where science says, actually, we need to rethink this. So the purpose of this example is about correcting misinformation that holds people back from getting better dandruff relief. And dandruff is something that is incredibly common. You've got about 50% of the adult population who experiences it at some time or other. And there's a lot of stigma about it, but it's really not about a hygiene problem. It's just, do you have scalp skin that reacts to this environment that we all have? And half of us do, half of us don't. So a little bit of dandruff background before we get into the example. Dandruff is caused by a fungus that lives on our scalp, and it feeds on our scalp oils. So we all have this fungus. We all have the scalp oils. Some of us react to the byproduct of that feeding process of fungus feeding on the scalp oils. Some of us don't. So it's kind of like an allergy or a sensitive reaction that some of us have, a lot of us have, and others don't. But that reaction, for those of us who are prone to it, is the scalp skin turnover rate accelerates. So it can go from what should happen over a 28-day period to happen as fast as a 7-day period. And when it accelerates like that, the scalp skin doesn't mature as it should, which turns into a disrupted scalp barrier. And that can show up as visible flakes. It can show up as feeling dry, feeling tight, or feeling itchy because of the barrier disruption. When it comes to dandruff, there is not a cure for it, but it is something that you can manage, and you can manage it as part of just a normal hair and scalp care routine. That's been the norm for many, many years. And products do that mainly by working to target that fungal source of dandruff by addressing the overgrowth of the fungus that can lead to this scalp skin disruption. And the challenge that we faced is the common belief that anti-dandruff shampoo should be used only once in a while, like maybe once a week, every few washes. But we knew from a lot of research that people who experience dandruff and use an anti-dandruff shampoo less than, once or twice a week, they tend to struggle a lot more with dandruff recurring than those who use an anti-dandruff shampoo every time they wash their hair, just as part of their normal routine. To change that belief around what's the recommended best use, we really need to get more data to give the right guidance. This took some clinical research, and we did 2 clinical studies here to then shore up that foundation. One was around wash frequency. There were a couple of studies that were done to learn what happens to scalp health and hair health if you go from the extremes of washing 1 time a week to then washing daily, because there's fear that washing that frequently will be bad for your scalp. And this research showed that actually the opposite is true, that higher wash frequencies correlated to better scalp outcomes. So this was a couple of studies that were then published a couple of years ago. But then the second thing that we realized we really didn't know is what's happening as you go from having your scalp in good condition. So you've got your dandruff under control. And then what happens when you stop using that anti-dandruff treatment? What's the progress of changes? And so we did a clinical study in reverse. So oftentimes you start with people who they're experiencing the dandruff condition. Their scalp is fully flared. And then to look at, is a treatment effective or not? Then you introduce the treatment legs and you see how does that flared scalp go to something that hopefully is under better control. In this case, we started with scalps that were under better control, and then had people just go to a non-anti-dandruff shampoo, just a cosmetic shampoo instead, to see what happens to your scalp. What's the sequence of events? That's when we learned that when you stop using an anti-dandruff shampoo, in as little as 3 days after stopping, the overgrowth of this dandruff-causing fungus returns, and you begin to see biomarkers of itch and oxidative stress, suggesting that scalp health is declining. That says that now had more of this evidence-backed proof to say we need to change the prevailing thought as to what's the best way to get dandruff under control, that just using every few washes is not going to give you that best control if you're someone that's struggling with that constant recurrence. So clinical research says, hey, it's best to adopt an anti-dandruff shampoo as your main shampoo versus switching constantly and get to every use. So our audience for this has primarily been the dermatologist community, because they're very interested in helping their patients find the best way to resolve their scalp issues. Like, even if somebody's coming to them for acne concerns, for example, they're often also bringing up, hey, my scalp is also irritating me, and it's just this nagging problem. And so they're someone that's very interested in understanding how can I best help them. And so our key theme then has been, this clinical research has shown that using anti-dandruff treatments like these shampoos with every wash can give you better control over dandruff. And then how we've been working to communicate this is, one, by publishing the research, by presenting the research so that the dermatology community can assess for themselves what do they feel is right to be recommending to their patients who are expressing concerns about a dandruff affected scalp. And then repeatedly sharing the research, because that former school of thought had been in place for decades, if not longer. So changing that is going to take time. And so we need to constantly remind of the research, share it whenever we have the possibility to do so, sharing those references to help cause that shift to what really can make a difference rooted in this clinical research. As we talk about challenges that we face here, this type of research, it has a long lead time to do clinical research or mining old studies, but looking at them differently, and then to go about publishing and presenting. This isn't something that is, from a brand point of view, think about, oh, we're going to be launching a new product. We should talk about it as we talk about that new product, because it's such a long lead time and very different timelines than when you might be bringing a product launch. So we really have to think about this as communicating this with the brand and how the brand is showing up with education, disconnecting it from any individual product launch. And therefore we should be focusing on the research that has the biggest impact for getting people, back to the purpose, getting people to their best options for getting their dangerous situation under control.
Now, my final question to you is, do you have any takeaways that you'd like to share with our audience, be that other brands or just general consumers who might be present here today?
I mean, I think one of the big learnings that I've had over the years is you really have to start with a purpose that matters and that matters to other people. So, as we work with our marketing partners, that we all believe, hey, this is something big enough to go after. And when it comes down to choices of what to focus on, that the purpose is so important to be addressing that you can get people on board. And even external partners are happy to join in because they have a shared interest in that purpose. And so understanding, from what myth or misconception, like what's fueling that and what can we do to address it and what we can do more when we can do it together. And finding those partners who share the interest in this purpose and who have the expertise and the credibility that complements what you bring to the table. So big, meaningful purposes, they really take a village to effectively make progress against. And then there's the consistency is really important when you're trying to tackle long-held beliefs and you're competing with so many messages that are out there. It's usually not a one and done. So it's more effective when people hear things, multiple times to get that attention. And then the other thing is just, I think we can continue to make progress the more that we share very well-researched understanding of whether it's in my world, hair and scalp science and what we know about products and treatments, their abilities, their limitations, what they're rooted in. And the more that we can make that publicly accessible, the less that people need to fill in the gaps with some assumptions, but it really can be rooted in science. So again, that's a big responsibility that I believe we have as science communicators.
Our next presentation will be by Dr. Jess Stokes-Parish, who's a nurse and educator who's worked across a number of sectors and settings. In her role as the Associate Dean of Student Affairs and Service Quality at Bond University, she works with students to co-design curriculum and support initiatives in a tertiary setting. Jess holds a PhD in medical education and a graduate certificate in science communication. Jess is an active science communicator and an engaged public health professions educator. She loves storytelling and reimagining evidence in ways that are easy to access and understand, including through the use of social media. Jess is an advocate for inclusive practices in education and healthcare and contributes a large portion of her time creating accessible science content for health professionals and general public alike. Without further ado, here's Jess's presentation.
Hey there, all the way from the Gold Coast in Australia. Thank you so much, Jen, for the opportunity to talk today all about communicating science and the science of science communication. If you don't know me, my name is Jess. I'm an ICU nurse and a researcher based on the Gold Coast in Australia. I'm currently employed in the majority of my time as an academic at Bond University on the southern part of the Gold Coast. If you haven't been here, it's beautiful. It's worth coming, worth the travel. And I work in teaching health professions education, and I have taught a range of topics, clinical education, right up to science communication. And science communication is one of my areas of interests. I have done research in it, I've done training in it. I have a personal passion for it that stems from late nights, feeding my children and seeing the volume of misinformation that's online. So why am I here today? Well, I want to talk to you about science communication. I want to talk to you about what is science communication, why do we science communicate, and how should we science communicate? And I trust that you will find something useful out of the information that I share, which I hope will complement really nicely all the other discussions that you've been having around misinformation, strategies of science communication, being an ethical brand. And I'm hoping that I will leave you with some food for thought. So let's dig in. Firstly, what is science communication? This definition here is the most, the one that I connect most with. There's lots of different definitions of science communication, but I think this one fits best what I do, and I think it probably fits best what you do and what I know Jen and others do as well. Science communication is defined as the use of appropriate skills, media, activities, and dialogue to produce one or more of the following personal responses: awareness, enjoyment, interest, opinion forming, and understanding. Now, science communication is not new. It can be dated back to the 1800s, but the science for science communication is much more recent. Most of this science about science communication is not interdisciplinary, and it largely focuses on things like politics and environmental sciences. And the field of health science or other areas of science communication is much smaller by comparison, but we have seen a huge increase in interest in this area following on from the pandemic. So a lot of the literature that I'll draw from today has come from political or environmental sciences, but we are increasingly able to draw from health specific or other specific areas of science, but the principles are still the same. So who science communicates and who is interested in science communication? Well, broadly, everyone. But you can segment this into three main areas. You might have government, you might have research organizations and scientists, or organizations and corporations, and you might also have the public interested in science. And these are all for very different reasons. So for example, with the government, they're interested because they want the public to buy into policy and they want to have people to endorse their political strategies. Research organizations want to drive those policies. Research organizations want money. So science communication is a really important aspect of driving funding to those areas. And of course, the public uses science communication every day, even if they don't understand it or they don't know that they're doing it. The public is utilizing information about science to make decisions about their everyday life. There are a number of different modalities of science communication, which you will see from lots of different people. You might have traditional media, you might see science museums, you might see journal articles, and you might also see video or other formats. When we think about science communication broadly, there are three main models that are referred to, and these are dissemination, dialogue, and participation. Now, I could spend a whole workshop just unpacking this one slide, so I want to leave you with the TLDR, which is that dissemination is characterized by a one-way form of communication that is about getting information to a mass group of people. There's not so much opportunity for that information to be shaped by those receiving it, and it's often from a power base. So it might be from a government organization sharing updates about important pieces of science that are relevant to the public. Dialogue is more of a two-way type communication model, and it's about sharing ideas. It's about opening up questions, thinking about things more broadly, but the power still rests with the expert. And then finally, the more recent model that's come about in the last 10 to 20 years is the participatory model. And this model is, I guess, grounded in the idea that individuals that are going to be affected by the science communication should be driving the science communication. And this might be characterized by, say, hashtag trends on social media, say endo awareness or something like that, where the community has worked together to drive change and ideas, and it has informed what kinds of information the people want and how the people want it. Now, importantly, there is no right or wrong model. There is the right model for your specific goal. So don't dismiss in any of these models. Each of these different models works for different situations and different audiences. I've got a few little examples here that I think will be helpful to illustrate. And I'll just pause here for, say, 30 seconds. But you can see across these 4 different accounts, they use a number of different mediums. You can see that they vary from being either disseminatory or participatory or dialogic. And you can see that they have different tactics of how they utilize these platforms. So just to give you a broad idea. Now, I've briefly mentioned the different types of science communication, but there's a whole range of other subfields of science communication. So I talked to you a little earlier about environmental sciences, political sciences. These are the other 3 big areas that have been focused on. So debunking. So debunking has a whole field of research on its own. And it's a dissemination-based science communication strategy, but there's lots of different subsets. Then you have risk communication. So risk communication is more of a social sciences type of research, and it's related to, say, vaccine communication. And then, of course, political sciences, as I've mentioned. And interestingly, political sciences research tends to be led by the US researchers as opposed to other countries. So why do we science communicate? Well, there's a whole range of different reasons, but essentially with science communication, we can influence policy, we can build connection with groups that will be affected by a topic, we can remove barriers to accessing science, we can also contribute to behavior change, and we can contribute to a shift in society's perception towards science. And importantly, we can build trust. Now, this, of course, extends to social media. Social media can be an amazing tool to stimulate thinking, to provide useful information to people to make decisions with. We can influence democracy and so much more. And we know that that's backed up by research because social media influences attitudes, decisions, and behaviors. So we get to the really sticky part, which is, okay, that's great. We've got this theory. We know that it works. We know that we want it. We know that it's important for us to do. But how do we do it effectively? The first key is your strategy. And the second aspect is trust. Now, these are interwoven, and I just want to walk you through some of the key aspects of strategy and how the evidence base might inform this strategy. So firstly, if we take a moment to pause on strategy, this is all about you mapping a plan for success. So you start with research. What is your goal? What is it that you want to achieve through science communication? Is it you want to influence decisions? Is it that you want to see behavior change? Do you want to create awareness? Or do you want to create enjoyment of science? Is your science communication all about the joy of science? And then following on from that, who is your audience? Because joy in science or decision-making in science is different depending on who your audience is. And it's really important to know what do they want and what is important to them. Once you've been able to identify your broad goal and what you want to achieve, and you can spend that time looking at what their preferences are and what's of interest, you can then start to work through your strategy. And your strategy is that higher level overview of breaking down the goals. So it might be that you want to see people use sunscreen more often. Okay, so if your goal is that you want people to use sunscreen more often, then your strategy about science communication might be a multi-step process in which you talk about, first you want to raise awareness of sunscreen. You want to raise awareness of the harms of sun damage to the skin. And you might also want to break down some myths about sunscreen. So how are you going to break that down? How are you going to define it? How will you evaluate it? And over what time frame? Once you've developed those, what we would call overarching strategies, then you need to work into tactics. Now, the tactics are those smaller micro aspects. What are the steps that you'll take to achieve the strategy? And your tactics might be different based on the different goals. So for one thing that was about awareness, you might want something much larger to reach a broader audience versus something that's about more behavior change. It'll be a stepwise process to actually engage somebody and to be able to measure whether that behavior has changed. And then, of course, really importantly, what risk will you come across? What challenges do you think you might anticipate to you personally, to your company? What might be some of the unintended consequences? Okay, but what works? What contributes to success? So I want to present to you these 4 things that might help you with designing your social media or science communication content. Firstly, we'll go to visual attention. So visual attention is a really interesting theory, and this is basically a cognitive sciences theory which says that our eyes are the window to cognitive processes. Whether we are aware of it or not, our brain is working tirelessly to decide what it should pay attention to. And when it comes to science communication, that means that you need content that is high contrast, illuminated, bright colors, well-defined edges, because this is what will capture your eye's attention, and then your brain will pay attention to it. So you can see an example here with this and not that. You can see immediately your eyes are drawn to this. Okay, connection. Now this is a big one. So connection, if we think about connection, we can achieve connection through transparency, behind the scenes, acknowledging our power paradigms and how we might hold ourselves out there. But importantly, connection is all about trust, and trust must be earned. So what is trust? I really love the trust triangle coined by Francis Frey and Anne Morris, and they say that it's made up of these 3 things: authenticity, empathy, and logic. So trust is a contentious topic when it comes to social sciences and science communication, and there's different types of trust. And the key message here is that trust is not an object that you possess, and nor is it located in something or a particular message. It's contextual and it can change over time. When you think about trust as a concept, what comes to mind when you think of trust? If you think of somebody online that you engage with and that you trust, what is it about them that makes them trustworthy? And often it's these 3 things. It's they've been authentic to themselves. They've shown the behind the scenes. They've owned up when they've made a mistake. They've been transparent about what is outside of their area of expertise. And you don't feel this perception of an overreach or an overprojection of their expertise. When it comes to showing logic, this can be so fantastic to do on social media and with science communication. I think we probably don't do it enough, is showing people how we got to our decision making, showing people how we got to that end point. Because whilst there's this element of warmth and authenticity, there's also this craving of logic. People want to see the system of how you've thought, and they want to understand that you've used a logical process to get to that. And then finally, as part of the concept of building trust, we have empathetic. This is about being warm, not holding yourself up to be higher than the other. It's about really taking the time to hear what the other person says and to be okay with not proving yourself right. It's really easy with science communication to position ourselves as the expert and to hold that authority because we are the expert, but sometimes that can come across as arrogance. When it comes to success, it's also about credibility. It's about you being transparent with your expertise, the information completeness, what credentials you have, what evidence do you have to back it up. And in this study from 2017 on trust and credibility in web-based health information, what they found was that these 5 things increase somebody's likelihood of perceiving you or a website as credible. So the information was easy to navigate, it was complete, there wasn't missing pieces of information, the credentials were clearly on display, There was references and evidence to back up what you were saying, so they could go and look for more. And the information was similar to others. So this is where you might say, does your information line up with the consensus or with the body of evidence that's out there? And finally, the last key that I think and that we see from evidence is so important for success when it comes to science communication is using story. Story is an amazingly powerful tool. And of course, a story is made up of a narrative, or it'll have a resolution and a change. There's personalization. So it makes, the other person that's hearing the story can put themselves in their shoes, because that brings in this emotional hook and this ability to engage somebody beyond the intellect. As scientists or as people that are interested in stats, it's super easy just to be able to say, well, here's the stats, believe what I have to say. But stats aren't enough. It's also about the story. And using story in your science communication will increase people's likelihood of remembering information. It will also reduce counter-arguing. It will make people feel the experience being described was their own. It will be so much more convincing than data, as I've just said. And it also can increase engagement when communicating science to non-expert audiences. Now, there is a bunch of research on this, and there's been comparators of, say, using a story and using statistics only. And the really important thing is that it's not story or stats. It's actually story and stats. So when you're thinking about presenting your data, how can you ensure that you present a story, and how can you engage the person on the other end of the message or the dialogue, whatever you're talking about? How can you engage them in the story so that they feel part of it, and that will persuade them more with the information that you have? So I have jam-packed this session, this 18 minutes of conversation, with a whole range of different useful pieces of information. But what I want to end with is to emphasize that science communication is essential for society. But beyond that, every individual has some unique offering to bring to science communication. You might have a completely different style to me, to Jen, to Michelle, to any of the other speakers here today. But what you bring is unique and will be really important for somebody. But for that uniqueness to land, for it to do really well, is you must have a strategy, and you must think about the evidence behind how you communicate, why you communicate best to the audience that you're trying to meet. Thank you.
Thank you so much, Jess, for that presentation. And I think it's dark where you are. Thank you for, what time is it right now?
It is 5:30 a.m., so it's actually quite light outside.
Oh, you just have your blinds.
My lighting. Yes.
Okay, that makes me feel better. I thought it was much.
Yeah.
I mean, 5 is still very early, so thank you for waking up so early to be a part of the Q&A. We had one question come in from Anna, who asks, how can cosmetic chemists, particularly those who are newer to the field, navigate the fine line between feeling like they don't have enough or they don't know enough in ensuring they're contributing accurate science-based information? Maybe I'm also going to say, on the flip side, just because I've observed a perception from senior scientists who've kind of just like shook their head at the work. I don't know if they were really aware of the work that I do, but when I describe that I'm an influencer, I do science communication, like, who are you to do this? I don't get this as much anymore because I'm older, but certainly I did when I was a bit younger. And so I can imagine the impact that has for younger people. So like on the flip side, how do maybe older people in industry who do have that more experience think about younger people contributing and also themselves contributing as well?
Yeah, so I think it is a real challenge, and certainly when you're newer to the field, it can be hard to figure out your identity in the first place. So then joining the online space can be extra hard. What I would say is stick to, in those early kind of years, stick to things that you confidently know are within your scope, that you know that you can contribute to. You don't have to go straight into controversial topics or sticky topics. And especially if, you're feeling a little bit of imposter syndrome or you don't really feel like you measure up, uh, remind yourself of what you do know and what you are trained in and what you are skilled in. And so from that flip side of the seniority, and I don't know that it's necessarily an age or an experience thing from an academic perspective. I think for the majority of senior, and we're talking, people that have been in the field for 20, 30 years, they don't understand the social media landscape. And so that's never been part of their career for themselves. And my observations across adjacent fields, not so much from cosmetic chemistry or chemistry and beauty science, these people don't want to go near social media within a 10-foot barge pole. They have no interest in joining this space. And so I think some of that is the hesitance as well. And yeah, I think there is an overemphasis on how much expertise you have, and perhaps it is being weaponized in some way.
And that's certainly something that I've heard of, like not wanting to go near social media. I guess, is that short-sighted? This may be a leading question. Why is science communication on social media important, if you think it's important, as a medium for doing this?
I mean, well, as I highlighted in my presentation, we have data and we have evidence that shows that social media influences attitudes, behaviors, choices. So it's part of our everyday living fabric now, and that's why there's an emphasis on needing to utilize social media. And I think it's a generational shift. I think there's actually a lot of fear as well. I know certainly amongst my colleagues that are academics, they're really scared about the backlash. They're scared about the workload. They don't like the idea of putting themselves out there in this way. They would much prefer to go to an academic conference and present.
And now this comment came from Ruby's Resource. So the comment, and then I see a question that they asked after. So I see a lot of angry comments when Scicommers try to debunk fear-mongering, and have encountered angry responses when trying to start dialogue on a more personal level with people on misinformation. How do you deal with that anger that people respond with? And do you have any tips for detaching from how your content is being received by others?
Yeah, your social media can't be your identity. You have to be able to see it as a medium for communicating, and I don't think it happens overnight. I certainly, and especially if you care about what you do, you care about how you present yourself, you care about the information that you present, it can be really easy to take it personally because you've put so much effort in. I've certainly felt that way, but I have learned that I have to treat it as an output and as as not part of my identity. And so some of those strategies are setting boundaries before you engage around what you will and won't engage with. So not every comment or question deserves a response. You can make a judgment as to whether the comment is in bad faith. I mean, Jen, you've had plenty of this in your experience. I've had personal threats. I mean, we've all kind of gone through that. I've had emails that tell me I'm an unfit parent and a whole range of different things. So you just have to go in, and when you post it, you kind of have to just actually sometimes I think when you schedule the post that can help because you're not pressing the button yourself. It's just going out and you don't know, necessarily when it's there. So yeah, so I'd say detach your social media avatar from your identity if you can.
Which takes practice, speaking from
Yes.
experience. This next question
Yes.
comes from Joyce, which I really like. How can someone effectively backtrack and admit they were wrong after unintentionally spreading misinformation? And also, you did highlight this in your presentation. Why is this important?
Yeah. Look, I think this is so important. This is central to the whole concept of why people will trust you, why we should demonstrate that science moves, that science changes, that science is a system. It's not an absolute. And so being able to highlight, hey, I made a statement about X and I've discovered after conversation and with reading that I was wrong. And here's why I was wrong. And I'm going to now go do more reading and I'm going to do X and Y. So be honest, I think you need to be clear about what you messed up with or what you unintentionally spread. I saw some really good examples. I think that Michelle has highlighted in the last week or so where, somebody has said, oh, well, this and that, and then with comments and challenge, that individual has then said, oh, I was wrong. I'll take it down. Now, I mean, it's just, I think it's harder on the online space because there's a record of everything, but do what you would normally do in real life, which is you would say, hey, Jen, I learned this from you and I was wrong, and I'm really excited to keep learning more.
I have my own personal question. It's something that I struggle with personally is the role that the algorithm has in people seeing my content. And that is, I mean, I try not to be impacted by it, but it is rather demotivating when I have content that I put a lot of time into it that has more nuance and then nobody sees it. Also, obviously, for your message to have impact, you want people to see your message. So how do you contend with or navigate or accept the social media algorithms as a science communicator?
Oh man, the algorithms are such a challenge, and I think we've seen even in the last 5 years, I think since the pandemic, we've seen such a shift. I mean, during the pandemic, people were so interested in science. Now, to some degree, they're really sick of engaging with it because life is happening. But we are operating in an outrage economy now, and the only way to get attention or viral attention is to say something outrageous or to, really be out there. So I mean, personally, I use a number of different mediums and platforms, and I think about what I want to achieve, and then I shape my message based on that. And I do take into account the algorithm, what do I need to do to get this out there a little bit more? How do I do that without, without letting go of my personal values, without letting go of what I know to be myself? I don't have an answer. I think, social media in general has a lot to answer for and on so many levels, not just misinformation and health science, but it's such a challenging space and it's really hard to keep up. And so I would say be strategic and know what you want to achieve and focus on that.
And then the last question that I'll ask, we are over time, just so everyone knows, we're about 10 minutes over time. It's pretty close. This was like pretty jam-packed with information, so hopefully you guys are okay with that. No, the last question that I'll ask is from Ruby's Resource. What's your perspective on deleting comments containing misinformation that others leave on your posts? How do you decide if or when to delete them? This is something that I really struggle with as well, because I understand that when I do something like that, then it just provides opportunities for people to then say, like, I'm silencing people or whatever
Oh,
other things that people are going to say. So I don't delete comments personally, and I generally don't block people either, although I know many people do, and you may be included in that. And maybe this is a false strategy or bad strategy on my part, especially for like mental health. But yeah, what do you think about that?
Yeah, I have a varied approach. I tend not to delete comments. I will tend to unless they're in really bad faith and I can see that they're just spoiling for a fight, because the other aspect is they're going to distract your viewership and then they'll just descend into this big, long sub thread inside your comments. So I tend to, if I think that they're engaging in good faith, then I will respond and say, well, thanks, but you're entitled to your belief. I have a child that's joined me now. That's the time of day that we've got. She's asking for school uniforms. So I do block. I block people that are aggressive towards me, that they're just, they're threatening me or anything like that. So I think you can have a mixed approach, but yeah, you do have to be, I mean, you have to think about your mental health first, but also you do want to not appear to be shutting down people in the conversation, because that's not at all what I want to do.
Yeah. Varied approach. I know like Michelle, who will be presenting next, I think she does block people when people are being very like aggressive comments, like they do impact us. And so I definitely respect anyone who takes that route to just block people so that they can do their job more effectively. Thank you so much, Jess.
Like my philosophy is just that some people do not deserve my time.
Yeah.
They just don't.
Thank you so much, Jess, for agreeing to present, especially for this timing. And yeah, this was a really great contribution to the summit.
Thank you so much for having me, and I look forward to the rest of the presentations.
Our final presentation will be by the propagandist herself, Dr. Michelle Wong, who is a science educator and cosmetic chemist with a PhD in medicinal chemistry. She is behind Lab Muffin Beauty Science, where she explains the science behind beauty products for a general audience. Founded in 2011, Lab Muffin Beauty Science receives 2 million page views per year and has an Instagram following of 415,000 and YouTube audience of 370,000. Disclaimer, these may be old numbers. I think her audience may have grown. Oops. Through her science education work, Michelle has worked with a range of brands on campaigns, including Procter & Gamble and Johnson & Johnson. Her work has been featured in international publications, including New York Times and Chemical and Engineering News. Michelle is the author of the novel The Science of Beauty and also co-founder with me of the social enterprise BeautySciComm. Without further ado, here's Michelle's presentation. So I'm here with Dr. Michelle Wong from Lab Muffin Beauty Science, also the co-founder with me at BeautySciComm, and she's going to be covering the last chat of the day. We're doing it in a fireside chat version on challenges of BeautySciComm. I think that this is probably an interesting topic for industry, especially in industry. I know a lot of companies and associations want to get involved, but to get involved and do the topic justice, I think understanding this topic is fundamental, in my opinion. And so I'll just get right to it with my first question. Can you tell us a little bit about your history of BeautySciComm and the main barriers that you felt along the way?
So, hi everyone. My name is Dr. Michelle Wong. I have a PhD in chemistry, and during my PhD, I started Lab Muffin Beauty Science. So, this was a website that started as a blog, and then in 2014, I expanded into Instagram to promote the blog. In 2017, I also moved on to YouTube. In 2020, I moved on to TikTok. And earlier this year, I also released a book, a real book that you can find in bookstores. How I ended up doing what I'm doing. Back in 2011, when I was doing my PhD, I started looking into what science communicators were talking about. Actually, this was 2010. Before I started my blog, I took a while to start up. I looked at what science communicators were talking about, and it looked like everyone at the time was talking about the Wakefield scandal, like all the fraud with measles. There was lots of extra measles cases. So I started looking at that, and I realized there were lots of people talking about vaccines and talking about these, like, I guess, more traditional science communication topics. And what was missing, though, was no one was talking about beauty. Or back then, there were about 3 people talking about the science behind beauty products. And I saw this as a massive missed opportunity because in the beauty forums where I was, there were exactly the same sorts of logic as anti-vax logic. So things like seeing what ingredients were in a vaccine and then looking up what the risks were and then realizing that, oh no, if I inject this, I'm going to get, like, if it was like aluminium or formaldehyde, I'll have all of these terrible side effects. Therefore, I'm not going to vaccinate my children. That was exactly the same logic as clean beauty. It was even overlapping ingredients. So I realized that it was a massive missed opportunity because if we have girls mostly, although there are also men, of course, in the beauty space, if we've been indoctrinated to be scared of scary sounding long ingredient names, all this time from, like, I don't know, age 12 or so, when we start looking at cosmetic products, all the way until we start having children, we're not going to want to vaccinate our children. Because, I mean, if you're scared to put it on your skin, you're going to be scared to inject it into a newborn baby. So that's kind of where I started. Yeah, one of the biggest barriers, I guess, in BeautySciComm is just that not very many people took it seriously. Back then, I was in a few Scicomm groups, and there were guys telling me, oh, there's no science in cosmetics. Don't be ridiculous. What are you even talking about? Why don't you talk about something more important like space travel or quantum dots, I think, was one of the big trends back then. But yeah, that was always one of the big problems. Things that women like are generally not taken as seriously as things that men like. So I'm sure if I started doing a no race car content, lots of people would be very excited about that. But beauty is kind of seen as frivolous and unimportant. And that's probably one of the biggest challenges. The other big challenges are just, in general, science communication, it's pretty hard to monetize because, again, it's just something that's not taken as seriously, especially within the science community. There's a lot of this sort of mentality of, if you know how to do it, if you know how to go into the lab and make stuff, why don't you do that? Why are you talking about it? And again, this, I think, there is an undercurrent of misogyny there, like things like teaching. It's always just been valued less. I mean, it's so important. A lot of it is, I mean, in the cosmetic industry, we can already see the big impacts where consumers who are misinformed, they are asking for products that are supposedly better in different ways, but they're not actually better. I mean, we've seen this with things like mineral sunscreens where they're not actually safer, they're not actually better for the environment. It really depends on what specific ingredients we're talking about, but overall, they are pretty much very, very comparable to chemical sunscreens. But consumers are asking for them. And then they're also asking for impossible things like having no white cast, which, I mean, maybe it's possible, but it is extremely, extremely difficult to get there. I'm not sure anyone has yet. So yeah, I think those are probably some of the biggest barriers, especially when I first started.
So many barriers to science communication, especially in the cosmetic space. And so something that's really interesting about Michelle is that she does it full time. This is Well, I mean, I think you may still have some gigs on the side, but could do it full time. I'm not sure where you're at right now, actually, if you're still teaching on the side. But you've made this a sustainable career and certainly could do it full time if you're not already. I'm sorry for my ignorance there. I really, really should know. I really should know. But I'll ask my next question. So, how are you able to make it sustainable for yourself? And where do you see sustainability issues with respect to like financial sustainability, even, or just having the want to continue in this for BeautySciCommers?
So first off, in terms of whether I'm full-time, I'm basically full-time. I still teach about 3 hours a week because it's just fantastic practice for Scicomm. I think one of the biggest problems with doing Scicomm online is that you don't get that much feedback. You do get feedback with comments, but the things that people comment aren't necessarily the things that everyone is thinking. And sometimes it's really hard to really check if people truly understand. A lot of the time people will agree, and that's really nice, but sometimes then you'll just see them commenting things that kind of show that you kind of messed up your communication somewhere. And one of the things about teaching is that you do get that immediate feedback, plus you can check how they went in their quiz, and you can sort of see whether or not you succeeded in communicating right. How I managed to make this sustainable is when I first started, I was very much into reviewing products. I still am. I wish I had more time to review products because I personally love using products and I use a lot of products. I like using them and sharing my thoughts on them because I found that so useful when I was looking for products for myself. I think it is a really important part of the beauty community. I do a lot of sponsored posts. It is really tricky to do sponsored posts. I think there is a lot of tricky ethical line treading, I guess. It is really difficult to make sure that you stay true to yourself when you're doing these sponsorships and just being consistent with your principles. And I think that is one of the biggest pitfalls because I think when you're first starting, it is really tempting to just take every sponsorship offer that you get. But the problem is you do need to continue having trust. Like you need to build trust with your audience. Sometimes it's extremely tempting to take offers that aren't true to you, things that you don't truly believe in. And I do see a lot of people having a bit of a struggle with that line. And I get it because it is really difficult when someone is offering you a lot of money in a career where isn't super sustainable. So I think that is a really big part of it. And I think in beauty, we are kind of lucky because we have a sort of mature sponsorship space. Beauty companies have been sponsoring influencers for a long time. It is kind of nice that a lot of them are now funding science communication as part of their, I guess, marketing strategy. In a lot of other sorts of topics with Scicomm, things like food and health, it's a lot harder to get these sorts of sponsorship opportunities. And I think those topics are maybe a bit more politicized. And so when influencers / science communicators do take sponsorships, they get a lot of criticism. And a lot of the time it's completely undeserved. Like what they're saying is exactly what they would be saying if they weren't sponsored. Things like back when the World Health Organization classified aspartame as I can't remember which category of carcinogen, a lot of science communicators were sponsored to talk about it. And the way they talked about it was exactly the same as people who were not sponsored. Like it's just talking about how the classifications work, how something being a probable carcinogen doesn't mean that it is actually a carcinogen at the doses that you take it in. I can't remember if it was probable or possible. Clearly, I do not talk about food science. So I think it is really tricky for a lot of science communicators in that sense. And also for those more politicized topics, I think we are quite lucky when beauty. They get a lot of abuse. I mean, I think we get a bit of abuse as well sometimes when we talk about things that are maybe more ingrained misinformation in the beauty community. So I do remember in 2020, I did a post saying that maybe fragrance isn't terrible for everyone. And I got so much abuse for that. People were telling me to hand back my PhD. I was told that I was an absolute clown and how dare I call myself a scientist. And then these days, I feel like that is a very mainstream opinion. So everyone is welcome for that. So yeah, I think that is one of the big things driving attrition. So as well as the lack of monetary reward, because science communicators, generally we have lots of skills and we can do things that further our career that will bring us monetary reward. that is a bit less punishing as well in terms of the abuse. So yeah, there is just massive attrition in the Scicomm community. And I think on top of that, it's just such a pity when that happens, because not only are you losing someone who has built up all this talent and skills, you're also losing all the connections with the audience and trust with the audience. And a lot of the time, the people we're talking to, they are also the people who then go off and talk to their friends and share that science with their friends as well. So you're losing that massive network. And there's a lot of research showing things like it doesn't matter as much if someone is seen as an expert. It's actually more important that people trust them. And if you have the trust plus the expertise, you have a very convincing person. Of course, some people use that for evil, but most science communicators, I think, use it for good. Yeah, it's just so important having these trusted voices amplifying the science, because on the other hand, I feel like this might be a topic that Jen might ask me about in a bit, because it's one of our favorite topics. Misinformation just spreads so much faster than science. There's so many amplifying factors with misinformation that just makes it really take off. So things like it appeals to biases, it's easier to understand. A lot of the time you can just make stuff up that make people really excited about it. So you can have really actionable advice. People will screenshot it, share it, save it. They'll send it to their friends. If it hooks into fear as well, like I think everyone cares about their friends, hopefully. If you find out that there's a common product that is going to kill you or maim your babies or whatever, then you are probably going to share it with your friends because you care about them, you don't want them to get hurt. On the other hand, if you have nuanced science, things like maybe there are people who are selling you products that aren't trying to kill you, things like that, it's not quite as exciting, it's not quite as attention grabbing, and so it doesn't tend to get shared and go viral.
Okay, so my next question is, well, kind of along those lines, if you want to add to the topic of why misinformation spreads, you've already covered it, I think, pretty sufficiently. But then on the flip side, what are some of the challenges in the BeautySciComm community today that make it harder to do Scicomm? And so like that 15 seconds or less soundbite that will be more successful, for me, as one challenge that I have is like it's very demotivating when like less than 1% of my audience sees my content because I'm not engaging with the algorithm in the way that it wants me to.
Yeah, I think there are a lot of massive challenges for science communication. Like you said, a lot of the time you are trying to engage with the algorithm, and the algorithm, it really prefers things that are catchy, short, snappy, prefers like brand new information that people have never heard before. Things like, I don't know, something else is going to kill you. Lord knows what's tomorrow. And a lot of the time, if it is brand new information, that means it doesn't have a good evidence base. That is just how science works. You need to have replication, and brand new information generally doesn't. On top of that, other big challenges, I guess, apart from, the fact our messages themselves are just harder to sell compared to really simplified things. The fact that the algorithm doesn't really amplify it because the things that do hook into it are different. There's also so much competition for attention as well. So a lot of the time, the platforms, they are trying to kind of get rage bait. So the more emotional you are, the more time you spend on the platform, the more ads you end up seeing in between all the posts you're swiping through, which is how the platforms make money. So they're just really not incentivized to suppress misinformation. There's also a lot of people who are, I guess, especially with topics that are more politicized, which sunscreen is actually becoming one of them now. There's a lot of sort of conspiracy overlap with things like QAnon and vaccines and sunscreen these days. You might have noticed that there are more men talking about sunscreen now, especially like the bro science podcaster type crowd. That means that you have a lot more angry people who are kind of very shouty, a bit more abusive. They're a bit less willing to listen, especially if you do have like a longer video where you explain your nuance. On top of that, I think it is just a thing with men on social media as well. A lot of the time, if you are female, people just don't believe that you understand science. You cannot possibly understand science better than them, and they are someone who just has no science degree. I think both of us have noticed this sort of trend where if you have a man say something, even within the beauty space, which is very, like, I think it's 90% female if you just do a straight up male-female gender split. Even within the beauty community, people just assume that men have an extra relevant qualification than they do and women have one less. So I will get men tagged into my comments, and these are men who don't even have a science degree a lot of the time, to fact check me. And it will be a topic of chemistry, which is the thing I have a PhD in. So that's a massive challenge. It's pretty demotivating. I think there's also a lot of plagiarism. And I think this is just partly because, again, science communication just isn't seen as original work, even though it is. A lot of the time, unless you are doing primary research, like in the lab, a lot of people will just not credit you. It's kind of crappy because a lot of the people who are doing this are people who know better than they might be dermatologists or ex-journalists who have been taught how to cite people. A lot of people don't really see why this is a problem. The reason it's a problem is that A, you aren't seeing the real sources. That means that it's really hard to check what is misinformation and not. You kind of have to take their word for it. The other big problem is, of course, it is demotivating the people who are doing the work, and it's adding to their attrition, which means that you get less of this original, important content. It's sort of like AI, like eventually it's just the system will eat itself and there will be no original content to feed off.
Speaking from experience, plagiarism is very demotivating, and it happens, I think, more than people recognize, or maybe people do recognize. I guess if you do recognize it, it could be worthwhile to maybe just say, hey, have you seen this person's content? This looks familiar. Because that, as somebody who has been plagiarized, when people stand up for me, is something that has the reverse effect of like, oh, people are actually here to support me and see why this could be a problem for me emotionally. Okay, so now we've talked about the challenges. I guess this is kind of still a challenge for Scicomm. It's the specific skill requirements to do Scicomm effectively. Why is first misinformation easier than Scicomm, but also what are the specific skill sets required to do Scicomm effectively?
That's a very good question. So I guess the first thing is, why is it so hard to do Scicomm? A lot of the research is really difficult. Like, you have to work out what's true or not from a scientific perspective. It helps if you have training in that particular area, but a lot of the questions that you tend to come across from consumers, they tend to overlap in multiple areas. So I think one of the skills I've developed over the years is just being really good at sniffing out BS. Just trying to work out who is the right expert for a particular topic. So Jen made a really beautiful chart for BeautySciComm, which shows which people have the most relevant expertise for a particular topic. And I highly recommend that chart. Like, Jen made it so beautiful, works so well. It would be really nice if other people from other areas of science made them too, because we've had so much great feedback about it. On top of that, we need a lot more education to get to the stage where we can discern what content is good or not. That means there's a lot less people who can do that compared to just making up misinformation. Like, people can just get an app on their phone and scan an ingredients list and work out if it's like red, yellow, green. There's all that background that's required. And then on top of that, there's the fact that if you do have that background, generally you have skills that are required for other jobs. And so you could be doing something that is earning you money rather than just getting you very angry comments, which is also a bit annoying. And also these days, every platform wants video. And so you also need to generally have the skill set of editing video. Now, it's not super hard because there are apps that make it a lot easier these days, but it is still a lot more time consuming than just making like text posts or infographics like we used to be able to do and still manage to plug into the algorithm quite well. There's also the presentation skills. So I did a talk a few weeks ago at a Sunscreen conference about one of the skills that I personally have. So the way I approach making my videos is actually kind of like a lawyer. So I did 1 year of law school, and this is like the one thing that I took away, which is working out how to present arguments to be convincing. There's a sort of old school style of Scicomm, which is based on this, I believe it was called the deficit model of science communication. Basically, the idea is if you present people with the facts, they now know the facts and they should be able to make the right decision. But over the years, people have realized that is a lie. We are not perfectly rational people. In general, we need to, even if there is a fact that we all know. So a sunscreen example, I think we all know that not wearing sunscreen increases your risk of cancer. But in reality, and this was reflected in a survey I did recently of some of my followers, In reality, we don't start putting on the sunscreen until we also realize it's not great for our skin's appearance. It's also anti-wrinkle. It also helps even out pigment. So yeah, there's like a lot of things like that where like even knowing that something like skin cancer, melanoma is really, really bad. It's one of the top cancers in white people in a lot of Western countries. Even knowing that, until we know that it improves our appearance and we find one that isn't heavy or greasy, we do not make that action. Science communication is really a bit of an art rather than just straight up unloading facts. So yeah, being able to present something, communicate something clearly in as short a time as possible is a skill, and that requires a lot of practice. So one of the things that Jen and I did with BeautySciComm is we're trying to help upskill science communicators more quickly. This is one of the initiatives that we're still trying to work on a bit more and build up. We want to start teaching science communicators how to edit videos quickly, how to communicate ideas, how to do research, how to also build a more sustainable career out of it. Things like how to preserve your mental health, how to find funding opportunities, things like that.
And I think that leads me really well into my final question to you, Michelle, which is, what are some of the opportunities for BeautySciComm in the cosmetic space? And then I'm going to do a two-prong, so I kind of lied. Do you have any messages that you'd like to give to industry about this topic?
So I think the most important thing with science communication in the beauty space is that it is an important part of the information ecosystem. The information ecosystem is really important for beauty because we are a very much consumer-led industry. A lot of the time, what the consumers want is what we end up giving them. This makes it really difficult if you are a brand or a supplier who is honest and wants to do things led by the evidence, because you just can't really sometimes. A lot of the time, if a consumer says they want some magic powder, you have to somehow make a magic powder, even if you want to make something that will actually help them. So I think that is really important to remember. It's good to note that science communicators do have a really big part in influencing what people are thinking. The number of comments I've had from people saying that because of me, they are no longer scared of using every single product. They're no longer staying up at night because they thought that the benzene in their benzoyl peroxide was going to kill them. I have had so many comments from people, and I'm sure there are more people who just haven't reached out. But that just is really, I guess, affirming of the work that I've been doing. And I think it is just so important. So one of the big problems, of course, is all this attrition that I mentioned. There is so much attrition. I've seen so many amazing science communicators quit, both within cosmetics and in other areas. And it's just because there's just not that much support. So I think if brands do want to support science communicators, there are lots of different ways. I guess the first way is sponsoring science communication opportunities, sponsoring science communicators in your influencer campaigns, for example, including them, having maybe some myth-busting campaigns where you just try to debunk some of the myths that are really frustrating you in the industry, not necessarily things that are directly related to your products, but things that might be tangential even. There are lots of non-monetary ways as well. So for example, having experts is really useful because obviously if I'm covering a topic like, I don't know, sunscreen's environmental impacts, I can only really cover the chemistry. And even that is like, if it's not directly something that I have expertise in, I am like a little bit shaky and just trying to do my best. So a lot of the time, having experts to help me, maybe look over my scripts, maybe even provide a talking head, maybe provide some quotes, some opinions on studies that I'm having trouble interpreting, that is super, super helpful. So just giving information is just really handy. Also, there's been a lot of times where there's been just really useful like white papers or reports or handbooks that different companies have put out, and I just don't find out about them until years later. So if your company puts out something like that, it would be great if you could like email some of the science communicators and maybe like give them a heads up if you have time. Also, just producing material like that is super, super handy. I guess that is something that BeautySciComm can do. So if you reach out to BeautySciComm, we can publish it, and then hopefully the beauty science communicators are following us and they can see that as well, and that can be their alert system.
A massive thank you to Michelle for contributing to this conversation. We're about to go into Q&A. We're going to do it a little bit differently, though, because it's in the middle of the night right now for Michelle and she's sleeping. And so on behalf of BeautySciComm, I'm going to be handling this Q&A. So if you have more questions about BeautySciComm and some of the challenges associated with it, the Q&A starts now. Thank you so much for joining me for this whole presentation or this whole summit so far. Sorry, the mute on my Zoom was distracting me. I know you can hear me either way. I'm going to answer a few of the questions. I'm sorry that Michelle couldn't join us today. A few of the questions that came up, and then we'll close the summit. I do have a few asks for you. So first from Julia, what do you recommend for students looking to enter the field, both in terms of cosmetic science and in Scicomm? So with respect to cosmetic science, I would say there are so many different angles of cosmetic science that you can explore. So first, I would think about that because you can work in as a chemist, for example, you can do, even within as a chemist, there's so many different things that you can do. Maybe you're formulating products, maybe you're developing ingredients. You can also go at it from an environmental science point of view, a toxicological point of view. So think about the niche in cosmetic sciences, and then I would consider looking at roles within companies who are within that niche and the educational requirements that they're looking for. Specific to cosmetic science, there are a lot of cosmetic science, and I'm talking about like formulating here. There's a lot of, and you can expand what you're doing based off of having a cosmetic science, cosmetic formulating type background. There are a lot of bachelors of science and now masters. Many of them are coming online as well to improve how accessible they are to students. So I would look around. The International Federation of Society of Cosmetic Scientists, or is it chemists? IFSCC, it must be chemists. They have a list of education that students can look to on their website if you just Google it. And so they lay out some of the online and offline cosmetic science programs that are available. In terms of Scicomm, I mean, this really depends on where you're going to do Scicomm. Are you going to do it with a company? Then, I mean, same kind of recommendation as before. Look at what the requirements are. I will say when I personally got started, I had a bit of a different journey than Michelle, but something that I did really early on while I was still doing my undergrad is I started a blog. I was just doing science writing at that time. And so I was creating a resume while I was still doing my undergrad, creating content. The social media landscape has changed since then, so maybe you're doing something on social media yourself to kind of create a resume so that you can be appealing as a candidate for a job within a company. There's many layers or iterations, ilks, whatever, of science communication in various industries within companies. Like you saw Jeni Thomas earlier from Procter & Gamble. She's a science communicator as well. Or you can be on social media. I would really think about some of the messages that Jess Stokes-Parish gave in her presentation. I think a lot of those messages will really help in considering how you navigate becoming a science communicator. From Victoria, being a science communicator looks like a completely new job. Has there been anything like this before, or is it really novel? I mean, I think we're talking about it more. I think there were communication opportunities for scientists, but especially when we're in this fast-paced media atmosphere that we are, the opportunities for careers in science communication has really increased. So I know I brought this up in the presentation with Jeni, that when I was in undergrad, which I did my undergrad between 2008 and 2013, no one was at that point really talking about science communication. I know P&G, as one example, started a little bit before that, but they were a bit before it started to become popularized. They were already thinking about that. That's often how it goes with conglomerates. But now there are schools that you can go to. You can do you can do an undergrad, you can do a master's, you can do a graduate certificate. Like Jess Stokes-Parish has a graduate certificate in science communications. So that's something that you can look to. There's many schools that are popping up. This next question is from... Wow, you guys are giving me a lot of questions. Thank you so much. Okay, this next question comes from Donatella. I'll answer your question. Kind of on topic. Why weren't the Australian presentations placed earlier in the event? So the reason is because I built the timeline in a way that I felt made sense to the topics. In retrospect, I probably could have shifted it, but I thought that starting with fact first myths presentations would set the stage to start to unpeel the layers of misinformation. And as we understand what the issue is, then the topic of addressing it with science communication, I think, becomes more relevant. So that's how I just built the topics out in the agenda. And it just so happens that the people that were covering science communication, 2 of them were from Australia. So I'm sorry to Michelle and Jess for making you guys, well, Michelle can join us, but Jess for waking up so early. So I will ask Julia Ruby's question. Michelle mentioned the value of other experts looking over appearing in content. What has your success rate been in reaching out to experts for those kinds of things? Your podcast, these events? Like, what percentage of people say yes, are able to provide their time? So I think this has shifted from when I started to where I am now. But I would say I've had a pretty high success rate from the get-go. I kind of started with a podcast, and in my experience, people like to share their expertise. And in the cosmetic sector, people are very generous with their expertise. So I would reach out to a lot of people on LinkedIn, and I would say my success rate even back then was at least 70%. Very high. And I would say now it's even higher. Most people respond to me. Maybe they can't contribute, but oftentimes if they can't contribute, that is because there's a conflict of interest reason. That happens a lot, or maybe they just don't have the time. But many of them will give me recommendations for other speakers, or I'll just say for my own presentation, I actually had a little bit of imposter syndrome myself, because I'm aware that there's a lot of very smart people who work in the ecotoxicological space. So I actually reached out to some speakers to do the presentation instead of me. They couldn't do the presentation because of conflicts of interest, but they were willing to contribute information if I asked. And I will say I've had really good success for experts. Now, I've had experience online to build a network with experts who are willing to answer my questions. There are a lot of people these days where I can just reach out when I have a question, they'll answer. But that takes time. So I would say historically I've had good success rate, and that's only increased as I've been on social media. So if your success rate reaching out to people is a little low getting started, give it time, continue to try to build your network, and I think you'll see that more and more people will be there to help you to get information out there when they see that you're really putting effort behind it. Okay, I'm going to stop. Instead of just scrolling through the questions, I'm just going to leave it there. Thank you so much. But I do have a couple of thank yous, and I also wanted to leave you with ask. ask. So, well, in Michelle's presentation, we talked about the importance of like funding to science communicators. So I think it's a really good opportunity to thank the sponsors for these e-summits, because the reason why I'm able to do so many e-summits free is because of the sponsors. They've made this possible. They've made this sustainable for me. So I have to thank my sponsors for this event for helping us make this event free and accessible to everyone. So thank you so much to the New York Society of Cosmetic Chemists for being our silver sponsor, to BASF and L'Oreal for being our bronze sponsor, to Applechem plus Labia for being our general sponsor, and to Cosmetics and Toiletries for being our media partner. And they will be helping us give the conversations that we had today a bigger platform through their media platform. I also wanted to thank all the speakers today for agreeing to donate your time and expertise to help make this event possible. I think we can all agree we had phenomenal speakers. So yeah, thank you, thank you, thank you. And the two asks, I've already asked it, but I will ask it again. I'm going to be sending a feedback survey to your email. Expect to receive it by tomorrow at the latest with the replay of the summit, which there will be a replay. Please take the time to fill it out. Those feedback surveys are immensely helpful for me in improving these events for the future, and I've certainly come a long way since Conference 1. If you watch back, you will see that. My second ask is, if you value this initiative, this free conference initiative that we've been working on, and you want to see more truth in beauty, please share. The link that you're watching right now will be, you could rewatch it. So share that link with your audience, share some of the things that you've learned, and you will get a replay link to your email shortly. So stay tuned for that. I think I had one more ask, but now I completely forgot. So I'm just going to leave it there. Thank you so much for joining me for the Truth and Beauty e-Summit. I remember what my final thing that I was going to tell you. My next e-Summit is going to be in either the last weekend of November or first weekend of December, and that's going to be the Future of Beauty e-Summit. So stay tuned. I'm going to be announcing details for that shortly. If you're a company wanting to partner with us, please reach out to me directly. That's what I had to say. Thank you so much for joining us for the Truth and Beauty e-Summit, and I hope you have a great rest of your Sunday.